we've had a change. It being 11:02, the House will now proceed to the consideration of private members' business as listed on today's order paper.
Private members' business. Consideration at second reading of Bill S-209, Pandemic Day Act, in the name of Ms. Fry.
Ms. Fry, seconded by Ms. Duncan, moves that Bill S-209, an act respecting Pandemic Observance Day, an act respecting Pandemic Observance Day, be now read a second time and referred to the Standing Committee on Health. Debate. The Honourable Member for Vancouver Centre.
Thank you very much, Mr. Speaker. It's my honor to move to speak to this bill on Pandemic Observance Day. It was moved in the Senate by Senator Marie-Françoise Mégy and was adopted on the 3rd of May. It was adopted on May the 12th, 2022 in the Senate. Now, I know we all have days of everything, but I wanted to say why this is important and relevant, because we need to bring an end to COVID-19 everywhere on the planet. There have been 6.5 million deaths and even more orphans worldwide and close to 620 million cases. It is still considered to be a pandemic by the World Health Organization, even though all of us do not think we want it to be. The second reason would be to help Canadians to grieve and to commemorate the efforts to get through the pandemic. Over 45,000 Canadians died from COVID, and more than 100 Canadians died from COVID last week in Canada. And the third reason is to reflect on ways to prepare for future pandemics. Why March the 11th? Because March the 11th, 2020, the World Health Organization first characterized the coronavirus, COVID-19 epidemic as a global pandemic. Now, how should people commemorate March the 11th? We're not going to try and prescribe any ways of doing this. I know that the senator who originally moved this bill in the Senate feels that it's up to all Canadians and organizations to choose how and why they observe it, the manner that is most relevant to their community, to their needs, to their province. This bill does not create a paid holiday. Now, I think one of the things we need to know is that it is very relevant to the health and people in Canada. It is a government's top priority. We know that it is still a real pandemic. The World Health Organization has not declared it over. We know that this virus has had an uncanny ability to mutate, to evolve. And right now we have Omicron B4 and B5 that are actually ready in the Northern Hemisphere where we live. And as we shut down, as we close up our houses and we're all internal and inside, the risk of getting another wave is very high. In the summer, we could be outside, and that was helpful to us. But now that we're inside, we need to be still taking care. And you know, the problem here is that we continue, even though we have removed travel requirements, etc. The Public Health Agency of Canada's chief officer is saying to everyone, please, we're asking you to wear a mask. We're asking you to get vaccinated. We're asking you to get boosted. And we now know there's a new bivalent vaccine available for people to get that might be helpful against the B4 and the B5 variant. Our government has brought forward all sorts of treatments that may be available for if one does get COVID. And there have been recent studies that are showing that, in fact, people who had COVID, even though it was mild, that there is something called long COVID, in which these persons, even though they had a mild attack, would be subject down the road and over the years to chronic diseases. They would not be as healthy as they would have been. They could get all kinds of other diseases. So we're just saying, please, for the sake of your own protection, try and follow the kinds of things that the Public Health Agency are asking you to do. Now, the Public Health Agency of Canada continues to ask you to get your vaccinations. And I know there are lots of people who don't want vaccinations. Nobody's forcing you to have a vaccination. But please, the thing about getting a vaccination is it protects you and it protects others around you. And it protects others in your community who may be immunocompromised or who may be having chronic illnesses or who are getting cancer treatments or who have all of those things going on for them because they are very, very susceptible. Now, I think since the beginning of COVID-19, Canada has done very well. And that was the reason we did was because we had vaccines. Many Canadians, more than any other country in the world, Canadians got vaccinated. And that prevented us from having the sort of results and outcomes that we saw in the United States, where there were millions of people who were contracting the disease and who were dying from it. And so we were lucky because we followed rules, we followed protocols. And the thing about public health and the thing about pandemics and epidemics is that they're not going to be gone. They're going to be here with us for a long, long time. The globalization, as we travel, we're now going everywhere in the world. We're visiting any country. We can go for holidays anywhere we want. And when we do that, we are subject to whatever the little epidemic that's going on in that country is. And we bring it back. And that's how pandemics spread. I mean, we know about the great flu pandemic in the 90s and in 1900s. And we know that really killed a lot of people. We know a lot better now. We know what we can do. And I think we need to be reminded always, every year at this time, even if we don't get a massive wave in the fall of this year, even though we have all escaped and everyone's taking their vaccinations and everyone is doing everything, we've got to be reminded that this is not going to be our last pandemic, that there are going to be various pandemics. This one spreads by aerosol. In other words, it spreads in the air. And that's why if you're in a close-up room, one of the things you need to do is open windows, ventilate the room as best as you can, turn on fans to make sure that the air is circulating, because that's the important way to prevent us from breathing in this virus. Every time we speak, I'm speaking right now, Mr. Speaker. I'm at home because I am not particularly well, and I'm doing this virtually. But I want to say that I'm at home and I'm not wearing a mask. But if I were in the house, I would be wearing a mask. I would be speaking because the drops from my mouth as I speak, would be floating in the air and would be able to infect other people in the room who could contract it. And so what we want people to do is remember this pandemic in order to protect ourselves from others. It may be that the next pandemic we face may not be borne by aerosol. It may be contact. It may be sexually transmitted. It may be spread by feces and gastrointestinal products. There are lots of ways that pandemic infect each other. And the thing about public health is that what it does is it tells us the first thing to do is find out what's causing the pandemic. And once we found out what that particular bacteria or virus, in this case of COVID, is, then we're able to decide how it's going to be, how it's spread. And then we take precautions with regard to how we get it from each other. So those precautions will be different depending on whatever the pandemic is. And so what we want to do is remember pandemics. Remember that pandemics are going to be with us. Remember, we're living in a new world now post-COVID, and that we need to be careful. We need to care about the others in our community. We need to care about our loved ones. We need to care about our friends. We need to care about people we don't even know who live nearby, because it is the only way we're going to be able to stop pandemics from spreading and to to nip them in the bud and to end them as soon as we can. This one has stayed for a long time because, as I said earlier on, this virus seems to be able to have the uncanny ability to mutate, to change, to evolve, to take different forms. And so the vaccines that we get would not be as effective as well. Vaccines that we well know have a timeline, a time period after which they are not as potent and strong as protection as they used to be. That's why we're doing boosters, reminding ourselves of what we faced, reminding ourselves, and I talked to you about the millions, hundreds, tens of millions of people around the world who died from this pandemic. This is not where we want to go. We see the outcomes of this pandemic. This pandemic created all kinds of economic restraints. We saw that women who were mostly affected by this pandemic, they were forced to stay home, they were forced to quit their jobs. That individual family economic balance was disrupted. We saw that women who were at the front lines, women were the ones who were the nurses and many of the doctors and many of the people that are working in hospitals and in the community to try and get people. So we saw that this was a pandemic that affected women, but it also affected children, and it also affected seniors who tend to be immunocompromised because they've got chronic illnesses. They've got diabetes, they've got chronic lung disease, they've got chronic heart disease, and these make them more susceptible to getting COVID. Some people take a medication because they may have an autoimmune problem, and those medications alone bring down your immunity, and so you become what is known as an immunocompromised person. And I am the first to say I am an immunocompromised person. I take a medication for an autoimmune disease that I have that actually is one of the top of the list of things that cause you to be immunocompromised. And that is one of the reasons why I am very careful and I follow the protocols. And we need to be reminding ourselves of that. We need to be reminding ourselves that we're living in a different world. And so observing this day is an important thing, not just for our protection. We need to thank all those people in the front lines who are now burnt out. We need to look at what could happen to our hospitals if we have another pandemic, if this becomes another wave for us this fall. We need to know that we cannot cope anymore. Our systems were just too beaten by the COVID-19 over 2 years for us to have that ability to rebound the way we used to. People are burned out. Some people no longer want to be frontline workers. Doctors and nurses no longer want to be working in the system. These are the things that Panic Observance Day will help us to remember, that we must care for our system that has served us so well in the for a long time, that now is under stress and is cracking and is breaking. All of you who live in your communities that don't want to go to a hospital, finding you cannot get into the emergency is overworked, you cannot get a bed. All of these things are changing for us, and we need to be able to respond to them. But this is a reminder of that we need to care about our system itself, the whole way that we have to respond. A lot of people remember what happened when we, as a government, had to suddenly spend billions of dollars to help people who had lost their jobs, to help them to keep a roof over their heads, to help them to pay their rent. We saw the number of people who joined food banks. The community impact on families and people have been horrendous with this pandemic. Observance Day reminds us of this. It reminds us that we need to understand the impact of any pandemic, not just COVID, but of any pandemic. And it also reminds us of what we may need to have to do in the future to react as soon as it happens, to be able to have the resources to put into helping pharmaceuticals to create vaccines, to be able to build our own vaccine ability here in this country so we don't have to go begging other people to give us vaccines, to be able to become self-sufficient, to be able to be resilient. In other words, not to have to do the things we did, not to have to lock down, not to have to stop people from going to work, not to have to do all of those things, because we would have learned from this and built in new ways to cope, new ways to protect ourselves, new ways to prevent what happened with COVID-19. So Pandemic Observance Day is for us to learn from what happened, as for us to learn from the past, to learn lessons, because you know what, if we don't learn lessons, we are doomed to repeat the same mistakes we made sooner. And as Einstein said, that if we keep doing the same things over and over, which is denying that we're living in a pandemic, even though we don't like it, we're going to be doomed to repeating the same mistake, and we're also going to be. It's a definition of insanity to repeat the same thing over and over. This is helping us to be able to be not so powerless as we felt during the pandemic. The Observance Day is going to help us to remember, to build anew, to create resilience in our country and our communities, to create resilience amongst ourselves, to look at how we deal with long-term care systems where seniors were in fact getting COVID, even though everyone was trying very hard to prevent it. The ventilation systems was carrying the COVID throughout that whole building. We're going to have to learn how to be able to build that kind of resilience in the future, so our seniors aren't as vulnerable as they were. So I just wanted to thank you. I hope you're going to support this particular Senate bill, because I think it's a really important thing for us to move forward, to be resilient, and to build a new Canada post-COVID. Thank you very much, Mr. Speaker.
Questions and comments? The Honourable Member Cumberland Coast Chester.
Well, thank you, Madam Speaker. I thank the member from Vancouver Centre for her comments. I find it interesting that there's obviously a lot has happened with respect to pandemic. That's undeniable. I guess my question really resides in the fact is it's very clear, as stated by the President of the Canadian Medical Association, that the medical system is on the brink of collapse. I guess I just don't believe that a private member's bill, remembering that there was a pandemic, is any way, shape, or form going to help the catastrophe that is the medical system. And why not bring forward a bill that would actually address the deficiencies in the system that this government has allowed to happen over the last 7 years?
The Honourable Member for Vancouver Centre. The Honourable Member has to put her mic on.
You did. Okay. I just wanted to say thank the Honourable Member for his question. I understand the logic that he's using behind it. But the thing about remembering is that what we do is when we don't remember, when we don't learn, I mean, this is not just saying, oh, let's remember. It's saying, let us look at what we build to protect ourselves the next time around. One of those things is obviously going to have to be to shore up our healthcare system. One of those things is going to have to be to make sure that we have frontline workers, to make sure we do what we need to do to keep nurses, to recruit nurses, to retain nurses, to look at how we keep physicians. I mean, in British Columbia alone, we are now looking at helping family physicians to be able to go back and practice family medicine. We're looking at incentives. Those are some of the things we do, because as I said in my speech, that I think one we don't do is just sit there and say, oh, I remember. Of course, that would be a ludicrous thing to do. But by remembering, we find out what we did wrong. We look at what the outcomes have been, and we try to prevent those things from happening again by creating new systems, by helping to build a new resilience to everything. And that would mean looking.
I do have to allow for other questions. There's only 5 minutes of questions and comments. The
Honourable Member for Avignon-Lamatane-Mitipidia. Thank you, Madam Speaker. I don't necessarily have a question for my colleague, but I thank her for her speech. Perhaps I have a comment beyond seeing what was done and not done, and to have an overview of this day or what was done during the pandemic. I think this day should be dedicated to the families of victims of COVID. It's over 45,000 people in Quebec. I think we need to dedicate it to health care staff, those who are on the front lines, essential service workers. I watched 24/7, a series on Télé-Québec. I read Dr. Marquis' book. There are people who are at the heart of this pandemic, and we need to dedicate this day to them. I think there's unanimity within the House on that, and I'm pleased to see that. Thank you.
Honourable Member for Vancouver Centre.
Thank you very much to the honourable member. I agree. I think we need to remember all those people who passed, all of those people who are now chronically ill, all of those people who were overworked and overwrought and burned out right now that we're seeing in the system. This is about remembering all of that, but it's also about remembering what we must do, what we didn't do, learning lessons. And so I want to thank the honourable member for her support.
Time for a brief question. Questions et commentaires. The honourable member for the honourable parliamentary secretary of the government House Leader.
Thank you, Madam Speaker. I'm wondering if the member could just provide her thoughts in regards to the importance of reflection, whether it's our healthcare professionals, to children in our schools, having an opportunity to focus on the issues related to pandemics, and just to share her thoughts on that.
Answer from the member for Vancouver Centre.
Well, I think it's at the heart of what I do as a physician, and what all physicians and nurses and healthcare professionals know is that we got to learn from our mistakes. We've got to reflect on what went on and what we could do again. I mean, the word post-mortem is a much bandied about word, but it means looking back and see what you did. Was it good? Could you have done better? What would you have done differently if you have to do it again? And that's what that reflection on this observance day is all about. It's about waiting so that we don't have to get another one before we think about where we go and how we deal with it and how we reflect on the mistakes we made and what we can do better.
Resuming debate, the honourable member for Cumberland Colchester.
Well, thank you, Madam Speaker. Thank you. You know, certainly it's an honor to rise, as always, in the House of Commons and to address legislation before the House. I think one of the important things is to understand that, you know, I don't think we need a pandemic observation day or observance day or any other day to remember the pandemic. My goodness gracious, how could you possibly forget the pandemic? Very clearly, we all can remember 1918, there was a pandemic. I don't think there's anybody who forgets it. There was a pandemic in 1918. I very clearly remember what happened during the pandemic. You know, my wife and I were very fortunate enough to be away on vacation. While there, it became very clear there was multiple news reports coming in around the world that this virus was approaching Canada, and as we now know, it was probably here. Friday the 13th, March the 13th, 2020 came around, and you know, I can remember having spoken to folks in my office and saying, we need to get ready for this pandemic. You know, we don't know what's coming, and you know, unfortunately, like many of us, some people didn't really believe that it was coming. The 15th of March came along, Madam Speaker. That was a Sunday, and you know what? I can remember very clearly going to our local hospital and then really understanding that there were two people planning for the pandemic, two people. You know, as I went into that room, they said, hey, Doc, would you like to join us? And I did. That led, of course, to us setting up the northern Nova Scotia response to COVID-19, which we ran successfully for a very, very long time, sadly. Went on and on and on. You know what? One of the interesting things, Madam Speaker, that I'll always remember is the sense that even though at that time, and we really didn't know anything, of course, about COVID-19 and how this was going to unfold, even then, people joined together as a team to staff that unit, to look after patients, as we said, we call it the northern zone of Nova Scotia, to look after those patients who were going to be sick with COVID-19. We thought that there was a better than average chance at that time that many of us would die from COVID-19, and thankfully, of course, none of us did in that unit. We were very, very happy to have come through the pandemic without those burdens upon us. Sadly, as a member from Vancouver Centre readily points out, there are many Canadians who did not fare as well as those of us who did. However, I think it also important, Madam Speaker, to underline the fact that many, many people, the trials and tribulations that they had to suffer during the pandemic are things that they will never forget, and perhaps that they might even want to forget. And us continuing to have a pandemic observance day does not seem to make any sense to me. I do not believe that it's a place to look at the systemic failures of our healthcare system, which, as I said just briefly in my question, is on the brink of a catastrophic failure when we have, in Nova Scotia alone, 100,000 people without access to primary care. When I look at those things, that's a system failure. I don't think that we need a pandemic observance day to remind those 100,000 Nova Scotians and 1 million people in Ontario who do not have access to a family physician or primary care that they need to have a day to remind them how terrible the system is. What we need very clearly is a government to get acting on these things. We need action. We need somebody to do something. We need to stop talking about it and blathering on about all of these things the Prime Minister has said. The 7,500 doctors, nurses, and nurse practitioners, where are they? And what are they going to do in a system that is short at least 60 to 70,000 nurses? 7,500. And we've seen none of them, Madam Speaker, and that makes me sad. That means we have, as I said previously, we have a government of inaction. We need to stop talking about things, and we actually need to get things done. And if we don't begin to do things, having another observation day is only going to enrage those Canadians, in my mind, Madam Speaker, who are unable to access appropriate care in this country, of which we believe medical care is part of those things that we hold near and dear to our hearts. That is a very, very important thing. And I don't think, Madam Speaker, that I would say that simply because I am a family physician. I would say that because I am a Canadian. And those are things that are important to us. So when we look at those things, do we need a day to allow us to remember the system is crumbling in front of us? No, you only need to look no further. In many cases, sadly, not outside your own family, and certainly not within 2 degrees of separation of knowing somebody who suffers without being able to access primary care. To further build upon that, Madam Speaker, I don't think we needed a pandemic observance day to allow those folks who could not be with loved ones during their final days. We don't need to remind them that they couldn't be with their loved ones. They're not going to forget that. We don't need to remind them that they couldn't have funerals. We don't need to remind them that people couldn't celebrate birthdays and anniversaries. I remember my own son's graduation was an event that you could drive by in your car and get out and having from distance received your graduation certificate. Those things, we don't need a day to remember them. Those are things that we will not forget. We don't need to have a day to remind us that we couldn't socialize with people in the manner in which we wanted to, that we couldn't travel and experience the great things that the rest of the world has to offer, and to have those learning experiences that we are able to have when we do travel, that makes us better and richer people from a personal and social and spiritual point of view. We don't need a day to remind us that we were unable to do those things. We are now learning to live with COVID-19, and I think there's a lot of lessons to be learned. We need to look at the science behind it. We need to look at the science behind this new group of vaccines, the mRNA vaccines, to understand what is the science telling us. And if we don't do that, the member from Vancouver Centre talked about repeating mistakes. If we don't have the courage to look at those vaccines and the outcomes, then we are doomed to make mistakes. And I think that's going to be an important thing going forward. Do we need a day to do that? No, we need to be working on that now. We need to do it day after day after day. We don't need one day to remind us to do that. That doesn't make any sense. We also, Madam Speaker, and I say this with a heavy heart, we do not need a day to remind us that our Prime Minister lashed out at many Canadians and called them racist and misogynist. We do not need a day to be reminded of those sad days. We do not need those. We don't need another reminder of the division in Canada that this Liberal government has created, Madam Speaker. We do not need that. So as we begin to look upon this, I really believe that people will not forget the pandemic which began in 2020 and as yet is still not over and not declared over by the WHO. We know that perhaps the pandemic emergency will soon end. But what we do need, what do we need? We need members of this House to have the courage to come forward with the appropriate personal private members' bills that will give us hope for the future, that will bring us forward, that will look at systemic failures and the failures of what happened in managing the pandemic, that will look at things that are near and dear to all of our hearts, like the healthcare system, and for us to be allowed to say, how are we going to change things? How are we going to make it better? How are we going to repair this? That's what we need to be thinking of. Do we need to have a day to do that? Madam Speaker, we do not need a day. We need multiple days. We need years. We need people to dedicate themselves to doing that, and I believe there are, Madam Speaker. And once again, Madam Speaker, this government of inaction needs to move forward to action and actually do something about it, as opposed to having another day to talk more about it. I thank you, Madam Speaker.
Reprise de débat.
Resuming debate, the Honourable Member for Berthier-Masquinongé. Thank you very much, Madam Speaker. It's a pleasure for me to speak on this today. There are different ways of looking at this. Some people may say we don't need a day, but this day already exists. Last year, on March 11th, we had a rather somber commemoration. 2 years before that, we also commemorated it significantly. I'd like to be able to hear myself speak, Madam Speaker.
There's individuals having conversations in the House here, and it's sometimes hard for members to be able to hear themselves speak as well. And so I would just ask members, if they're having conversations, to please take them out of respect for those who are making their speeches here in the House.
The Honourable Member for Berthier-Masquinongé. Thank you, Madam Speaker. I thank my colleagues for their collaboration. So what I was saying was that this day already exists. It was declared on March 31st, 2021. March 11th was declared to be a day of remembrance. In 2020, as I said earlier, we also had that. So this would make it official and permanent. This wouldn't be a day off or anything. This would be a day that would be on the calendar and that would regularly remind us of what we need to do. That we need to remember what happened. We need to take into account the mistakes that were made. And everyone is aware that the context was exceptional, that it was extremely difficult to find the way forward in all of this. But we still need to learn lessons from what happened. So that's what it would be for. It's a symbolic day. I think I would have presumed that the House would have been unanimous on this today. It's not the impression I have at the moment, perhaps. We'll see. We'll see when it comes to the vote. What's important to do on this occasion is that we must repeat our sincere condolences and say that we understand that we stand in solidarity with everyone who's been affected. We have to remember those who have passed away, and we need to remember the families. Families who weren't able to visit those who were passing on to the next world. That's extremely difficult, and we need to ensure that doesn't happen again. We must remember this on a daily basis. And on behalf of the Bloc Québécois, I think I could even say this on behalf of the House, I think there's no one here in this House who doesn't have sympathy for those who are affected. I would also take this opportunity, Madam Speaker, to thank first frontline workers, those who are on the front. We were privileged in that we were able to telework. When we came here, it was done in small groups. You'll remember the measures we took to ensure distancing. We pretty much always felt safe. That wasn't the case for everyone. I'm thinking of healthcare workers. A healthcare worker, the previous speaker, who's a doctor, spoke about doctors, but there's also nurses, healthcare aides, and perhaps we could speak especially of them, and people who volunteered to help in nursing homes. It's remarkable. I know people who did this who weren't working in their traditional job, in their usual job, and they volunteered to risk their life on a daily basis to help others. That deserves remembrance and respect. And I'm also thinking of guardian angels, people who requested asylum, who went into nursing homes as healthcare aides to try to help save people, to take care of others. We have a moral commitment to these people. And when we vote on a day, an observance day like this, I don't think it's the time to talk about criticisms. But not all of those cases have been resolved yet, and it's been going on for quite some time. So I think it's important that we conclude that. And I would call on the government, those who are responsible for this, to accelerate this. When it's immigration, it's hard to accelerate things, but I think it's possible. And these people have already been identified. When I talk about frontline workers, I've talked about healthcare aides, but there are also maintenance workers, janitors, those who work in parking lots, grocery clerks, minimum wage, to risk catching COVID on a daily basis. They had bonuses after a bit, but we need to think of these people who dedicated themselves every day. Dedication comes in different forms. I can think of delivery drivers, truck drivers, teachers who at the beginning were teleworking, weren't able to go in, but then when they did go in, they had to face extremely difficult conditions. Hairdressers, cutting hair with your face covered. I have a hairdresser who told me she thought about becoming a truck driver because hairdressing with pandemic measures isn't easy. That 3D perspective and that fog, it made it more difficult. So all of those people.
Police officers, people who took care of our roads. We need to think of them. Young people. Some people say, oh, it was unfortunate. I had a parliamentary assistant who, unfortunately, had to do their BA almost entirely remotely. We had a discussion last week. I won't go into all the details, but we were comparing our university experiences. We certainly didn't go through the same thing, and I find that a little sad. Of course, they developed other strengths, and that's what we have to do with adversity. We need to essentially do some judo and turn that weakness into a strength, but those individuals suffered as well. So there are people who went to university and people who also went to high school, people who missed out on things that seem entirely ordinary to us, like prom, that they were not able to experience. So we need to keep that in mind. I can't name everybody, and I won't have the pretension or the intention of thanking everyone who contributed during the pandemic. Of course, the pandemic's not over. We have to keep that in mind. We need to remember that. And I would like to gently remind everyone that for everyone who should get vaccinated should really freaking get it done. I'm very pleased to now be, by bivalent. I guess I'm better able to protect others around me than I used to be. But I encourage everybody to get it done. I encourage everyone to go if they can. Now, I would also like to thank the scientific community. It wasn't easy. We were before the unknown, and we also had to inform the public as we were discovering new scientific facts. Not creating panic was a challenge, but we still had to regularly inform people and remind them of what needed to be observed at the time. That was extremely difficult. I thank everyone who participated in that effort. I think this day is extremely important. I heard earlier we don't need a day. We should remember it all year long. But when we have a moment on the calendar, it does force us to remember. It does provoke some thought. So we're in favor of this day. And we certainly don't want to recommit the errors of the past. I'm thinking of how we fund healthcare. I'm thinking of avoiding doubling up specific structures. We need to really think about prevention for the future. Our system needs to be effective. It needs to treat our staff well. It needs to ensure that people who work well or are thoroughly grounded in this situation can handle crises in the future.
Manukaski?
Thank you, Madam Speaker. Madam Speaker, I'm honored to rise today to debate Bill S-209, an act respecting Pandemic Observance Day, proposed by the Honourable Member from Vancouver Centre, that would designate March 11th of each year as Pandemic Observance Day to give Canadians an opportunity to commemorate the efforts to get through the pandemic, to remember its effects, and to reflect on ways to prepare for any future pandemics. First of all, I think it's important that we first recognize the incredible toll that COVID has taken on our country, and indeed our world. In Canada, already more than 1 in 10 Canadians have had some form of COVID. Almost 50,000 Canadians have died as a result of COVID-19. Around the world, the numbers are horrific. 625 million people infected, over 6.5 million deaths. People's lives, we know, have been shaped irreparably in some cases as a result of COVID. Lives have been put on pause. Finances crumbled. Weddings, funerals, new births, last moments missed. Special moments, milestones with loved ones missed as well. There's not one family in our country that hasn't been touched by the tragedy of COVID-19, I would argue. Yet what we are also here to talk about today is the clear fact that much more could have been done, both within our borders and abroad. If we look back to the last couple of years, we need to talk about the support that Canadians so desperately needed. We can't forget, the Liberals only wanted to support Canadians with a one-time payment in the face of not just a public health emergency, but a financial crisis for many Canadians. It was the NDP that successfully fought for regular CERB payments that helped lift many people up during this time of crisis. Now, unfortunately, this government is targeting the benefits of people who relied on CERB throughout the pandemic, including many in our region. All the while, wealthy CEOs who used tax avoidance schemes and avoided paying taxes and got support during the pandemic are getting a free pass. We need to see amnesty for those that needed CERB and applied for it. Unfortunately, this is in character for this government. They cut the guaranteed income supplement for the most vulnerable seniors, leaving low-income Canadians in desperate situations until New Democrats forced them to reverse the cuts. Recently, we learned that they cut the Canada Child Benefit for families struggling to feed their children. It's clear whose side the Liberals are on. Rich companies that use the wage subsidy, even though they were making profits and gave millions in dividends to their shareholders, aren't being asked to pay the money back that they got. But this government isn't hesitating to make hardworking Canadians who are struggling to make ends meet to pay back the CERB that they desperately needed throughout the pandemic. The reality is that the COVID-19 crisis held up a mirror to the country we've built and the cracks at its foundations. And no one need to look further than the reality of First Nations during the COVID-19 pandemic. First Nations in our region, like the Island Lake First Nations that don't have regular hospital access, communities like Ocean, Shamattawa, God's River, and others, had such bad COVID outbreaks that the military needed to come in and help. A lack of PPE, testing kits, and even nurses and doctors left communities fending for themselves, scrambling, and without support. And then we had communities like Pugetawagan, where the government decided that the best way to help community members isolate was to give them tents in the middle of winters that nobody from that community asked for. It wasn't quite the heartlessness of the Harper government sending body bags during the SARS pandemic and H1N1, but it was awfully close. The worst part is that no one in the community even asked for this. We looked into it, and it turned out that a board member from the company that made the tents also sat on the COVID-19 Supply Council, designed to advise the government on procurement during the pandemic. When this came to light, that person was forced to step down. COVID showed us how vulnerable so many of our institutions are and how ill-prepared we were. A COVID outbreak at a Cargill meat processing plant highlighted how unserious our country is about workers' safety. Over 1,000 cases were linked. People died because they worked in unsafe workplaces. Throughout the pandemic, we also saw how ill-suited our institutions were to ensure the most vulnerable in their society were protected. Our healthcare system, where this Prime Minister and this government never replaced the cuts to transfer payments brought in by the previous Conservative government, was stretched beyond its absolute limit. Nurses complained about the lack of PPE while they put their lives on the line to keep people safe, to save what lives they could. And our behavior as a country was no better abroad. It was this Liberal government that blocked countries like Bolivia from accessing a Canadian-produced generic vaccine, preferring to put the economic profits of giant pharmaceutical companies ahead of the lives of people around the world. Don't forget, Bolivia reached an agreement with a Canada-based drug manufacturer, BioLease, to acquire desperately needed vaccines for a country that at the time had only been able to vaccinate 5% of its population. Our government, despite publicly stating they were doing everything in their power to get the vaccine to the global south, worked to block Bolivia's efforts at the WTO. Canada has put lives at risk. It is abundantly clear that much more could have been done and could still be done both at home and abroad. This government did the bare minimum, and it was up to Canadians to pick up the pieces. People checking in on their neighbors when they were sick, helping them out with things like groceries and basic necessities. And when we talk about the cracks in our foundations, we also saw the way in which the loss of our vaccine production capacity rendered us at risk. The inability to produce the PPE that we needed here at home put us at risk. Publicly owning the capacity that we need to be safe in a pandemic is something that we as Canadians need to act on. We cannot be vulnerable the way we were during this pandemic. I also want to highlight that many have pointed to the lessons we should be learning out of this pandemic. I appreciate the work of Nora Loretto, who wrote a book called Spin Doctors: How Politicians and the Media Misdiagnose the COVID-19 Pandemic, who talked about how the media, in many cases, the mainstream media, overlooked the reality that was afoot in our country, and how politicians and public health officials were mostly given the benefit of the doubt, and that what they said was true and that they acted in good faith, when in many cases we know that that was not necessarily the case. Her book documents each month of the first year of the pandemic and examines the issues that emerged from the disproportionate impact on racialized workers, to the people that died in residential care, to policing. Her book demonstrates how politicians and uncritical media shaped the popular understanding of the issues. And it very much argues that we desperately need to move beyond the idea that individual actions will keep us safe and move towards collective action. backed up by the political will to ultimately put people's lives ahead of profit, something that we didn't see happen the way it should have throughout this pandemic. In wrapping up, I want to share my thoughts with the many people across the country, including here in our north, who lost loved ones to COVID-19. Our thoughts are with you. But we also know that thoughts aren't enough. What we need is clear action so that lives that were not lost in vain, so that we are there to protect workers, people on the margins, Indigenous communities, people living in long-term care. We need to protect them going forward. And that requires political will, that requires public investment, that requires supporting our healthcare system and our healthcare professionals. It requires public ownership when it comes to the production of vaccines, PPE, and the materials we need to keep our communities safe. It requires ending the housing crisis in First Nations, building hospitals where they are needed for Indigenous communities. It requires lifting people up in concrete, tangible ways, and ultimately making it clear that lives, whether they are in Canada or around the world, are much more important than profit. We need to act now. Thank you.
Resuming debate, the honourable member for Etobicoke North.
Madam Speaker, I rise today to speak on Bill S209, which seeks to designate March 11th as Pandemic Observance Day, to commemorate the efforts Canadians have made and continue to make to get through the COVID-19 pandemic, and which was introduced by Senator Marie-Françoise Mégy. I want to take this opportunity to first thank the Senator for developing this bill, and to next thank my colleague for Vancouver Centre for presenting this bill in the House of Commons. I would also like to thank her for her decades of service as a former minister, member of Parliament, and as a physician, and someone who knows firsthand how important it is to act quickly to save lives. Madam Speaker, a National Day of Observance matters to commemorate the people who lost their lives during the pandemic and the significant impacts we have all felt because of COVID-19. All of our lives and the lives of everyone around the world were forever changed by the emergence of COVID-19. Madam Speaker, today we mourn the tragic loss of more than 45,000 Canadians, grandparents, parents, heroes, siblings, friends, and loved ones, and they matter to so many more. Each of these losses cascaded through families and communities, leaving many more thousands bereaved. Because of restrictions around traditional mourning customs and rituals, heart-wrenchingly, many families were unable to even say goodbye. We did not get to be by our family members' side, to hold their hands, to comfort them in their last hours. But instead, some of us said goodbye over Zoom with little or no funeral afterwards. And today, COVID-19 has infected over 4 million Canadians. Madam Speaker, the pandemic has had an immeasurable impact on how we work, learn, connect with family and friends, and live our daily lives. And all Canadians have experienced sacrifice and loss over the past years. Seniors were isolated from the ones they love. Our children miss birthday parties, friends, and sports. And for far too many, the virus meant the loss of their job or the closure of their business. Our healthcare workers have been heroic for almost 3 years now, initially putting the interests of their neighbors, communities, and country ahead of their own. While many of us could work from home, healthcare and other essential workers could not. Like farmers who ensured we had food on the table, truck drivers who made sure food got from the farm to grocery stores, grocery store workers who kept the shelves stocked, later teachers and childcare workers who comforted our children. The women and men in uniform who helped care for our most vulnerable. They worked long hours. so we could get the services and care we needed. They were the everyday heroes who we cheered on and hung signs in our windows for. We witnessed Canadians at our very best. We came together, remained strong, lent a hand to neighbors, organizations, and whenever possible. Madam Speaker, it's important that we commemorate the pandemic, to remember how our world changed forever and how once again human resilience is succeeding. This bill would create the opportunity to come together and honor each year the memory of those we lost, to recognize everyone who has been impacted by COVID-19 and pay tribute to all those who continue to work hard and make incredible sacrifices in our fight against the virus, because the pandemic is not over. We need to be prepared to use the tools we have. The flu vaccine and COVID-19 vaccine help prevent people getting seriously ill, prevent further delays in scheduled hospital care, and help support worn-out healthcare workers. Internationally, we need to close the booster gap. In low-income countries, only 35% of healthcare workers and 31% of older populations are fully vaccinated and boosted. And we must be prepared for next time, because there will be a next time. History is clear on this. More than 6 distinct influenza pandemics and epidemics have struck in just over a century. Ebola viruses have struck over 25 times in the past 5 decades, and we have seen the impacts of SARS, MERS, and COVID-19. Internationally, governments and private funders poured billions of dollars into building preparedness. Plans were tested and evaluated. Still, COVID-19 demonstrated that the world was not sufficiently prepared. Madam Speaker, this is the time we should all be asking, why did this break down and what must change? We should also be studying the lessons learned to date from COVID-19, our state of preparedness prior to the pandemic, the impacts of COVID-19 on Canadians, business, industry, the economy, and public services, the disproportionate impact of COVID-19 on some communities, and what actions and investments are being made to be better prepared for the next pandemic. We should also pay attention to antimicrobial resistance, a global crisis that threatens a century of progress in health and achievement of the Sustainable Development Goals. And because the drivers of antimicrobial resistance lie in humans, animals, plants, food, and the environment, a sustained One Health response is essential. There is no time to wait. And we should learn what we always learn during a pandemic, namely that science, research, and public health matter, and not just when we are in crisis. They are fundamental building blocks of our country that require attention, nurture, and support, and they cannot be neglected. We need enhanced competitive investment in science and research to keep the best and brightest in Canada. Madam Speaker, we cannot afford to forget, because we have forgotten before. In 1918-19, influenza swept the world and killed more than 50 million people, more than the number that died of all the fighting of the First World War. And many victims were healthy young people in the prime of life. There was a shortage of medical personnel. There were no effective treatments. There were no flu vaccines, antiviral drugs, antibiotics, or mechanical ventilation. To slow the spread of the disease, governments implemented quarantine, placarded homes, closed public places, and regulated and enforced mask wearing. Individual citizens closed their doors to the outside world, communicated via letter. In Canada, between 30,000 and 50,000 people died. In Montreal, the demand for transporting the dead was so great that trolley cars had to be converted to hearses, which could carry 10 coffins at a time. Whole families disintegrated and young adults left behind children who were forced into orphanages. Losses to businesses were staggering. Merchants lost their livelihoods because staff were absent with flu and customers were too ill to shop. Restaurants and theaters all lost heavily. Madam Speaker, it was one of history's deadliest pandemics. People did not want to talk about their experience during the pandemic. And because they were reluctant to talk or write about the pandemic, future generations were not always aware of it. Historian Alfred Cosby called it the forgotten pandemic. People want to forget difficult times, move on with their lives, and think about a happier future. Madam Speaker, this time is different. There are innumerable memorial projects and memorials underway around the globe. Here in Canada, there is an obituary project to pay tribute to everyone who has died of COVID-19 and every Canadian who has died of the disease abroad. It is called They Were Loved. And Madam Speaker, that's why this bill matters, because they were loved. Thank you.
La période prévue pour l'étude des...
The period for private members' business is now expired, and it is at the bottom of the order of priority on the orders of the day.
du jour.
Orders of the day, ordre du jour, government business. Consideration of government business motion number 20, proceedings on Bill C-31, an act respecting cost of living relief measures related to dental care and rental housing.
Monsieur Duclos,
Mr. Duclos,
appuyé par Monsieur Guilbeault, propose que, nonobstant
that notwithstanding any standing order, special order, or usual practice of the House, Bill C-31, an act respecting cost of living relief measures related to dental care and rental housing, be disposed of as follows.
A, the bill be ordered for consideration at the second reading stage immediately after the adoption of this order. B, when the House resumes debate at the second reading stage of the bill. And I, the ordinary hour of daily adjournment shall be midnight. Double I, at 11:45 p.m. or when no member rises to speak, whichever is earlier, all questions necessary to dispose of the second reading stage of the bill shall be put forthwith without further debate or amendment, provided that if a recorded division is requested, it shall be deferred to the expiry of the time provided for oral questions on the next sitting day, and the House shall thereafter adjourn to the next sitting day. Triple E, pendant
Triple I, during consideration of the bill at the said stage, the House shall not adjourn except pursuant to a motion moved by a Minister of the Crown. C, if the bill is adopted at the second reading stage and referred to the Standing Committee on Health during its consideration of the bill. I, the committee shall have the first priority for the use of House resources for committee meetings. Double I, amendments to the bill, including from independent members, shall be submitted to the clerk of the committee by 6 p.m. on Thursday, October 20th, 2022, and distributed to the committee members in both official languages by noon on Friday, October 21st, 2022.
Amendments filed by independent members pursuant to subparagraph C-II shall be deemed to have been proposed during the clause-by-clause consideration of the bill. And 4, the committee shall proceed to clause-by-clause consideration of the bill no earlier than 7 p.m. on Monday, October 24th, 2022. And if the committee has not completed its clause-by-clause consideration of the bill by 11:59 p.m. that day, all remaining amendments submitted to the committee shall be deemed moved, and the chair shall put the question forthwith and successively without further debate on all remaining clauses and amendments submitted to the committee, as well as each and every question necessary to dispose of the clause-by-clause consideration of the bill. Number 5.
Number 5, a member of the committee may report the bill to the House by depositing it with the clerk of the House, who shall notify the House leaders of the recognized parties and independent members, and the report shall be deemed to have been duly presented to the House. D. The bill be ordered for consideration at report stage on Thursday, October 27, 2022, provided that I, no later than 6:15 p.m. that day if the House has not previously disposed of the report stage. Any proceedings before the House shall be interrupted, if required for the purpose of this order, and, in turn, every question necessary for the disposal of the report stage of the bill shall be put forthwith and successively, without further debate or amendment.
Number two, if a recorded division is requested after 2 p.m., it shall not be deferred except pursuant to Standing Order 76.1 sub 8. And number three, the bill be ordered for consideration at the third reading stage immediately after the concurrence of the bill at report stage. And E, when the bill is taken up at the third reading stage pursuant to subparagraph D, 3 of this order, no later than 11:45 p.m. or when no member rises to speak, whichever is earlier. Any proceedings before the House shall be interrupted if required for the purpose of this order, and in turn, every question necessary for the disposal of the said stage of the bill shall be put forthwith and successively without further debate or amendment, and if a record division is requested, it shall not be deferred. And F, le jeudi le
On Thursday, October 27, 2022, 1. Private member's business shall not be taken up. 2. The House shall not adjourn until the proceedings on the bill have been completed, except pursuant to a motion proposed by a Minister of the Crown, provided that once proceedings on the bill have been completed, the House may then proceed to consider other business, or if it has already passed the ordinary hour of daily adjournment, the House shall adjourn to the next sitting day. Debate.
Débat. L'honorable ministre.
The Honourable Minister of Health.
I rise today to ask my colleagues to join me in supporting a motion, the motion you just read, to schedule the time for passage of Bill C-31, an act respecting cost of living relief measures related to dental care and rental housing. While I am, of course, as we are all, committed to ensuring that this legislation is given due consideration, undue delay will mean that eligible families will have to wait until next year before receiving the Canada Dental benefit. The target implementation date for the benefit is December 1st, 2022. Delivering a nationwide benefit is not a small endeavor, and many elements cannot be put in place until this legislation has received parliamentary approval and royal assent. Delays would mean leaving parents with further uncertainty about when they will get the financial support that they need and deserve to seek out dental services for their children. I think, and we think, that we can all agree that children should not have to wait to access the care they need. Permettez-moi de rappeler à mes collègues.
Let me remind my colleagues why the speedy passage of Bill C-31 is necessary. Our government introduced this important piece of legislation to address the urgent need families have to deal with the rising cost of living. Across the country, parents are struggling to pay for their children's dental care. Inflation is a global phenomenon that affects all Canadians, but its effects are not felt equally by all households. That is why our government has acted quickly to improve the affordability of dental services for those who need them most, while taking the time to design a longer-term national dental program. Oral health is essential to overall health. When left untreated, dental problems become serious problems that are more costly, more painful, and more difficult to deal with. Industry data shows that children's dental problems cause an estimated 2 million days of school absenteeism each year. When children are taken out of school to attend to urgent oral health needs, parents have to take time off work to accompany them. In fact, we estimate that oral diseases account for about $1 billion in lost productivity to our economy each year. Some members of this House, Madam Speaker, have questioned the real importance of children's oral health. Poor oral health places a heavy burden on our children and our healthcare system and can lead to problems with sleep, nutrition, growth, and social development.
Care is out of financial reach. Oral health troubles can become exacerbated, and hospitals and other urgent care settings may be required to pick up the slack. Emergency surgeries and crowded hospital emergency departments become the fallback. Dental surgery under anesthesia accounts for 1/3 of all day surgeries performed at most pediatric hospitals for children between the ages of 1 and 5. Low-income Canadians are the ones hardest hit by the impacts of poor oral health. Children in low-income families are 2.5 times more likely to need surgery for oral health concerns than children from wealthier families. We should all strive to avoid the need for such drastic interventions whenever possible. General anesthesia for dental procedures can result in psychological and emotional distress for both children and their families, things that could be more limited and limited to only the most complex cases if access to preventive care was more affordable. This is what the Canada Dental Benefit is aimed at addressing. A simple, upfront payment because parents know what their children need. No red tape, no hassle, just a means for parents to help their children thrive and be healthy. We are collaborating with the Canada Revenue Agency because it has the expertise to successfully deliver such a program. When a person applies for the benefit in My Account, the CRA will verify information in its existing tax and Canada Child Benefit systems, like income, age of children, and the applicant's relationship to that child. Simultaneously, the attestations and verification information that make up part of the application itself will be incorporated into CRA's standard verification processes to ensure the integrity of the program. This is a tested, responsible approach to delivering much-needed relief to Canadian families. But we have more to do. The Canada Dental Benefit is a first step toward addressing overall oral health needs in this country, starting with those who have the most to lose by delays. There is a pressing need now, with the potential for lifelong impacts of some of the most vulnerable, our children. This legislation puts kids first in line so that they can reap the benefits of early intervention for a lifetime. At the same time, our government continues to work hard on the long-term dental care program that will support Canadians for decades to come. We have been debating, Madam Speaker, important measures through C31, such as supporting Canadians with rental support and helping kids access the dental care that they need. Yet, throughout this time, unfortunately, we've seen the Conservatives play political games to waste time and slow down the important legislation that will help Canadians. Our government has also been investing in families since 2015. One of our first actions was creating the Canada Child Benefit, which, since its inception, has played a major role in reducing the number of children living in poverty. Unfortunately, the Conservatives yet again voted against this measure. We've made historic investments to build a Canada-wide early learning and child care system, starting with a 50% average fee reduction by the end of 2022. Unfortunately, the Conservatives are also against this measure. On this side of the House, Madam Speaker, we will always stand up for Canadian families so that every family and every child has a fair chance at success. Why won't the Conservatives join us, stop playing political games, and help us get this much-needed support to Canadian families? Hear, hear. En terminant.
In closing, I ask all of my colleagues in this House to support this motion. Canadian families and children who need dental care depend on all of us. The bill was vigorously debated at second reading in 6 sittings of the House on September 22nd, 23rd, and 26th, and October 3rd, 5th, and 7th. I'm sure my colleagues will understand that time is of the essence and that we must act now for the sake of our children. By scheduling second reading, we are allowing this bill to be referred to committee for further study.
Madam Speaker, I hope that all my colleagues will join me in supporting this motion and allow this bill to progress so that Canadians can get the support they urgently need. Thank you.
Questions and comments? The honourable member for Sarnia-Lambton.
Thank you, Madam Speaker, and I'd like to thank the Minister for his speech. Certainly, Conservatives agree that oral health is very important, but the measures in Bill C-31 are really covering children under 12 that are mostly covered in other provincial programs to maybe add them $500, $600, and then the one-time $500 payment for rental. At the same time, the government is taking away more than $1,500 from Canadians and increasing the carbon tax and increasing their payroll taxes. So does the government not recognize the hypocrisy of the fact that they're taking more money away than they're actually giving? And if they wanted to do something instantly, they could cut the carbon tax, stop the payroll taxes. Will the minister commit to do that?
The Honourable Minister of Health.
Madam Speaker, we're all very pleased to hear that the member supports this bill, and if so, then we should pass it quickly. We look forward to their support officially when the motion is voted on very soon, and we look forward to their support when it is passed in the House.
Questions and comments. The Honourable Member for Mirabel. Madam Speaker, because Quebec already has a rental assistance program, the Parliamentary Budget Officer did the math, and we learned last week that 86,000 Quebecers in need with an income of under $35,000 for families or $20,000 for individuals won't qualify. C-31 for the housing components forgets Quebecers and Quebec. And so I will speak to the constituents of Quebec City who need assistance with housing. I want them to remember at the next election that we are short-circuiting debate in the House, and their member, the Minister of Health, has forgotten them, Madam Speaker. The Honourable Minister of Health. I'm very pleased to receive a question on my riding, the riding of Quebec, where there are many community organizations, cooperatives, nonprofits who've been working hard since 2015 to strengthen the action of the Government of Canada with the first ever strategy on housing. And I am sure that in my colleagues' writing, it's the same thing, that nonprofits and community organizations are delighted with the strategy we put in place in 2015 that supports hundreds of thousands of renters in Quebec.
Member of Cowichan, Malahat, Langford.
Thank you, Madam Speaker. I, for one, am not prepared to encounter any more delays for the children in my riding who desperately need dental care. And we know that those regular dental checkups are so important for overall oral health. I was wondering, Madam Speaker, through you, if the Minister of Health can just comment on how those regular checkups for children under the age of 12, how that will actually save our system a lot of money going forward because of early detection of oral health problems and really help those families that are struggling to make those difficult choices week in and week out.
The Honourable Minister of Health.
Thank you, Madam Speaker. And obviously, I'm very much in agreement with the importance to invest in the oral health of our children. Oral health is health. And when we know that about 2% of all hospitalizations are due to urgent oral health needs that could have been prevented, that could have been treated through this type of dental care program that we're putting into place this time and with which we're going to build on in the next years to come. This is, Madam Speaker, an important investment to protect the health of Canadians, particularly those with modest and average incomes who otherwise won't go to see a dentist or a technician or a therapist because they don't have the means to do so.
Questions and comments? Member for Kitchener Centre.
Thank you, Madam Speaker. And thank you to the Minister for his speech. The member for Saanich Gulf Islands and I are both supportive of what's in this legislation, as well as moving it ahead as quickly as possible. We feel it's a step in the right direction, while not enough. But my question this morning is with respect to the motion itself. If the Minister can share more with respect to why this motion is necessary in terms of moving the supports ahead. He mentioned December 1st as a critical timeline. If he can speak to how this motion will allow all parliamentarians in this place to get the supports needed to Canadians as quickly as possible.
The
Honourable Minister of Health.
Madam Speaker, this is an excellent question. Now, the timing is quite clear. December the 1st is when this program is due to be in place. There is a lot of work to do until then. The Canada Revenue Agency obviously has a significant challenge in implementing this in the most appropriate manner, and that's why, Madam Speaker, we need to move to second reading and have the committee look at this bill. Obviously, the Senate will then take the bill over if the House passes it, and then we can start helping those hundreds of thousands of children who need dental care as quickly as possible.
Questions and comments? The Honourable Parliamentary Secretary, Government House Leader.
Yes, thank you. Madam Speaker, if I may first, just to thank the Minister of Health. A few weeks back, coming to Winnipeg North and meeting with some community members at the Fred Douglas Lodge, it was greatly appreciated. And we were talking about how we help our seniors. Today, the Minister is bringing forward legislation again that are going to help the residents of Winnipeg North, children under the age of 12 that might not necessarily have the financial means through their parents or guardians to be able to get the dental work that's so critically important. And that applies from coast to coast to coast, Madam Speaker. My question to the Minister is, can he specify why it's so important? How many children fall through the cracks because they don't have the benefit and ultimately end up going into hospital facilities?
The Minister de la Santé.
The Honourable Minister of Health.
Thank you, Madam Speaker. My colleague is quite right at pointing to the 500,000 children who we estimate don't have appropriate appropriate dental care in addition to appropriate child care with their families. And in his writing is probably around 1,000 to 2,000 children and therefore their families who will benefit from this dental care program if it is being passed by Parliament. That's obviously a lot of children who will therefore be able to live more healthily because of those investments.
Questions and comments? The Honourable Member for Central Okanagan, Similkameen Nicola.
Thank you, Madam Speaker, and I appreciate the Minister being present for today. I'm disappointed that the government is moving forward with such a large expansion without necessarily having debate. But Madam Speaker, every province, with the exception of Manitoba and the Northwest Territories, has a program to help seniors as well as low-income children to get dental care. My own home province, John Horgan, the Premier, who has said on behalf of the Council of the Federation that this is not where they would want to see health dollars spent. How does the minister square going outright and expanding areas of government that are not the priority, while our healthcare system, the system that this minister, Madam Chair, is supposed to support, and to be putting money into those things that even the premiers say is not a priority? How does he square that? How does he feel about his role working contrary to every single province?
The Honourable Minister of Health.
Thank you. I'm very glad and very grateful for this question. Two key statistics, 4% and $2 billion. 4% is the approximate share of current expenditures by provinces and territories on dental care. That's obviously not enough to cover the needs of almost 30%, 35% of the population in Canada who don't have access to dental insurance. Second, $2 billion. That's the estimate of the cost that hospitals have to incur because people are forced to go to the emergency room, emergency department, because they don't have access to preventive dental care. So these costs are obviously very large and will be significantly reduced by investing in the dental care for low and medium income families.
A quick question, the Honourable Member for Mirabel. Madam Speaker, over the weekend I was in my riding near Mirabel, and I had to tell citizens there who already have a right to the rental income that they are poor, that the Liberals of Quebec have forgotten them, and then they're part of the some 86,000 Quebecers that will not qualify for federal assistance because the minister has forgotten them. Did the Minister of Health go to his riding in Quebec and explain to families of low incomes who won't qualify and they won't receive anything A quick answer, the Honourable Minister of Health.
Merci, Madame la Présidente.
Thank you, Madam Speaker. The member obviously does a very good job, and obviously he did look at the housing support that has been paid for quite some time to 100,000 families in Quebec. That represents roughly 1/3 of households across the country, and he is surely aware that this is a significant investment to help the government of Quebec and all partners with respect to housing, also cooperative housing and low-income housing. As he says so well, this is absolutely essential for the cost of living of hundreds of low-income families in Canada and also in Quebec.
Resuming debate, the honourable member for Cumberland-Colchester.
Well, thank you very much, Madam Speaker. Always a pleasure to rise in the House and represent the good people of Cumberland-Colchester. And I thank the Minister of Health for his speech, always very interesting. Maybe to reflect a bit of the Minister's own language, $10 billion. $10 billion. There's a number, $10 billion for what's contained in Bill C-31 for the rental relief and the dental program funded by this federal government. I think that's a big number, and perhaps I'll come back to that as the Deputy Minister of Finance talked about throwing stones in a lake, Madam Speaker. I would suggest that here we are actually throwing boulders almost into a teacup, and the teacup, of course, is going to overflow, much unlike what the Deputy Minister of Finance would have Canadians believe. That being said, Madam Speaker, as I mentioned, this bill is split into into two parts, realistically, the rental relief bill. And let's speak about that. My honourable colleague from Mirabel spoke about this, about how Quebecers will be left behind. It's interesting when you look, it's actually not interesting, Madam Speaker. It is shameful, it is saddening, it is disheartening, it is just inconceivable, Madam Speaker, that the average monthly rent in Canada is more than $2,000. $2,000, and this Liberal government, which the Minister of Health did not speak of the rental program much, but this Liberal government wants to give people a one-time payment of $500. That being said, we know that rental prices are up 4.3% since August. They're up 15.4% over a year, again to an average of $2,043 per month. And that's information from rentals.ca and another a source called Bullpen Research and Consulting. We also know that all rental property costs are up 21.9% since April of 2021. And of course, this is due to increased demand, increased interest rates, which we know is fueled by this Liberal government's inflationary fire, for which we all know that they want to continue to pour more gasoline. Sadly, Madam Speaker, in Nova Scotia, my home province, the average rental cost per month for all property types is $2,453, a shocking amount of money for a place to live. In Ontario, slightly less at $2,451. A condo and apartment in Ontario on average $2,855. So when I look at those numbers, you know what? It's not that $500 is an insignificant amount of money, Madam Speaker. It is certainly an amount of money that you wouldn't pass by. That being said, it is not significant in terms of trying to help people who are having difficulties with housing. When I asked people in my own constituency, as we all know, we had a constituency week last week. When you ask them about, you know, perhaps receiving $500, the majority of people say, and I quote them, "It is not worth it." And the other answer is, why even bother? Why bother with $500, perhaps 1 week out of 52 weeks, of course, when we look at the cost of housing ballooning. When we look at this, why would we not consider in this House, Madam Speaker, directing funds to things that really affect the sustainability of every household in this country. As we all know, and if we're not, we're living under a rock, sadly. Groceries are up at least 10%. And of course, let me expand on that a bit if I could. Fruit, 13.2%. Eggs, 10.9%. Bread, 17.6%. Here's a shocker. Pasta, 32.4%. Shocking increases, which then translates, Madam Speaker, into a family of 4 having to spend $1,200 more to feed that family over last year. $1,200. So if we're giving them $500 a one-time payment, it seems like shockingly little. This program, of course, as touted by the Prime Minister, is going to cost about $900 million. And we also, of course, Madam Speaker, we all know very clearly that we have a government here that has added more debt than all previous governments for Canadians, all previous governments combined in 148 years. A significant portion of this, and I know the answer, Madam Speaker, is going to be related to this government talking about the terribly high cost of COVID, but we all know on this side of the House, Madam Speaker, that really is not forming a significant part of this massive amount of burdensome debt that is going to be left to my children and my grandchildren as well, Madam Speaker, which makes me very sad. We also know, Madam Speaker, that that side of the House has had significant failure on the housing file. We now know that people are spending over 50% of their checks on housing, up from 32%. And we actually have the fewest per capita houses in the G7. And of course, Madam Speaker, we all know very clearly that the average housing price in Canada has doubled. Madam Speaker, we're talking about creating another federally administered program from a government that has multiple failures. We as Canadians are having trouble getting a simple passport. Madam Speaker, I can remember getting my first passport in the early 90s. At that point, it seemed really quite simple. There was a form which you were able to get. It wasn't really downloaded then. I think you went to the post office. You put your name on it. You got several people in the community as guarantors. You sent it off. And surprise, you put it in the mail, and surprise, surprise, Madam Speaker, do you know what happened? It actually your passport came back to you in a timely fashion. And you know what happens now, Madam Speaker? Shockingly, the constituency assistants in my offices in Truro and Amherst spend untold hours and hours and hours advocating on behalf of the great citizens of Cumberland Colchester to simply get a passport, because they have now beginning to emerge from this pandemic that they would actually like to go somewhere, Madam Speaker. Shocking. It's as if it couldn't have been foreseen that as life returns to normal and we learn to live with COVID, that people would actually want to go and do something, and surprise, their passports were actually running out. That being said, I find it just inconceivable, Madam Speaker, that my office has to spend such tremendous, and the offices of all my colleagues here have to spend such tremendous amounts of time with something as simple as a passport. And now we are actually going to entrust this government with another federal program. We're going to say, hey, why don't you federally administer a program for all Canadians? That makes no sense when you can't even get people a passport. It really doesn't make any sense to me at all. Two other issues, Madam Speaker, that I think really underline the ridiculous nature therein is the immigration file. I met with a gentleman at my office during constituency week. He has been living in Canada since 2011. He entered this country with a BSc and an MBA. Since that time, he has obtained in Canada an MSc as well. And what has happened to that man? He has been waiting 5 years for his permanent residency. 5 years. It's nonsense. He's been here, as I mentioned, for 10 years, working in Canada, functioning as a Canadian citizen. All of his paperwork is in. He pays taxes. As I said, he goes to work every day. Why does it take such an inordinate amount of time? And again, I would suggest that all of my colleagues here in the House, Madam Speaker, are really able to fully realize that this is not a fallacy. It is the sad reality that people are waiting years to become permanent residents and citizens of a country in which they are actually functioning as citizens already. They're following the laws, as I mentioned, they're paying their taxes, they're working. They are contributing to the great country which we all have the privilege of calling home. So when I look at those things, Madam Speaker, I ask, how can we entrust this government to administer any other programs? That being said, Madam Speaker, finally, as we know very clearly, Hurricane Fiona has been devastating to Atlantic Canada and certainly specifically to Cumberland, Colchester. And the way in which that support is rolling out for Atlantic Canadians and the great people who live in my riding is appalling, Madam Speaker. There doesn't appear to be rhyme or reason. There appears to be words attached to this amount of funding that's going to be rolled out. However, there does not appear, as we're sadly reminded daily, there doesn't appear to be any plan behind how to get people that funding. People have trees lying everywhere. I'm not talking that they have, sadly, some alder bushes that have fallen over that you could, snip with, with a good pair of clippers. These are big trees that have fallen down, and in the order of 30 and 40 trees, Madam Speaker, that this government has promised money for these people to get their lives back together, and sadly, they don't have a program to roll it out. And again, I would suggest that asking this government to be a part of rolling out another federal program is really not the way in which we would like to see things proceed. We now know that the Canadians are paying more in taxes than in housing, transport, food, and clothing combined. We are taxed. I don't even know where it is. Is it above my nose? Is it above my eyes? We're paying significant taxes, Madam Speaker, and people are feeling this cost of living crisis. People are not able to afford to pay more, Madam Speaker. They need to think, as we all know, winter is coming. I know that sounds perhaps a bit cliche, but it is coming. It always does. And people are now worried about putting oil in their oil barrel, people in Cumberland, Colchester, who often live in single-family dwellings, who are very much still dependent on fossil fuels. We know that that's what their concern is. We know that they're worried about feeding their families, and adding more programs doesn't seem to make any sense. We also know, as mentioned here in this House this morning, that the upcoming payroll tax increases and the tax on tax, the dreaded tax of all, tripling of the carbon tax, the Canadians are at their breaking point, and this government continues to pile on more and more taxes on the backs of Canadians, which we know is an untenable position. People cannot afford this. People do not want to continue doing this. And as we also heard, we know that this government is often wanting to give with the left hand and take with the right. And that's what we're seeing with these increased payroll taxes, which we know are going to roll out in January, and then, of course, the tripling of the carbon tax, which we know is going to be rolled out against the best wishes of many, Madam Speaker. And therefore, we see giving $500 and taking away many more, and again, putting that money that they're taking in the form of payroll taxes and putting it into general revenues, which really doesn't make a whole heck of a lot of sense. That being said, Madam Speaker, the second part of Bill C-31 is the Dental Benefit Act. As I mentioned, the Deputy Finance Minister, and I don't know if I have this quote exactly right, but said, it's like throwing a stone in a lake. The lake doesn't flood. And of course, when we continue to add billions of dollars, I believe that's like throwing boulders in a lake, which eventually we do know it will raise the level, and it could possibly overflow, depending on the size of the lake, Madam Speaker. If we put a boulder in a mud puddle, we know that that's going to take up all of the space. What's the evidence with respect to this? Well, I would like to think that the Parliamentary Budget Officer is a good source of information. The estimate is this is going to cost $9 billion, with a B, over 5 years. There's some other strange math that perhaps could be clarified, but certainly it appears that year one is going to cost in and of itself $5.3 billion. Again, with a B, not an M, with a B. For another federally administered debacle, Madam Speaker. When you look at this, what does the Canadian Dental Association have to say about it? Arguably, certainly speaking for many dental professionals in this country, but they say, wouldn't it be better to bolster existing and underfunded provincial and territorial plans as opposed to attempt to create another system altogether? As we've heard, Madam Speaker, we know very clearly that at least 11 of our 13 jurisdictions have abilities to fund, at least in part, dental care for those in the greatest need. And certainly that if that is the truth, which I believe it is from research, that it would make more sense and behoove us all not to create an entirely other system, but actually then to bolster, as the Canadian Dental Association would say, would be to bolster the existing and underfunded programs. Madam Speaker, if I might, in Nova Scotia, for instance, there's a program there that's fairly comprehensive for children under age 14. It costs $11 million per year. So when you look at those things, the federal program is for children under age 12, but I would suggest that perhaps Nova Scotia might have per capita fewer children than other jurisdictions. Just doing some perhaps spitball math, if there's 1 million people in Nova Scotia for children under 14, averaging that out to the rest of the country, that would be $3.4 billion per year. So certainly, Madam Speaker, not an insignificant amount. We hear that we believe that the CRA is going to administer this part of the program. When you look at these things, I don't believe that anybody who pays taxes in this country would believe that the CRA is going to create a simple administration for this program. I fail to believe that. We know how complicated even filling out simple taxes is, Madam Speaker, and we know that that is going to be difficult. We also understand that there could be claims adjudication in this. We hear that early on in this part of it that it's going to be $650 a year, really with no strings attached, no questions asked, how much were the fees, etc. You can, I don't know, can you keep the rest? But there's a thinly veiled threat that if you are dishonest, you'll have to pay it back, and there'll be a fine as well. We also know, Madam Speaker, that we've heard from dentists that we know that their fees vary widely, even in the province of Nova Scotia and certainly across this country. We know that a checkup and cleaning, for instance, Madam Speaker, in Nova Scotia could be between $90 and $240. We know that a filling in Nova Scotia could be $70 up to $400, Madam Speaker. So we know that there's significant difficulties associated with that. We also know, as I previously said, Madam Speaker, that multiple jurisdictions already have significant dental coverage in a universal sense. Quebec, Newfoundland, Nova Scotia, PEI, Yukon, and certainly Nunavut and the Northwest Territories have more complete coverage for First Nations families as well. We also know that there's additional coverage for other families, Madam Speaker, who are receiving financial assistance in places such as New Brunswick, Ontario, Manitoba, Saskatchewan, Alberta, and British Columbia. So when we look at these things, will the provinces actually be expected to continue the programs that they have? And, Madam Speaker, I would suggest that there is some concern in the bill that I would have that would suggest that those provinces that have programs will be expected to continue them, which really doesn't appear to be fair and equitable. What do we really need to have happen here, Madam Speaker? We need to understand very clearly that the funding for health transfers need to be shored up across Canada. We hear day after day of folks who don't have access to primary care. We hear of these tremendous and just insane backlogs, Madam Speaker, that have been created by the COVID-19 pandemic that is going to require significant effort and significant funding, Madam Speaker. We know that this government has also not yet committed to funding the Canadian mental health, or the Canada Mental Health Transfer. On page 75, the Liberal platform, $250 million was committed, and then on budget 2022, another $625 million, which appears to, at another point, appears to equate to $4.5 billion over 5 years. And I don't think that there's a member in this House, Madam Speaker, that would not agree that mental health is a significant and ongoing and burgeoning difficulty for the entire country, for every province and territory, town, small and large, in this country. And we know that this government has yet to commit to funding the Canada Mental Health Transfer. We also know that there has not been significant consultation with the premiers of the provinces and territories, Madam Speaker, with respect to this bill, and we believe that that is what those provincial and territorial ministers of health would want. We also know that this government continues to run a significant deficit in debt, and I've spoken previous and multiple times before about the terrible debt burden that this government is leaving future generations. You know, and I look at this, Madam Speaker, to try to make sense of this. This is, you know, I have a minivan, and if we continue making payments on those, why would I buy another vehicle? I don't understand that. If I can't finish paying for the one that I have, why would I continue to say, I want something else? I'm just adding to it. Those are wishes and desires. And from that perspective, Madam Speaker, that just doesn't seem to make any sense. The Minister of Health also spoke about a speedy passage, and I would respectfully disagree with the Minister, Madam Speaker, that we know the speedy passage is related to the Liberal NDP coalition and the demands that are required to keep this government afloat. And I don't think that that is a reason in any way, shape, or form, Madam Speaker, that we would want to impede debate on such significant legislation in terms of the cost of that legislation. As we said, this is a $10 billion, and again, I'll use the minister's own parlance in the sense to say, here's a number, more than $10 billion. And that is without the hiccups and pitfalls that we know so many federal programs are going to fall with. Therefore, could it be $15 billion? And again, these are boulders that we're throwing into a teacup, Madam Speaker. I have to be clear, Madam Speaker, that this is not a question of the importance of oral health. This is a question of responsible government and fiscal responsibility and timing. This is about partnerships with provinces, Madam Speaker. This is about federal oversight and heavy-handedness. This is about the federal administration of a program which we know has failed multiple times. And we know that this government is a government that is great at making loud overtures, but we also know that this government is not very good at following through on action. And we also know that they're really great at spending money and not delivering much. Therefore, Madam Speaker, I think it's become very clear over the last several minutes that there's no way that I could possibly support Bill C-31 in its two separate parts, which the rental relief program, which, as I quoted, people from Cumberland Colchester feel it's not worth it and why bother, and the significant costs and even perhaps the lack of support from the Canadian Dental Association with respect to the dental portion of Bill C-31, Madam Speaker. So I hope that that sheds some light on the very important difficulties associated with Bill C-31 and the need to debate it further on behalf of all Canadians. I thank you, Madam Speaker.
Questions et commentaires, questions and comments. The honourable member for Don Valley East.
Thank you very much, Speaker. I'd like to ask the member a question. You know, I'm a big supporter of Bill 31. I believe that, you know, we are talking about $1,200 for dental care and $500 for rent subsidies. And the member opposite, on one hand, saying, you know, the government's spending way too much, $900 million, I think he said, on the $500 subsidy. And at the same time, he's saying $500 is not enough. My question to the member opposite, does he not think that anyone in his community could use $500 to help with rent or groceries? Does he not believe that any child in his community would help by having the $1,200 subsidy? My question to the member.
The honourable member for Cumberland Colchester.
Well, Madam Speaker, I thank the member opposite for his question. I think what the important thing here is that this government needs to begin to understand the significant effects of inflation and increasing interest rates that are happening to Canadians and the difficulties that every day Canadians, not just in Cumberland, Colchester, but across this vast nation, are struggling with in order to feed their families. We know that a family of four, it is costing them $1,200 more to feed their family. We realize that. What I would suggest, Madam Speaker, is this government needs to do something better. They need to change their fiscal policies because we know that that is what is putting the gasoline on the inflationary fire, and they continue to do it, Madam Speaker, only to sadly support their coalition with the NDP, which continues to prop this government up.
Thank you very much, Madam Speaker. I appreciate my colleague's speech, and I agree on many points that were raised. Namely, not to multiply the number of programs and to use the ones that are in place. We agree on that point. My question for my colleague is that he mentioned health transfers to the provinces during his speech as being the solution rather than creating new problems. Did I hear that correctly? And does my colleague agree with increasing health transfers to the provinces as the provinces and Quebec have been asking, and to do so without conditions? Because since the new leader was elected, we haven't heard that message clearly.
In Colchester.
Madame la Présidente, je voudrais...
Madam Speaker, I want to thank my colleague for the question.
Madam Speaker, that the Canada Health transfers have been a difficulty for all provinces. We see the burgeoning costs of health care, and we know that this is a significant issue. Part of the argument I would make, Madam Speaker, would be to say, why are we spending money on more and new programs, which are exceedingly expensive, as I said, on the order of $10 billion, when we realize that we are continuing to underfund the Canada Health transfers at the current time? So it's that old question of, are we robbing Peter to pay Paul? Why are we doing this? Why are we taking money that we don't have and trying to pull it out of this pocket and do a little hocus pocus and say, oh, here we found some more money? We're continuing to print money. We know that that is adding, as I said previously, fuel to the inflationary fire. We know that Canadians find it very, very important to have a robust and accessible, Madam Speaker, an accessible health system, which at the current time they do not have, and that's the travesty of this Liberal government.
And comments, the honourable member for Edmonton Strathcona.
Madam Speaker, and I would like to thank my colleague for his intervention today. I'd certainly like to thank him for pointing out that this, in fact, was the NDP that has brought this forward. That's kind of him. I did notice, however, that he spent a lot of his speech talking about things that weren't, in fact, dental care, and I wonder if that is because he is worried about going back to his constituents and telling them why he doesn't support dental care for children under 12. He did talk about this $10 billion price tag. I wonder how he feels about the fact that there are tax evaders in this country that we just heard from that are evading $30 billion worth of tax. And in fact, if we actually took care of that program, we could take care of the teeth of children in this country. I wonder if he could comment on that, please.
The honourable member for Cumberland Colchester.
Well, Madam Speaker, I thank the member opposite for her question, and I think the important thing that we need to understand here, of course, is that this government has so many flaws that is really beyond fixing, Madam Speaker. We know that they're not catching tax cheats. We see that they're not doing those things. They're not funding mental health care. They're not funding health care. And here we want to fund another program. That seems to be nonsensical. As I mentioned very clearly, and I'll reiterate this to my colleague, I know I said this previously, Madam Speaker, but I think it bears repeating. This is not a question of the importance of oral health. This is not what this is about. It is a question of responsible government, of fiscal responsibility, partnerships with provinces, insane federal oversight, and a failed federal administration, Madam Speaker. That's what this is about.
Comments, the honourable member for Kitchener Centre.
Thank you, Madam Speaker. The member for Cumberland Colchester spoke about how the $500 rental benefit in Bill C-31 is insufficient on its own, and on this we agree. I'd appreciate hearing his perspective on one of the root causes behind the housing crisis that we're in, and that's corporate investors treating homes across the country like commodities. The governing party says they need more time to study the issue, while experts across the country are recommending we move forward with sensible measures like removing tax exemptions for real estate investment trusts. It's a path that then Conservative Finance Minister Jim Flaherty, the late Jim Flaherty, started down 13 years ago or more. Can the member comment on measures like this? I've put it forward as motion 71 that would move towards a housing market that treats homes as places that people live rather than stocks that institutional investors trade.
The honourable member for Cumberland Colchester.
Well, Madam Speaker, I thank the member opposite for his insightful comments. You know, part of the difficulty that Canadians are facing is inflation. We know that interest rates are rising, and when you begin to speak to some other economic experts, perhaps even a recession looming on the horizon, which is absolutely terrifying from an economic perspective, Madam Speaker. When you understand that generations coming forward will not be able to afford a home, that's a travesty. That is not the vision that we have for Canada. When we understand that the current generation, the children are living in their parents' basements because they're unable to afford a decent house, that's a travesty, Madam Speaker. On the weekend, I met with a great friend of mine, many years friend of mine. 2 of his adult children are living in his basement because they're unable to afford a house. Is that a problem? It is a giant problem, which I will lay directly at the foot of this Liberal government, because clearly, Madam Speaker, there is no thought about monetary policy on that side of the House.
And comments. The honourable member for Barrie Innisfil.
Madam Speaker, one of the things that's being lost in this whole discussion about this dental program in Bill C-31 is the fact that in Ontario, for example, under the Ontario Healthy Smiles program, the government funds a dental program that provides free preventative, routine, and emergency dental services for children and youth 17 years old and under for low-income families. That includes checkups, cleanings, fillings for a cavity, x-rays, scaling, tooth extraction, and the list goes on. In fact, in my area of Simcoe County, the Simcoe County Muskoka District Health Unit has a bus that visits schools to provide oral health care. So my question is this really an issue of oral health for Canadian children, or is it just pure political crassness and political vote buying by offering this payment when in fact many of these programs exist within the provinces or are covered by insurance companies?
Member for Cumberland Colchester.
Madam Speaker, I want to thank the member for Barrie Innisfil for his questions, thoughtful comments, and highlighting of that wonderful program that the province of Ontario has. And I'd also like to pass on my condolences for the fallen officers in his riding. Madam Speaker, we know that very clearly that many provinces and territories have reasonably robust dental oral health programs at the current time. And as I mentioned, I think it's important that we understand what exists now could be built upon, and that is mentioned in the comments by the Canadian Dental Association, is to look at programs that are perhaps underfunded or perhaps going in a direction which could be improved upon, to understand that we don't need to tear down those institutions that already exist. We need to make them better. And I do not believe for one second, Madam Speaker, that there's anybody on that side of the House that could possibly run a program that's going to be effective and delivered quickly and useful for all Canadians. So I think that what our members highlight is very important, Madam Speaker.
Resuming debate, the honourable member for Mirabel. Thank you very much, Madam Speaker. Madam Speaker, how should we say? Closure, time allocation in a parliament is like the atomic bomb. It's what governments use, mostly majority governments, use to close debate, to put an end to the exchange of ideas, to put an end to everything that voters voted for on the day of the election. And that's why we need to avoid it as much as possible. And that is why, at the outset, opposition parties don't usually support time allocation and closure, because opposition parties are supposed to protect the work of the opposition. But this is the 44th Parliament, Madam Speaker, and there are 23 stages that have been accelerated, 4 motions adopted this way. Why? Because We're stuck in a parliamentary racket between the Liberal Party and the new anti-democratic party. We're talking about stopping Parliament from working. We would have thought that would have happened in March when there was that agreement between the Liberals and the NDP. But it began with the Emergencies Act, where the NDP MPs didn't hesitate to rise in the House on a Monday when there was no longer a trucker on the street to vote with the government for nothing else than to protect their seats because they don't want to defend their record to their constituents. Madam Speaker, they voted for clear violations of human rights, and it has continued since then. It has continued on budget bills, and we hear them, Madam Speaker. We know because when you turn the screw, it hurts. Because it's continued on bills, on motions, one after the other. They reject Quebec. They've allowed closure on C13. C13, when the Bloc was asking, for example, that the Charter of the French language apply to federal jurisdiction companies in Quebec, when they voted against that, they allowed closure to accelerate C13. Do you know what C13 is? It allows Michael Rousseau, Air Canada, Via Rail, CN to determine the language in which they work in Quebec. And you know what that is, Madam Speaker? That is English. So the NDP is about that. We're far from Jack Layton's day, the time they want to forget, when they pretended to have principles. We know the NDP doesn't have principles because principles aren't supposed to change over time, Madam Speaker. They're supposed to be stable. We're far from the time when there was the Sherbrooke Declaration from the NDP that said the national character of Quebec is based on being a majority French language society with French as the language of work. Those are the words of the NDP, but we're far from that now. They vote with the government nonstop to keep their seats, to offer stability that the Liberal Party doesn't deserve with the policies they present, among others, with Bill C-31, that quite seriously is poorly designed, poorly drafted, poorly thought out. So shame on this process supported by the NDP that would shut down parliamentary work and muzzle parliamentarians. Listen, C-31, before we get to the content, the process is very dishonest. We know this summer, they said the Liberals weren't able to deliver a universal dental care program. It's not under their jurisdiction. They don't manage institutions. So the leader of the NDP got mad. He went to the media and he threatened to undermine the government's stability. So the Prime Minister got scared. They met and they hurried up to prepare a bill to say they would do a half measure that doesn't really help the families of Quebec or Canada for dental care. I'll get back to that. And then we can justify our existence, Madam Speaker. And that's unacceptable for Quebec. It goes against its jurisdiction. This is not the federal government's role. But what they've said is, we'll have a little measure for housing. We'll give a $500 check to people. So if you stand up for Quebec in the interests of Quebec, and if you take the time to reflect before putting in place such an ambitious project, well, we'll go see your constituents and tell them that you voted against a bill that would have given money for housing, for rent. Do you understand, Madam Speaker, how convoluted this has made the democratic process? We should have taken C-31 and put it in two parts. We could have talked about housing on the one hand and looked at that on its own, and then we could have looked at the matter of dental care. They don't even understand their own bill, Madam Speaker. They think there's something for teeth in here. There isn't. We could have talked about this separately, and if the NDP hadn't been scared, they wouldn't have been scared of debating it here. They wouldn't have been scared of all of the hours of debate under the standing order. They wouldn't have been scared of hearing from the other opposition parties, and we don't even know if they consider themselves the opposition anymore. So here we are with closure for a poorly drafted bill. So I asked myself, does it deserve to go to committee? Should we be working on this bill? Because they have us up against the wall. They've said there's assistance for housing in here. And there is a housing crisis in Quebec, in Mirabel. People are experiencing this with great difficulty. Over the weekend, I was in Saint-Janvier. I was talking to people who were telling me how difficult housing is for them. And the Liberal MP was mentioning this earlier. Like others, I thought, well, maybe $500 during a time of inflation when there could be a recession coming up. Well, perhaps this would help families in Mirabel. I really asked myself the question. But the government hasn't done its job. The NDP hasn't done its job. They haven't asked the question of the real impact on the ground of this bill. Because if they really wanted to help people, they never would have tabled a bill under this form. So we asked the Parliamentary Budget Officer to see what would be the impact on Quebec for this bill. Because I listen to Quebec. I know Quebec's programs. I inform myself. And there are others in other provinces. And I'm aware, as the Liberal government should be, but they live in a constitutional stratosphere where Quebec doesn't exist, the provinces don't exist, where everything comes down from Ottawa. And they didn't realize that Quebec already has a housing supplement. If you're a family in Quebec with under $35,000 in income, or if you're a single person with $20,000 or less, and you spend more than 30% of your income on housing, there's already a housing supplement, a rental supplement. So will Quebecers be excluded from this bill? So what did the PBO answer? And it's a good thing we asked for this information because the Liberals don't care about Quebec. They didn't provide any calculations. They didn't ask for them. They're not interested in Quebec. So when the Bloc asked the PBO, we were told the PBO saw that some provincial and territorial programs offer assistance when housing hits 30% of income. 118,000 Canadians, 86,000 in Quebec would not be eligible to this benefit. That means, Madam Speaker, that if you're a Quebecer, not only do you have a social safety net that works, because in Quebec, we're not part of the individualistic left that defends people separately. We're together. We have a social safety net. We take care of our people. We've thought of housing. On the contrary to the government with its national housing strategy, which takes years to negotiate, years to get on the ground. So they have to give $500 to people so they can manage today. And Quebec is paying once again for doing the right thing, for managing things well. So now there's a pseudo housing assistant program, $900 million or a bit more. $200 million paid with taxes that Quebec sends to Ottawa. And 86,000 Quebecers who are targeted as being vulnerable in the bill, families, children. You know, $35,000 for a couple or a family isn't much. $20,000 per year for a single person, maybe a single mother, that's not much. And you know, these people aren't eligible to the same assistance as other Canadians. Why? Because there's not a single Liberal MP who stood up for Quebecers. There's no NDP MP who stood up for Quebec. Is that what the member for Rosemont-Lapetite-Patrie meant when he said that the government listened to the NDP's good ideas? Will the member for Rosemont-Lapetite-Patrie go tell his constituents who make under $35,000 a year that those who aren't eligible, will he inform them that they aren't eligible? Will he do that work? Is that what the member for Rosemont-Lapetite-Patrie meant when he said that it's a minority government and they're using the dynamic to obtain gains for people? Did he go tell the people of Rosemont-Lapetite-Patrie that though his fellow constituents aren't people for him or the Liberals, that these people will suffer when Quebec pays over $200 million in taxes to Ottawa to help the people of Ontario and Alberta, because it's easy to elect a right-wing government in Ontario and Alberta that doesn't take care of the social safety net, because they know that Ottawa will come do that job. But in Quebec, we have a social safety net. We take care of people. And that is why Quebec needs a right of withdrawal with full financial compensation for these types of programs. It's for the good of the people. It's not just an empty principle. It's because we already take care of this. We do more than others. We're ready to take on the costs. But when a federal government comes to do the same thing in other provinces, and Quebecers already have the program and it works, and at home it's permanent. It's a permanent program. Just give the money to Quebec. Nobody has stood up for Quebec. Even worse, the member for Hochelaga Maisonneuve, the parliamentary secretary to housing, who spends her summers doing little meetings, little photo ops, talking about housing. She comes to the House. She made a speech on C31 recently, and she said in Hochelaga, 70% of people are renters, and over 24% of them pay over 30% of their income on rent. Does that member for Hochelaga Maisonneuve, who could have stood up for Quebecers, the Quebecers of all ridings, she could have stood up for them. She could have done that work. Will she go to her riding and explain to people, explain to a single person who makes $18,000 a year, that all other Canadians will be eligible for housing assistance, and that her people in her riding, where people need help and who aren't able to make ends meet to feed their children, will she go tell them that Quebecers have paid over $200 million in taxes to fund this program, to help those who voted for Doug Ford in Ontario? I hope she'll do that. I hope she'll have the honesty to do that. I'm starting to understand them, why they made this little deal, and why they don't want to face voters. I asked the health minister earlier, did you tell the people of Quebec that you forgot them? He talked to me about housing co-ops, all sorts of things. He's saying the private sector is doing its work. He wasn't able to look me in the eyes, Madam Speaker, and answer me through you, of course, to say, yes, I will tell people that I'm in my bubble in Ottawa and that I'm not standing up for people, that my constituents aren't important to me. And now we haven't even talked about the dental care component. The NDP, what it wants is a centralized program that's focused on Ottawa, on Canada, one size fits all for everyone, Madam Speaker. Listen, when the NDP wanted to win seats in Quebec, because now the NDP doesn't care about Quebec, now that they only have one seat there. The NDP in the Leighton Times wrote that unity is not necessarily uniformity, the Sherbrooke Declaration of 2005. And in Chapter 3 of the Declaration at the time, this was the time when they had principles, when they did their job, when they stood up for people, when at least they claimed to stand up for Quebecers. They said the national character of Quebec is based on cultural, economic institutions, including state institutions and those in civil society. When the NDP wrote that, did they tell Quebecers that the day when they weren't voted in because they weren't properly being the opposition, that they'd come here and increase the Canada Child Benefit that has, well, Quebec's parents and the parents of the rest of Canada are told, we'll give you a fixed amount that we could have given you anyway because the system already exists. But just to satisfy the NDP, our friends there who shout. Point of order, the honourable member for Timmins James Bay.
Upset, but he keeps pointing personally at me, and I find it it's threatening my space. Could you ask him just to settle down a little?
The honourable member for Mirabel. I want to manage my time well, and under the rules, I can point at the clock. Thank you. I just want to ensure that everything's going well in the House So I hope that the honourable member isn't pointing at the member himself. So I'll just ask him to be a little bit careful. The honourable member from Mirabel can continue his speech. He has 4.5 minutes left. If I was criticized for my words, I could withdraw them, but it's a little hard with my finger. We're in a situation, Madam Speaker, where a family will have to go to the CRA, fill out paperwork, be audited. To be able to have that increase, that benefit, they'll have to go to the dentist to get services that aren't covered by current programs. Look, rather than spending the time on homework, spending quality time with kids, they'll have to spend time being audited for expenses that have nothing to do with the dental bill. And we're waiting for the PBO's numbers on this because we know, once again, that Quebec will be paying for this. Because Quebec has a program, a generous program, that can be increased, could be negotiated with the government of Quebec. Quebec has a dental care program for kids under 10, and it can be improved. The system already exists. The IT system exists. Dentists are familiar with it, parents as well. If kids need a filling, it's automatically reimbursed. But because we do well, because we take care of people, because we have a system, because we stand together, because Quebecers have solidarity, we will be paying. The parents of Quebec won't have access to as much of a benefit as parents in the rest of Canada. That's what will happen. Quebec in Ottawa pays the price for its solidarity. Quebec in Ottawa pays the price for the fact that we take care of our people. And during this time, who pays? Maybe there are good intentions here, but it's the children of Quebec, the renters of Quebec, the single people of Quebec. I'm not the person making this up. The 86,000 Quebecers who won't have access to this, the majority of people who won't qualify. So we'll get back to the matter of closure, because it's an essential issue, this time allocation. The NDP and the Liberals, they think they're so smart. They think they're so good. They have blinders on. They've forgotten Quebec, Ontario, New Brunswick's dental program. Everyone, aside from their own belly button, they think they're so good that they think debate is good for nothing. They think MPs who haven't cuddled up with the government, who do their job, who support bills when they're good for Quebec, who look at second reading and report stage, those of us who do our jobs, we're paid for that, we're elected for that reason. They think we're not smart enough for them. They think we're not able to read a bill, that we're not able to improve things, to take care of people. So what do? They play the government's game and they support closure. Shame, Madam Speaker, on those who run for office, who are elected as part of the opposition, in the party with the least number of seats in this House. And in order to protect themselves, they decide to put an end to debate in this democratic space. Shame on them. Thank you.
Questions and comments? The Honourable Parliamentary Secretary, the Government House Leader.
Yes, thank you, Madam Speaker. What is clear, unfortunately, is that the Bloc, who's a separatist party, who doesn't have any form of a national vision, recognized, working with the Conservative Party of Canada, do not support this legislation. And that is the reason why the motion is necessary. Because if the motion is not brought in, Madam Speaker, the children in Canada from coast to coast to coast will not get the benefits of a truly national program that's going to prevent, in many ways, children from having to go into hospitals. How can members of the opposition, the Conservatives and Bloc, disregard the needs of children under the age of 12? Shame on them, Madam Speaker. My question to the member is, why does he not recognize, if not for the NDP, we wouldn't be able to get this legislation through the House? Maybe being somewhat hypocritical, Madam Speaker, in terms of his assessment.
The honourable member for Mirabel. Madam Speaker, how indignant of him to say that. Someone who knows that we're going to support this bill at second reading. We understand the parliamentary process. We believe in debate. And how shameful of him to say that when they are skirting debate, and he is leaving thousands of Quebecers who are low income without additional benefits. But Quebec already has a system. It shows solidarity and it's generous. This is a shame.
Questions and comments. Our member for Peace River Westlock.
Well, thank you, Madam Chair, and I want to thank my honourable colleague for his passionate speech. I do know that I share with him this frustration around how the government seems to think that this place is completely an afterthought, and around how debate is not needed. And we've seen over and over again from the government is that they've brought things forward, and we've had concerns around them, and we said it's not going to work, it's not going to do what you're intending it to do. We have ideas for improvement, and they haven't been willing to listen to us. I'm just wondering if the honourable colleague can outline some of the other examples of other bills that we've seen come to this place where they've rammed them through and only to have disastrous results as we predicted. Thank you, Madam Chair.
The honourable member for Mirabel. It might seem somewhat insincere, but I believe in debate. I think we can have debate here, and I think bills need to be amended. People forget that we have to do this, and we have to show solidarity. And like what the member of Winnipeg North says, solidarity also means we have to recognize those who already made efforts, and we have to also compensate them for those. I have no animosity for the rest of Canada, but I do want to worry about Quebec. But I think then rather than yelling at us and insulting us, Madam Speaker, they should take some inspiration from us. And unfortunately, Ottawa has spent too much time in this little bubble here.
Member from Nanaimo, Lady Smith.
Thank you very much, Madam Speaker. I'd like to thank my colleague for his speech. This is the first step of our plan for dental insurance for all Canadians. Madam Speaker, why does the member not agree with the idea of offering dental coverage that is universal for all Canadians, including Quebecers? The honourable member from Mirabel. The member has just proven that BC is very far from Quebec. In the 1970s, Quebec already set up a dental program. We're the leaders in this area. Today, it covers children who are under 10. It can be improved, yes, but we do have a social security net. And we already have coverage for children under 18. And we've had to scale down this program because of healthcare transfer cuts that the Liberals set up. And people are saying we're against dental care. That's not true. They have to sit down, do their work, and look at history. And perhaps they could stop supporting the government that is responsible for undermining a program that they say that they want to enhance.
Comments? The
honourable member for Alberti-Masquinongé. Thank you very much, Madam Speaker. Like the member for, as the member for Mirabel is in great shape today, the parliamentary secretary also said earlier, I'd like to say that the door is open for him to comment on his comments. The honourable member, Madam Speaker, in an independent Quebec, we would have Quebec members that would take care of Quebec. We wouldn't have a member for Kingston or from Winnipeg talking for Quebecers. We would have our own ministers to defend Quebecers. Right now we have no one. Perhaps we'd have a parliament full of Quebecers that would defend our own interests. It's not a question of whether who is better or worse. We know we have the economic ability to do this. We know we can show solidarity. And we have to look at the very tone of the debate and the attacks from the member from Winnipeg North. I'd be surprised if you even know where Quebec is, knows where Quebec is on the map. And they didn't really do their homework on this. It shows that not only they need to take urgent action, there are Quebecers who need rental support, who earn under $35,000, and they're not interested in that. The honourable member for Châteauguay-Lacolle. Thank you very much, Madam Speaker. I'm sorry, I've just arrived. I'm very disappointing to hear what my colleague from Mirabel is saying we're not defending the interests of Quebecers here in the House, because in my riding, I know that, in Quebec, there were subsidies even beyond what was offered nationally. And I'm very happy with the projects that we were able to do at the same time in other ridings, as well. So I'd like to hear what the member knows about these programs. I think he must know about some social housing projects that were completed in Quebec. The honourable member from Mirabel. Does the member for Châteauguay not realize that she was in this parliament when they adopted the National Housing Strategy? They realized that there was already a program in Quebec. Does that member know that the FCM receives roughly 70% of funds, even though it should receive 20%? Did she call the mayors to find out more about this? Has she gone out to see members in her riding that are part of the 87,000 of Quebecers who won't have rights to additional benefits? Does she recognize that the provincial government needs to do more? And if she did do this work, I'd like to congratulate her. Questions and comments?
Westlock.
Madam Chair. It's not often you get two in one go. Once again, I just wanted to mention to the honourable member just around the fact that Alberta has had in a similar case to Quebec, Alberta has a dental care program for children across the province. And again, we've been pointing this out across the country. But one thing that I would note that I have disagreement with his assessment of the way things are is how Alberta pays an exorbitant amount into the equalization program, and of which Quebec is generally a net receiver of that program. And I was just wondering if you'd recognize that fact, that Alberta is often paying the bills for Quebec.
The honourable member from Mirabel. That's really hard to hear. We're talking about provincial governments that aren't doing their work, and that's the whole concept of federalism. When you give provinces power, we say that you're going to take care of housing or the social fabric to show social solidarity. But some provinces are making different choices, Madam Speaker. Obviously, Quebec has made choices and is now being penalized today because they performed better. And now we're talking about equalization payments in terms of environment, economic diversification. They are not being very performant in their province, and now they're paying the price.
The honourable member, the honourable parliamentary secretary of the government House Leader.
Yes, thank you, Madam Speaker. It was an interesting question. The member didn't necessarily answer the question. There is provinces like the province of Manitoba has been a big benefactor through equalization. And I'm wondering if he could provide his thoughts in terms of the importance of equalization payments. I know it's really important to the province of Manitoba.
The honourable member for Mirabel, a quick answer. Public accounts, pre-pandemically, wanted to consolidate all levels of government, and with the health of Quebec economy, it's well diversified. In 2019, if we had our own country, we would have had a deficit of around 1.5% of our GDP. That's better than the U.S. or France, and even this government that's not even able to manage its public finances. So if equalization bugs them as much as that, well, they need to look at that.
Resuming debate, the honourable member for Timmins James Bay.
Thank you, Madam Speaker. It's a great honour, as always, to rise in this House and speak on for the people of Timmins James Bay. It's very powerful that we're having this discussion today on trying to move forward with dental care legislation and protection for Canadian low renters in the midst of constant obstruction from both the Conservatives and the Bloc. I will be sharing my time today with the member for Edmonton Strathcona. So today, as we're discussing dental care, let's put it in context for people back home. We will be voting this afternoon on the New Democrat motion to take on greedflation, to actually shine a spotlight into the massive level of profits that are being made as ordinary working class Canadians, senior citizens, can't pay their grocery bills. And this morning, Galen Weston suddenly had the moment on the road to Damascus and announced, well, he wasn't completely willing to stop the price gouging, but he was going to put a price freeze on all his no-frills products. Nice, Galen. It's nice to know that when the New Democrats start putting pressure on, the big grocery giants are starting to jump. And we're not done with it, because, you know, what we see with inflation is that inflation has been hitting in two key areas. One is obviously at the grocery stores and others at the pump. And those are the two sectors that have had unprecedented levels of profits over the last year. So it is inexcusable for giants like Galen Weston and Big Oil to claim that they are just responding to the crisis that's been caused by the Ukrainian war and inflation, when actually what we're seeing is greedflation. Because whenever the price of the pump has been dropping, we've been seeing that inflationary pressures have dropped. Internationally, we see efforts at the EU, California, the United Nations pushing for a windfall tax to say this upper level of profit, this unprecedented level of profit coming out of the pocketbooks of people who can't afford to pay it, and it should be paid back. So that's something that's happening at the international level. We haven't seen this government go anywhere near that. But it'll be interesting today to see whether or not the Conservatives and the Liberals will stand with us and actually taking greedflation on. And I mention that, Madam Speaker, because it's really important to frame how the New Democrats have come into this Parliament and how we've been proceeding. When the Prime Minister called that completely unnecessary election last summer, in the summer of 2021, we went door to door and we listened to people. And we met family after family after family whose concern was that their children couldn't get their dental care fixed. We met seniors who couldn't afford to get proper teeth work done. And we made a promise that if the Canadian people set up the cards in Parliament and we had a minority Parliament, we would come back in and we would fight for a national dental care program. We ran on that and we're delivering on that. We are very focused on that. And I think it's very telling because it's obviously got my Conservative friends' backs up about this, is we're actually delivering. We said that we were going to push for a doubling of the GST tax credit because we need to get some money back into the pockets of citizens. And we saw the Conservatives light their hair on fire. Then they flip-flopped because how would they go home to their constituents and not say that they believed that they should be entitled to having money come back? But what they've been doing, they have a very different strategy than us. We're very focused on what we're doing. We announce what we're doing. We work on it. It's like siege warfare, I got to say, with the Liberals, dragging them, kicking and screaming sometimes to do the right thing. But you can do that in a minority Parliament if you're focused. So we said that we would get the dental care provisions in place, that we would double the GST tax credit, that we would get support for low-income renters because they are unable to pay the bills at this increasing time of insecurity. And the Conservatives, for their part, God love them. They love to jump down rabbit holes of conspiracy to get people arguing about things that are completely inconsequential. I'd like to talk, obviously, I couldn't have this conversation about the new shadow critic for infrastructure. Now, at a time when the issue of infrastructure and housing is the #1 issue in the land, she's demanding an investigation into Pfizer because she saw some crazy right-wing politician on YouTube making allegations. And so that's what the Conservative leaders, new infrastructure critics, saying. I remember when she was going on about the so-called Nuremberg Code, and it took the very wise member from Parry Sound, who I have a lot of respect for, to have to publicly say, quote, being offered a vaccine that prevents serious illness and our government's COVID response to COVID-19 are not the same as being tortured in a Nazi concentration camp. He had to send that against one of his own members. And I mention that, Madam Speaker, because the politics of disinformation is about getting people upset so that they're not focused on what matters. And what matters right now are concrete solutions to addressing the growing financial gaps and insecurities. So we see, if you want to talk disinformation, the front face of the Conservative movement in Canada right now, Danielle Smith. Oh my God, where to begin? We find out now that she's been promoting pro-Russian, pro-Putin separatist propaganda. That's unacceptable. When we see the horrific death rates and torture and killing and rapes happening in Ukraine, and yet she says that those who didn't want to wear a mask were the most discriminated against people in the history of Canada. We need to see all leaders in this country standing up against Putin because the economic devastation that's happening around the world is impacting us here. And we also, from a basic human rights point of view, need to stay focused. But I mention it because this is the politics of disinformation that the Conservatives are opting for to cover for the fact that they are not delivering real results for people. So when we came in and said we were going to double the GST tax credit, the Conservative leader had this term. He said, oh, if you give money to working class people or senior citizens so that they can help pay their bills, that money will be somehow vaporized, was the term he used. Vaporized is a magical Conservative economic term, kind of like cryptocurrency. And if we're talking about what got vaporized, how about the $1 trillion in crypto savings that disappeared after the Conservative Party leader went and told people to invest their savings in cryptocurrency? $1 trillion. That's vaporization. What New Democrats are doing is delivering. So today, what we're seeing is we're seeing a million reasons that Conservatives are telling ordinary Canadians that they shouldn't have dental care, that it's not necessary. This bill today will affect 500,000 children who do not have access to dental care. That's an enormous amount of people who deserve. These children deserve this. That we see 50% of low-income Canadians who have no dental care services, and only 1/3 of Quebecers who have dental care, private insurance. And what this means is to anyone who's had a child who needs their teeth fixed, it is an incredible pressure. And I know, talking to families about how they try and find ways to get dental care. So what this bill will do this year is we'll give 2 payments to families, low-income families with children under 12. That's not the full solution. That is the interim step that's necessary in order to get this program in place. This was our supply agreement with the Liberals. Now, it must be said, just because we have a supply agreement with the Liberals doesn't mean that we get along with the Liberals. This is about pushing these guys, because I got to tell you, pushing Liberals to actually do something is like wrestling with Teletubbies. Just trying to even get something to grip on with a Liberal is difficult at the best of times. But in this minority parliament, we found where it needed, and we knew it was on dental care. And so this year, we've pushed them. We've actually pushed these Teletubbies. We're going to get that money to low-income families, but that's only the beginning. We need this national program so senior citizens have a right to it, so ordinary working-class people have a right to it. Madam Speaker, we need to move on this. So while my colleagues on the other side are going to jump down the rabbit holes of conspiracy and Utah of nut jobbery, we will stay focused on getting kids their dental care, on getting money to working class and seniors, and to take on the grocery giants and take on greedflation. I'll be here all week. I'm ready to take questions. Thank you.
Questions and comments, questions et commentaires. The Honourable Parliamentary Secretary of the Government House Leader.
Yes, thank you, Madam Speaker. I appreciate the comments made by the member. I never thought of myself as a Teletubby, but I can tell you that when I think in terms of the process of getting things through the House, and given the opposition in terms of seeing this legislation ultimately pass in a timely fashion, and there might even be some members that don't ever want to see the legislation pass, I'm wondering if the member can provide his thoughts as to why it is important that we move this motion in order to be able to get the legislation through the House, because if we don't and we're not prepared to move the motion, I don't believe it would pass. If he can provide his comments.
Member for Timmins James Bay.
Thank my honourable colleague for that, and it's a very important point. We're here in Parliament sent by Canadian people, and they sent us a very clear message in the 2021 election. They didn't like that unnecessary election. They basically sent the same configuration and said, now do some work. And doing some work means at a certain point we put the interests of Canadian people above our own partisan interests. That means we don't have to get along, but we have to say there are objectives that have to be met. And so the objective that has to be met is we have to get this dental care through. If we don't get this thing through, if we allow the Conservatives in the bloc to obstruct it, it means that children will not get this service, and it means that next year seniors and families will not get this service. So we have to put our own partisan interests to the back once in a while and say, as a parliament, we can come together. So yes, we are going to work on this. Yes, we're going to get this thing through, and yes, we are going to get proper dental care for all those who deserve it.
Questions and comments. The honourable member for Peace River West Lock.
Well, Thank you, Madam Chair. I'm just wondering, as the member said that he put aside his partisanship, I would just argue perhaps that he's trying to look for relevance in this time. At the top of his speech, he was talking about how we needed this was the NDP initiative. Well, it is definitely a government bill, and so I'm just wondering, as the NDP seek relevance in this place, what will be their next initiative?
The honourable member for Timmins James Bay.
Well, I want to thank my honourable colleague for obviously he's looking to New Democrats now for the direction of where this House is going to lead. So that is what is about showing up. Because, I mean, God help the poor Liberals. They just don't seem to have direction. So, yes, we pushed them on the GST credits. Yes, we got them on, well, we're hoping they're going to be willing to stand up to the grocery giants. I'd like to see him as well. So as what's coming next, stay tuned, because there's a whole bunch of elements that we need to work on in terms of housing. We got to get actual housing built. It would be a good booster for the economy. We need to get investments, particularly in Western Canada, in the energy transformation. We hear a lot of hot air, but we need to see investments so that we can actually start to build a new clean energy economy. So yes, my colleague, anytime he wants to know what's coming up next in the House, come over. I will explain to him how we're going to push these Teletubbies and bring them into the promised land and make them a relevant government.
We have time for one more question. The honourable member for La Pointe de l'Île. We are not against dental insurance. There is already dental coverage for children in Quebec. Has the member thought about, or someone in his entourage thought about, how this is going to impact the existing program in Quebec? We don't want to penalize Quebec. We don't want to, and why would they not just simply transfer the money to Quebec for that program?
This issue, and we have been working across the board to make sure that children everywhere are entitled to this. And we know that only 1/3 of Quebecers actually have private dental coverage. They're woefully left behind on this area. So if we actually have a program that works, we will make sure that every child in this country, followed by every senior, followed by families who have a right to it, are able to obtain that, whether it's in Abitibi or whether it's in the Crow's Nest Pass.
Before I go to resuming debate, I do want to remind members who are having side conversations to maybe take them out. At one point, there was at least 5 conversations going on at one time on one end of the House here. So I just want to remind members that if they want to have those conversations, to please step out into the lobby. Resuming debate, the honourable member for Edmonton Strathcona.
I want to take a moment today to wish all of my colleagues in the House of Commons a happy Thanksgiving. We haven't been in this place since then, and certainly wanted to reach out to everyone and extend that greeting. And I want to just note that I'm certain that many of us, while we were in our constituencies last week, heard from our constituents that the price of food, the price of living, the price of fuel, the cost of living in Canada is becoming untenable, is becoming something that Canadians can't handle. And so I think it's incumbent on all of us in this place to stand up and find ways to work together, find ways to work with other parties, with other members, to make life more affordable for Canadians. And I am absolutely convinced that one of the ways that we can do that is with dental care. Now, Madam Speaker, you know, our job here is to support those people who don't have the same things that we have. It is to support people in Canada, around the world, to be able to meet their human rights, their human needs. And so it would be remiss of me as an Albertan MP, to not take a moment here to deeply, deeply condemn the comments that were made by our very new Premier of Alberta.
Yes.
Madam Speaker, I want to tell you about some people. People living in poverty, people who are houseless, people with disabilities, people living without drinking water, Indigenous peoples in this country, particularly women and girls, and the families and the children that went to residential schools, and those children who lost their lives. BIPOC folks, LGBTQ2S+ and SOGI folks, members of the Jewish community, members of the Muslim community, women in Iran, women in Afghanistan, women in Ukraine. My goodness. These are the people that the Premier of Alberta, the Conservative Premier of Alberta, said were not as discriminated as the unvaccinated in our province.
Wow.
Madam Speaker, I want to add to that. I want to just say, if you look at these lists of people that have suffered unbearably, and you discount all of that, and say that the people who have suffered the most are the people who chose not to take a free, a safe, a miraculous, and a scientifically proven vaccine. Free. I spent much of last year in this place talking about how we need to get vaccines to other places in the world. Those people didn't get access to that vaccine. But our Premier, the Premier of Alberta, the Conservative Premier of Alberta, has discounted every other group that has suffered harm, that has suffered devastatingly during this pandemic. And I would be remiss if I did not raise that in this place. But, you know, today we are talking about dental care. And I am going to say this is another opportunity for me to point out that the Conservatives don't seem to have a clue at all. We're talking about dental care for children under 12 years of age. And the fact that the leader of the opposition, the Conservative opposition, has had dental care for himself and his children for almost 20 years, the fact that every member of the Conservative Party has a gold-plated dental package that allows them to take care of their teeth, allows them to take care of their children's teeth, allows them to take care of their spouse's teeth. The fact that they have that, but that they don't want that for every other person in Canada. You know, my children will never not be able to get their teeth fixed. My children have access to a dental program that allows them to get their teeth fixed. And the idea that you wouldn't want that for every child in this country, the idea that the things you have, the things your children have, wouldn't be something you would want children across this country to have, baffles me. It baffles me, Madam Speaker. I don't understand. And I also don't understand, I mean, I walk around in my constituency. I hope we all do. I think it's very important. I mean, Edmonton Strathcona is, of course, the most beautiful constituency in the country, but I hope we all walk around our constituencies. And I'm hearing from folks across the board who are delighted with dental care, that are delighted that this is finally happening. It was recommended in 1968, but it's finally happening because of the NDP. So do the Conservatives not walk around in their ridings? Do they not talk to their constituents? Do they not understand what's there, I guess? You know, one of the other things I wanted to point out is that we are hearing in this place that, well, you know, you don't need this because there is a program already that helps low-income Canadians. Well, Madam Speaker, in Alberta, you need to make around $27,000 to be able to access some services. Some services. So basically, you need to be living so close to the poverty line to be able to access just a few of those services. And if you don't believe that children should have access to dental care, and if you don't think that it's important for the Canadian government to support that, is there an economic argument that we can make? Can we explain to the Conservatives how much it costs when a child ends up in the emergency room because they can't afford preventative dental care? How much more it costs when we don't do the basic dental care at the outset, what we pay for later on. So when they say, don't worry, people have dental care, people have pharmacare, people have all of these things, it's not true. It's not true for the vast majority of Canadians, and they know that. One other thing I wanted to bring up in my speech today, Madam Speaker. You know, dental care, I'm so incredibly proud to be part of the New Democratic Party that has brought this to the House of Commons, that has brought this forward. You know, my colleague before me from Timmins James Bay mentioned just how incredible it is to be able to say that we were able to push, I think he quoted called the Liberals Teletubbies, that we'd be able to get them to do this work, and that hold your horses because there's more we can do. Well, that's kind of what I want to talk about. Like, you know, dental care is great, but you know what else we need? We need pharmacare. We need eye care. We need mental health supports. In this country, as people struggle with COVID, with cost of living, with all of these things, the desperate need.
I just want to ask members who are having conversations to please take them out. I know that members are starting to come in, getting ready for question period, but it's very disrespectful to be having conversations and speaking loud enough for me to hear what the conversation is while another member has the floor. The honourable member for Edmonton Strathcona.
Speaker, could you just let me know how much time I have left?
2 minutes.
Thank you. So I would say that we need to have things like pharmacare, like eye care, mental health support, supports for people living with disabilities, supports for Indigenous people who have not even the basic rights being given to them. You know, we need to have support for people around the world. We have a food crisis. Putin is once again threatening famine to millions of people in sub-Saharan Africa and the Middle East. You know, we need to be supporting women getting an education in Afghanistan and other places around the world. And, you know, I know what the Conservatives will say. They'll say, yeah, but we can't afford it. We can't pay for it. So there's a few things I want to say to them. That was my deep voice that I used for that. First of all, we do have some solutions. The first solution we have is something that I hope they'll support today. You know, our motion that we brought forward where we would make sure that grocery stores aren't able to gouge consumers. The grocery stores aren't able to make massive profits while the cost of food goes up in Canada. You know, we've suggested a profiteering tax. This is a great idea, and in fact, something that the Conservatives in the United Kingdom have done. So we could do that. You know, wealth taxes. There's $30 billion of unclaimed taxes that we need to go out. It's always going to be a shock to me, but I'm standing up here on the same side as the CEO of Shell, begging the government to tax corporations at a stronger rate, at a higher rate, so that the burden of paying for social programs that are so vital falls equally, that it doesn't fall on the everyday Canadians. It doesn't fall on businesses, small businesses in our communities, that the corporations are paying their fair share, that the ultra-wealthy are paying their fair share. This, to me, doesn't seem like this is brain surgery. This seems very, very doable and easy. So when we talk about how we're going to pay for it, we've got a world of options. And maybe, as my friend from Timmins James Bay mentioned, if you want to hold tight, I'm happy to bring those ideas forward. The NDP is happy to push the government to make those things happen. We're going to be doing it today. I'm extremely proud of that motion, and I look forward to answering questions. Thank you, Madam Speaker.
Questions and comments. Questions et commentaires. The Honourable Parliamentary Secretary, the Government House Leader.
Yes, thank you, Madam Speaker. I think what's important is we heard many members of the opposition speak on the legislation. They'll often say, well, you know, province X has this, province Y has this. And what we're doing by bringing forward this legislation is to ensure that every child in Canada, in every region of our country, has the opportunity under the age of 12 to have some dental benefits. And it seems to me that the opposition has been lost to that point as they try to cite, and the member made reference to the uniqueness of Alberta. And the provinces are different. And I'm wondering if she could provide her thoughts on how important it is, coast to coast to coast, children under the age of 12 are provided this badly needed service.
The Honourable Member for Edmonton Strathcona.
Thank you, Madam Speaker, and I'd like to thank my colleague for his comment. I apologize for my colleague calling him a Teletubby. I know it was meant in good fun. In terms of the situation in Alberta, absolutely making sure that all children in Alberta can get access to dental care. But I think what he's getting at is the idea that I want to make sure, as a parliamentarian, you know, I love Edmonton Strathcona, but I want to make sure that the child in Nova Scotia and the child in BC and the child in the Yukon, that all of those children have access to the same dental care program, that can all access dental care, that there is no gap, there is no holes where families and young children can fall through.
Then comments, the honourable member for Sherwood Park, Fort Saskatchewan.
Thank you, Madam Speaker. The framing of this debate by this member is to say that if we want to see people have access to a particular thing or service, it necessarily follows that the government should provide that. So if you oppose the idea of federal mandating and controlling of dental care, then somehow you oppose children having dental care, which is ridiculous. I don't support, for instance, the government buying food for everyone. That doesn't mean I don't think food is important and indeed essential. I just don't think that government providing it is the best solution to the problem in the vast majority of cases. Does the member acknowledge that with the significant failures in terms of delivery and provision in core federal services, healthcare, passports, and other areas, that the government should recognize that maybe there are other institutions that can deliver these services more effectively, and that more federal intrusion isn't a solution. In fact, in many cases, it's the very cause of the problem?
Hear, hear. For Edmonton Strathcona.
Well, it's interesting to me because I think what the member is basically saying is that we should leave this to the private sector, which brings me back to where I started with my comments on the Premier of Alberta. And what I will say is that as a New Democrat, I strongly support universally accessible, publicly delivered health care that includes dental care, that includes pharmacare, that includes care for those who can't afford to pay for it. And I don't understand why the Conservatives think that being some sort of, we wish it happened, some sort of fairy is going to come and provide dental care to children. That's not going to happen. We tried that. It doesn't work. So now it's time to try the NDP way and get kids' teeth fixed.
Questions et commentaires. L'honorable député de Berthier-Masquinongé.
Merci, Madame la Présidente.
Thank you, Madam Speaker. During her speech, the member insisted on the importance of working together. I have the following question. Is she open to discussions to adapt the program because Quebec already has its own program, namely by looking at the way health transfers are done? Does she think it's all right to be voting on closure rather than working constructively on improving this bill?
Some conversations going on, and they're loud enough, so I would just ask members to keep it down. L'honorable député de Edmonton Strathcona.
Madam Speaker, and I would like to thank my colleague. I think it's important that we have these conversations, and I think it is important that we have this debate, but frankly, that's not what's been happening, has it? The obstruction, the deflection, the inability to do any work in this place because of some of the members of the opposition mean that it is very important that we move on this. You know, it is very important that we get this support out for people as fast as we possibly can. So I'm very supportive of this bill. I'm very supportive of working with people from all parties to make this bill stronger. I look forward to conversations with the member. Thank you.
And that brings us to statements by members. Déclaration de député. The honourable member for Hamilton East, Stony Creek.
And thank you, Madam Speaker. I rise today to recognize and celebrate the political career and achievements of Hamilton City Councillor Sam Marula. Following in the hard-working footsteps of his mother Rosalia and his late father Giuseppe Marula, Sam has dedicated his entire life to serving the public, and after 22 years of service, has decided to retire from elected office. Like a brother to me, he was always quick to offer good guidance, counsel, and support when I needed it most. Enhanced public transit, affordable housing, services for seniors and the disabled, infrastructure renewal, the list goes on. Councillor Marula was a leader on all issues, and it's largely because of his hard work and determination that we see what many consider a renaissance in our great city of Hamilton. I know that Sam is anxious to spend more family time with his wife Corinne and his two daughters, Sabrina and Alexa, and their families, and the newest addition to the Marula family, baby Remy. Madam Speaker, please join me in congratulating Councillor Marula for his more than 2 decades of service to the residents of Ward 4 and the entire city of Hamilton.
The honourable member for Selkirk, Interlake Eastman.
Madam Speaker, Vladimir Karamurza was arrested in April by Vladimir Putin's thugs on a trumped-up charge of spreading false information about the Russian military. His supposed crime? Condemning Putin's illegal invasion of Ukraine while speaking on U.S. soil. And now, just last week, the Kremlin kleptocrats in their kangaroo court have upped the ante, charging Mr. Karamurza with treason, which carries a 20-year sentence. This is the despicable show trial by Putin and his cronies. Clearly, the corrupt Russian court system is helping Putin punish his political opponents and muzzle anyone who dares speak the truth about his barbaric invasion and genocide he's committing in Ukraine. These are the kinds of gross human rights violations the Magnitsky Act was designed to address. If Russia refuses to bow to pressure and release Vladimir Kara-Murza, the full force of sanctions must rain down on all responsible for this abuse of authority. Vladimir Kara-Murza is a political prisoner, a prisoner of conscience, a human rights defender. Canada must speak out on the international stage and forcefully call for his immediate release.
The honourable member for Halifax West. Merci, Madame la Présidente.
Thank you, Madam Speaker.
The 30th Annual Women's History Month in Canada. This year's theme, Elle m'a ouvert la voie. She did, so now I can. I want to take this opportunity to praise the amazing women-led and women-serving organizations in our communities. In Halifax West, I want to give a shout-out to the Centre for Women in Business at Mount St. Vincent University, celebrating 30 years of helping women entrepreneurs this year. The Sisterhood of Deman Foundation, a group of Canadian women with kinship to their ancestral village of Deman, a small village overlooking the Kadisha Valley in Lebanon, who last month raised $160,000 to support the education of youth from Deman.
As we commemorate Women's History Month, we are motivated to follow in their footsteps and reflect on what each one of us can do to create a more equitable society. Thank you. The Honourable Member for Thérèse de Blainville. Madam Speaker, I would like to pay tribute to a citizen of my riding and former mayor of the city of Blainville, Richard Perrault, for his great contribution to the vitality of the region. Mr. Perrault has a remarkable record of public service. He has served the citizens of the city of Blainville for more than 16 years, first as a municipal councillor, then as mayor, and also as reeve of the Thérèse de Blainville MRC. Mr. Perrault has greatly contributed to the vitality of Blainville, which has more than once been named one of the top cities to live in. In recognition of his immense contribution, the City of Blainville has decided to name the VIP room of the Centre of Excellence on Ice after him. This is a highly deserved honour that reflects well on him. Congratulations, Mr. Perrault, for your achievements marked by deep commitment.
L'honorable député de Mercorel-Fortin.
Monsieur le Président.
Mr. Speaker, today I want to pay tribute to a man who practices a trade that is on the verge of extinction, that of shoemaker. Serkis Berijiksan is the owner of the Jean-Paul II shoe repair shop in the Old Saint-Rose district of Laval, a typical cobbler of the 1970s. Mr. Berijikan was born in 1946 in Syria and moved with his parents to Lebanon. He trained as a shoemaker in Lebanon, his adopted country. He arrived in Canada in February 1988 and opened his cobbler shop in 1991. Mr. Berijikan is a professional and friendly shoemaker who offers high-quality work at a good price. Even at age 76, he is still passionate about his craft. As we often say, we need to encourage our local merchants.
The Honourable Member for York Simcoe.
Mr. Speaker, I rise today with a heavy heart, along with my colleagues from Barrie Ennisville and Barrie Springwater Oro-Medonte, to honour Constable Devin Northrup and Constable Morgan Russell, members of the South Simcoe Police Service, who tragically fell in the line of duty last week. These brave men gave everything they had to protect their communities and ultimately sacrificed their lives doing so. Their incredible courage, their commitment to duty and service will not be forgotten by the grateful residents of Bradford, West Gwillimbury, and Innisfil, and all Canadians. Though we cannot imagine the heartbreak and grief their families and colleagues are going through, I hope it gives some solace to know that Constables Northrup and Russell will always be remembered as heroes. This senseless tragedy is a sobering reminder of the debt we owe those who wear the badge and the very real risks of their calling. I ask all members on behalf of Canadians to join me in showing gratitude to the sacrifice made by Constable Northrop and Constable Russell. Thank you.
The honourable member for Oakville North Burlington.
Thank you, Mr. Speaker. It's Small Business Week, and I'd like to highlight two small businesses in my riding that I visited last week. Yoga-tastic for Kids is a heart and mindfulness business owned by Sandra and Rich, providing various yoga and mindfulness programming that caters to children and adults in their beautiful Burlington studio. Crepe Presso is owned by Mohe and Farah, who moved to Canada as Syrian refugees in 2015. In September, they opened their family-owned and operated business in North Oakville, welcoming all sweet tooths and those who love crepes and coffee. I'd also like to acknowledge the support provided by the Burlington and Oakville Chambers of Commerce to small businesses. In particular, my friend France Fournier, whose leadership and inclusion efforts have not gone unnoticed since her appointment as President and CEO of the Oakville Chamber in January of this year. Thank you to the small businesses and those that support them this week and every week.
The honourable member for Fleetwood Port Kells.
Thank you, Mr. Speaker. This is indeed Small Business Week, and it's a great time to salute those small and medium enterprises that truly are the foundation of Canada's economy. And it's just as great a time to recognize the people who work so hard to support those businesses. People like Dean Barber of our Fleetwood Business Improvement Association, or Balja Dalwal and Anita Huberman of the Surrey Board of Trade. Their tireless work has been backstopped by our government's pandemic supports, the Canada Child Benefit, and so many other programs. Our government's focus on supporting people who really need some help works, because that money is spent close to home at our local businesses. That's why, unlike the previous Conservative government, we don't send checks to millionaires, and that's why we have more small businesses open for business in Fleetwood Port Kells today than before the pandemic. All in all, we're a great team making a big difference for families, small and medium-sized businesses, and a strong community. Thank you.
The honourable member for Peace River Westlock.
Well, thank you, Mr. Speaker. Mr. Speaker, the new Conservative leader will put the people first, their paychecks, their savings, their house, their country. And he'll put farm families first who have been busy harvesting in the fields. Rain or shine, hail or snow, these folks measure their time in acres, not hours. Farming isn't a job, it's a way of life. It's a heritage, it's a calling. From before the sun gets up to long after it sets, they ensure that the rest of Canada, when they head to the store, there's food on the shelves. It's simple. Farmers feed families, Mr. Speaker. To those farmers who are listening, thank you. Thank you for giving up the meals at your table so that my family can have a meal at ours. Thank you for being a wonderful example of hard work, faith, and dedication. Thank you for being stewards of the land, keeping it healthy now and for future generations. And when the Liberal government belittles you and thinks they can tell you how to do your job with carbon taxes and fertilizer reductions, know that on this side of the House, you are, and always will be, heroes. We will never stop fighting for Canada's farm families. Thank you very much.
The honourable member for Canada Carleton.
Mr. Speaker, I am absolutely outraged, furious. The anti-feminist hashtag used by the leader of the Conservative Party is a portal to some of the darkest, most hateful material on the internet. User of the hashtag supports terrorizing women, banning homosexuality, and legalizing rape. It's not a common hashtag. It's a hashtag of a dark internet subculture. Its use by the leader of the opposition was deliberate, strategic, and dangerous. Now under scrutiny, he pretends to have no recollection of the hashtag's use and its consequences. Really, Mr. Speaker? This is beyond locker room talk. This is violent misogyny. I hope Canadians recognize that this is not leadership. This is reprehensible behavior that is dangerous and is divisive, and it is not welcome in this country, let alone this House. Thank you, Mr. Speaker.
The honourable member for Saskatoon Grasswood.
Thank you, Mr. Speaker. Inflation is at a 40-year high. Thanks to this Liberal government's plan, the cost of food, the cost of transportation, and home heating is skyrocketing. Now we learn that home heating prices will go 50 to 100% more this winter. In my city of Saskatoon, we've seen a dramatic increase in the use of the food bank from 13,000 a month to over 20,000 people a month. Seniors in my constituency are already grappling with day-to-day expenses. The Liberal plan to triple the carbon tax in the new year will only make it more difficult for families and seniors to keep up with the cost of living. Our new Conservative leader will put people first.
Hear, hear.
Protect their paychecks, their savings, their home, and protect their country. We will continue to fight this dismal Liberal carbon tax.
The honourable member for Mission Matsuki Fraser Canyon.
Mr. Speaker, the new Conservative leader will put the people first. Their paychecks, their savings, their home, and their country. Small business owners are the unsung heroes of the Canadian economy. These entrepreneurs employ nearly 2/3 of workers across Canada, providing meaningful paychecks to millions of Canadians. But right now, under the Liberals, small businesses are being punished with higher payroll taxes, leaving them with higher costs for every person that relies on that business for a paycheck. They are also being punished with the carbon tax. Small and medium-sized businesses have to pay the whole thing and have no choice but to pass those costs along to consumers. This has made it more expensive for Canadians to buy local, homegrown products than goods that have been flown, trucked, and shipped from other countries. This Small Business Week, Conservatives will keep working to turn hurt into hope for business owners. We stand with these risk takers and job creators. We will keep fighting the Liberal NDP coalition, plan tax increases, and call for a cap on government spending. Thank you, Mr. Speaker.
The honourable member for Bourassa. Mr. Speaker, governments are facing many challenges such as war and inflation, and I would like to make the House of Commons aware of the crisis that the Haitian people are once again experiencing. Haiti is experiencing a multidimensional crisis, a political crisis where the absence of credible authorities and democratic institutions has led to the development of heavily armed gangs that rape women and terrorize the people, even before the assassination of former President Jovenel Moïse. A humanitarian crisis that has caused the people to suffer even more poverty and the arrival of cholera, an economic crisis with the help of oligarchs who continue to squander Haiti's resources. Corruption is on an unprecedented scale. The diaspora is very concerned about the situation. As a Canadian member of Parliament of Haitian origin, I call on all members of Parliament to show their solidarity for the dignity of the Haitian people. Thank you.
The honourable member for Winnipeg Centre.
Thank you, Mr. Speaker. Today is the International Day for the Eradication of Poverty, and I want to remind all members of this House that poverty is a political choice. It is a choice of governments not to fund and support people. It is a choice not to ask corporations and the ultra-rich to pay their fair share. It is a choice not to prioritize the crisis of poverty that is putting people on the streets, fueling a mental health crisis, and forcing people to use food banks to survive. We must make different choices, including by implementing a guaranteed livable basic income that ensures everyone can live with dignity. Poverty is a violent human rights violation, and it's time to stop picking and choosing which human rights we uphold. Mr. Speaker, Nelson Mandela said that, in quotes, "Overcoming poverty is not a gesture of charity, it is an act of justice. While poverty persists, there is no true freedom." End of quotes. Let us remember these words and work to end poverty once and for all. Thank you, Mr. Speaker.
The honourable member for Shefford. Mr. Speaker, the inflation that we are currently experiencing is difficult to bear, but it is worse for those who are already struggling. As we mark the International Day for the Eradication of Poverty, Let's keep less affluent seniors in our thoughts, seniors who were already struggling to pay for groceries before prices skyrocketed, seniors for whom every rent increase is another sacrifice in their basic needs. These people need to be supported. As we speak, there are 3 million seniors who have been abandoned by the federal government in the face of rising prices. 3 million people who, because they have the misfortune of being between 65 and 74 years old, are not eligible for any increase in their old age pension. On this International Day for the Eradication of Poverty, Ottawa must finally understand that this age discrimination does the opposite. It doesn't eliminate poverty, it exacerbates it. On this day, let's insist that the government finally address this serious lack of compassion.
The Honourable Member for South Surrey, White Rock.
Thank you, Mr. Speaker. This weekend, residents of Vancouver and the Lower Mainland cast their ballots in municipal elections, and the results are in. British Columbians rejected and repudiated left-wing politicians for the mess they've made of our cities, including kicking NDP Mayor Kennedy Stewart and all his city councillors out of office in Vancouver. Voters sent a clear message. There is too much violence on our streets and the cost of living is too high. Vancouver, Surrey, and White Rock residents elected new mayors who will get serious about violence in our communities and remove gatekeepers to build more homes. Congratulations to BC voters. You're taking back control of your lives. In the next federal election, you can count on the Conservative leader and our team to put the people first, restore safe streets, build more homes, and make life more affordable in British Columbia.
The Honourable Member for Sault Ste. Marie.
As part of Small Business Week, I want to welcome our Sault Ste. Marie Chamber of Commerce delegation, Rory Ring, his CEO, his wife, Michelle, who is also a small business owner, and Randy Shuren, secretary. Let's take a moment to reflect on the obstacles small businesses had to face during the pandemic and how we were able to adapt together. We promised to do whatever it took to support them, and we did. Now we're going to continue to work with the small business by cutting taxes for growing businesses, helping them move their services online, and improve their e-commerce. We're investing in strengthening our supply chains, as well as we're making it easier and better to export. As well, we're increasing immigration levels to help fill the worker shortage. A special shout out to all Canadian small businesses. They are our lifeblood of our economy. They create jobs, they grow our communities, and they just make us a better country. All in all, welcome all Canadian delegates.
Oral questions. Question orale. The Honourable Leader of the Opposition.
The government's costs increase the cost of living. Millions of inflationary spending increases the cost of things we buy. Inflationary taxes increase these costs even more. The Royal Bank revealed last week that inflation and increased interest rate hikes will cost every Canadian family $3,000 next year. Can this costly coalition finally realize that Canadians can no longer pay and stop raising taxes? The Honourable Parliamentary Secretary to the Minister of Tourism. Thank you, Mr. Speaker. I'd like to start by saying that we know full well that Canadians are facing higher cost of living expenses, and that is why we have set in place many measures to support Canadians. And the Conservatives decided to vote against them. A few days ago, the Conservatives finally did do a flip and decided to support our tax support measure to double the GST credit for 1,000 Canadian families. Will they do the same thing and support Bill C-31 that is before this House? The Honourable Leader of the Opposition.
Policies of this Prime Minister and the NDP mayor in Vancouver led that city to more violence, to be on track for a record number of overdose deaths, and to make that city among the most overpriced housing markets on planet Earth. But voters in Vancouver have said enough. They have fired the NDP mayor and rejected the radical policies and instead voted to remove the gatekeepers, to build more affordable homes, and bring in common sense laws to restore safe streets. Will the government in Ottawa finally get the message?
The Honourable Government House Leader.
I appreciate the leader's interest in the mayoralty campaign in Vancouver, but here in Ottawa, I have a very specific question for the member of Cross. We have an opportunity in C31, and I ask him whether or not they're going to agree to provide dental care for Canadian children across this country. It's bad enough that they won't support it, Mr. Speaker. Why won't they just let this House, the majority of whom members support it, be there for Canadians, be there for children who need dental care?
The Honourable Leader of the Opposition.
Now, it is true that Vancouver already has its own provincial carbon tax, but now the costly coalition of the NDP and this Prime Minister want to force BC to triple, and triple that tax. We already have gas prices nearing $2 a litre in British Columbia. People have voted in the Vancouver elections to reject these inflationary policies. Why won't this costly coalition get the message from British Columbia that people cannot afford these taxes and cancel their plan to triple the tax?
The Honourable Minister of the Environment.
Thank you, Mr. Speaker. Just last Friday, thanks to the climate action incentive payments, a family of 4 received in Manitoba $208, $275 in Saskatchewan, and $269 in Alberta, and in the member opposite's province, $186. And this will happen 4 times a year, Mr. Speaker. We can fight climate change and support Canadians, and that's exactly what we're doing. The Conservatives have no plan to fight climate change and no plan to help Canadians.
Thank you, Mr. Speaker. The Honourable Leader of the Opposition.
Well, they have no plan to fight climate change. What they have is a tax plan. And the Parliamentary Budget Officer has concluded that the majority of people who receive these rebates, which is not even all Canadians, get less in rebates than they pay in taxes. For example, East Coast Canadians, 40% of them, are living in energy poverty. The Liberal Premier in Newfoundland and Labrador has said that the Liberal government in Ottawa should not triple the tax on home heating. Home heating prices are expected to double this winter. Will the government get the message that heating your home in Canada is not a luxury and cancel the plan to triple the tax?
The Honourable Minister of Environment.
Thank you, Mr. Speaker. And in fact, we are helping households transition away from dirty and expensive home heating oil to more affordable and greener heating sources. And we are doing that, and we've committed to do that with our partners in Atlantic Canada, Mr. Speakers. We are working with every single province in Atlantic Canada to support programs that they have put in place, $250 million to help tens of thousands of Canadians have access to cheaper, greener energy, Mr. Speaker. We can fight climate change and help Canadians. On those 2 fronts, the Conservatives have nothing to say. Thank you, Mr. Speaker.
Honourable Leader of the Opposition.
So here we go. Trickle-down government. They scoop up the money from the hardworking people who are just trying to heat their homes, doubling home heating bills, bring the money to Ottawa, and then expect us to believe that the money is going to trickle all the way back down to the people who paid for it in the first place. Allow us to doubt that. We already know the vast majority of Canadians are paying far more in taxes than they're getting back in any rebates. Many provinces don't get any rebate at all, but yet this government wants to target seniors for the crime of heating their home. Why don't they cancel this crazy plan to triple the tax?
The Honourable Leader, the Government House Leader.
Trickle-down economics is a policy that advantages the most wealthy with the idea that those at the bottom will benefit. This party opposite, Mr. Speaker, is a party that voted against the Canada Child Benefit. This party opposite voted against raising taxes on those that have the most to give it to those that are less. But I have a question for the member right now. There's an opportunity, Mr. Speaker. The member opposite has an opportunity.
It's okay, we can continue. I believe the honourable member was asking a question. He can start from there.
Thank you, Mr. Speaker. I simply want to know, if they don't support trickle-down economics, then why don't they support dental care for children? Why, Mr. Speaker, do they not support those that are struggling right now with rent with support? They could do that. It's not bad enough they're not supporting it. At least let this House pass it, Mr. Speaker.
The honourable member for La Prairie. Mr. Speaker, last week in Washington, the Deputy Prime Minister announced Canada's new foreign and energy policy to the entire world. And what is Canada's new doctrine? Well, it's the same as the old one, selling more oil and gas. So much for the planet. The Deputy PM also announced that Canada will fast-track energy products to export more fossil fuels. It's drill, baby, drill. This confirms what many people are already thinking. Basically, all Canada did in Washington was to drive the final nail into the coffin of its fight against climate change. Is that it? The Honourable Minister of Natural Resources. Thank you, Mr. Speaker. The Deputy Prime Minister said last week exactly the same thing as I've said and as my colleagues have said in recent months. We need to have the right projects, and we have to make sure that we are looking at the environmental effects, and also we have to have a conversation with Indigenous groups. But of course, we want to have the right projects to move forward. The Honourable Member for La Prairie. That's the Minister of Natural Resources who answering. That just says everything. So the Deputy PM in Washington reveals deep down that Canada was just looking for an excuse to sell more oil and gas, and she found one. And now suddenly, so much for climate change, and we're just going to export more fossil fuels. They're in it for the glory, Mr. Speaker. The government is trying to use the war in Ukraine to sell more oil despite the climate crisis. So who wrote the Deputy PM's new foreign policy? Is it the leader of the Conservatives? The Honourable Minister of the Environment. Thank you very much. I'd like to thank my colleague for his question and remind him that we have an environmental impact process that is very rigorous, and the Conservatives were against this project with their bill, but we'd made a commitment to be a provider of renewable and clean energy, and that is why the German Chancellor came to Canada to sign an agreement for wind energy. That's exactly what we're doing in Canada. We're supporting Canadian companies and Canadians to fight climate change. The Honourable Member for Rosemont-La Petite Patrie. Oil isn't renewable as far as I know. But anyway, people can no longer afford to feed themselves, and we learned that Loblaws is going to freeze prices on no-name products. It's a nice gesture, but it comes after months of inflation. We can't allow CEOs of these big companies to keep on getting richer, and the NDP has concrete solutions to support families and make these CEOs pay their fair share. Will the Liberals commit to implementing the NDP solutions outlined in the motion to be voted on this afternoon? The Honourable Parliamentary Secretary. Thank you, Mr. Speaker. I agree with my colleague. Families across Canada are having a hard time making ends meet right now, but we did present in our budget a plan to ensure that everyone pays their fair share of taxes. The government has committed in particular to asking those who prospered the most during the pandemic to pay a bit more, particularly banks and insurance companies. The largest and biggest profiteers will pay a bit more to help everyone. Thank you.
For Cowichan, Malahat, Langford.
Mr. Speaker, while grocery CEOs are making millions of dollars in bonuses, Canadians have been making difficult choices about what groceries they can afford. Today, after pressure from the NDP, Loblaws showed that it is possible to freeze prices. They just need to be forced to do it. This afternoon, Conservatives and Liberals have an opportunity to help people instead of rich CEOs who are profiting off struggling Canadians. Will this government admit they've let corporate greed go unchecked by finally voting with the NDP to defend Canadian families?
The Honourable Parliamentary Secretary.
Mr. Speaker, our government is focused on making sure that we make life more affordable for Canadians, and I'd like to thank that member and all members in this House for supporting Bill C-30, which is going to see $2.6 billion delivered to 11 million households that need it the most. That includes more than 50% of seniors, Mr. Speaker. We have a chance to do more with the recovery dividend. We have a chance to do more with the 1.5% tax on excess profits from banks and other corporations. There's lots more work we can do in this place, and we're going to do it, Mr. Speaker.
The honourable member for Calgary, Forest Lawn.
As an immigrant to Canada, whose family came here with little, through the grace of God, hard work and opportunity, it is an absolute honour to stand here as a Member of Parliament and the new finance critic for the Conservative Party. But this is not the reality for many newcomers and low-income families. Because of unjust inflation and rising taxes, it's impossible for families to make ends meet. When will this Liberal government have some mercy and get rid of this unjust tripling of the carbon tax?
The Honourable Parliamentary Secretary.
Mr. Speaker, I'd like to start by congratulating the member opposite for his new role, and I hope that we can work together to make life more affordable for Canadians and to work on affordability, just like his predecessor did when their party supported C-30, which was a measure to double the GST benefit. I hope now that he can use the newfound power that he has in his critic role to challenge his own party and ask them why. Why are they obstructing our measures to make sure that kids who need it most can get their teeth fixed? Please use your power responsibly.
Honourable member for Calgary, Forest Lawn.
Mr. Speaker, Canadians are about to get hit with an almost 100% increase in their home heating and electricity bills just this winter. Banning and cancelling good energy projects in Canada by this Liberal government has led to Canadians paying more for heating their homes, filling up their gas, and buying groceries. Canadians are already suffering from Liberal-made inflation, rising rents, and the carbon tax, which they plan on tripling. Will the Liberal government end their plans to triple the carbon tax, or do they want to leave Canadians in the dark and in the cold?
The Honourable Minister of the Environment.
Thank you, Mr. Speaker. 10 Prime Ministers ago in 1970, a program was created to help Canadians face the impacts of natural catastrophe in this country. $8.5 billion have been paid since 1970, but a third of that was paid in the last 6 years, Mr. Speaker. The cost of natural catastrophe is increasing in Canada. Go and talk to people in Atlantic Canada. If they don't care about the finances, then maybe they'll care about human suffering, Mr. Speaker, and loss of life due to climate change. They have nothing to say about that, Mr. Speaker. We do.
Honourable member for Lakelands.
Well, Mr. Speaker, this government should actually be concerned about Canadians who are struggling to make ends meet. Now, Canada has shot rapidly up a global list. For what? For being the 25th most expensive country to live in out of 195. And even though a year ago the Bank of Canada governor talked about deflation, he now admits Canada's 40-year high inflation is increasingly self-inflicted by this government. Canadians can't afford to eat, heat, or drive under the NDP Liberal Costly Coalition. So will they cancel their plans to triple their taxes on everything?
The Honourable Minister of Employment.
In this House will have an opportunity very soon to vote in favour of C-22 and make life way more affordable for persons with disabilities living in poverty. You could also make life more affordable. One could also make life more affordable, Mr. Speaker, by voting in favour of dental for kids with disabilities or rent for low-income persons with disabilities. There's a lot of important decisions to be made, and I hope the other side will understand how we can make life more affordable for everyone.
Honourable member for Lakeland.
Mr. Speaker, it's these Liberals that are making life more expensive for every single Canadian. They're so out of touch. Healthy groceries are up 15%. Home heating costs will double for most Canadians this winter. It will triple, up 300% for some. And almost 1 million Canadians can't heat their homes already. Gas bills increased 50% since last year. Diesel spiked a record 13% this weekend. But these NDP Liberals are going to make everything more expensive and hike taxes on all essential goods. So will they cancel their plans to triple their cruel carbon tax?
The Honourable Minister for Families.
Conservatives have an opportunity to demonstrate that they do care and want to help low-income Canadians. They have several opportunities. In fact, they could support the bill for dental care for low-income children to get their teeth fixed. They could support the bill that's going to put $500 into the pockets of low-income renters. They could support the bill that's going to provide a disability benefit for Canadians with disabilities. Mr. Speaker, there are lots of opportunities for Conservatives to demonstrate in this House how they care for Canadians. I just don't understand why they won't. Thank you, Mr. Speaker.
The honourable member for Charlebourg-Saint-Charles. Mr. Speaker, since 2015, the Liberals have increased Canada's debt than all previous governments combined. In 2021, before interest rates rose, they spent $20.2 billion just to pay interest on this debt. The PM and his finance minister said we could afford deficits because interest rates were low, as if there was no risk. And we saw that over the past year, interest rates have risen and have dramatically increased the cost of living for Canadians. When will this Prime Minister stop his plan to triple the carbon tax, which is increasing the cost of living? The Honourable Parliamentary Secretary. Mr. Speaker, allow me to correct the facts. First, Canada has one of the lowest deficits in this G7. We have shown fiscal responsibility that is absolutely incredible, and other countries envy this. I'd also like to state that the Conservatives seem to want to attack our system to face the climate crisis. I find that strange to have this question from a colleague and member from Quebec. And we know that Quebecers absolutely want to tackle climate change, Mr. Speaker. The honourable member for Charlebourg-Saint-Charles. Mr. Speaker, what's clear, in the last 2 years, the Liberal government has deepened the debt. They've added $500 billion in deficit, and the PBO said that there were $200 billion that had nothing to do with COVID, and this is a waste of public funds. And when interest rates go up, they even have to pay more for servicing this debt. The Liberals want to hurt Canadians more who are suffering economically. They don't want to stop this tripling of the carbon tax. Will they finally abandon this plan? The Honourable Parliamentary Secretary. Mr. Speaker, the Conservatives are attacking our plan to fight climate change, but even worse, the Conservatives are attacking our system here in Canada that will support workers. For example, EI, and the Conservatives continue to attack our seniors. They're attacking our pension system. We absolutely have to protect our retirement system here in Canada, and the Conservatives don't want to know anything about this. The Honourable Member for Avignon-La-Métis. Mr. Speaker, when the Minister of the Environment approved Baie du Nord, he suggested that it would be the last oil project he would allow. But last week we learned that it was probably just the beginning. The Canada-Newfoundland Board has just issued calls for bids for oil exploration in 100,000 square kilometers of the province. My question is simple. If Baie du Nord was the last oil project the minister would allow, why did his government why is it still launching bids to fund more oil off of Newfoundland? The Honourable Minister of the Environment. Thank you. I'd like to thank my colleague for her question. I'd like to remind her that that board is independent from the federal government, and also that all new projects for energy production have to be subjected to the environmental impact process. And we have some of the strictest regulations for methane emissions in the world, not just in the G7. By 2030, we have the strictest rules for methane. The Honourable Member for Matisse-Lamatane. The government continues to encourage oil exploration in the middle of Newfoundland's marine refuge. Usually when you look for something, it's because you're hoping to find it. And even worse, the government is allowing these drilling companies to bypass the impact assessment. In the midst of a climate crisis, the Liberal government wants to increase oil production, and it continues to look for it at sea, and it wants to produce more to pollute more. Is the former environmentalist, the Minister of the Environment, still able to look at himself in the mirror? The Honourable Minister. I'd like to thank my colleague to be concerned about my image to that extent. But what's important for us is establishing the facts. And I think she knows that the leader of the bloc approved drilling in Anticosti without any public consultations and assessments. So that's not how we're going to work on this side of the House, Mr. Speaker. The honourable member for Salaberry-sur-Roi. Mr. Speaker, that is exactly in line with the new doctrine that Canada announced in Washington last week. Canada unveiled that its new foreign and energy policy is to put the pedal to the floor to sell more oil and gas to its allies. And it's already begun. That's exactly what they're doing right now in Newfoundland, allowing oil exploration without any environmental impact assessments to make it go faster. Mr. Speaker, where is the fight against climate change in this energy policy? The Honourable Minister. Thank you, Mr. Speaker. I'd like to remind my colleague that we're putting our foot to the metal for energy projects that are renewable. And we have wind projects at sea, and they will be the greenest in the planet. And that is why the German Chancellor came here to Canada to sign a contract, because Canada will be a top project for the green transition, not just in North America, but across the planet.
For Lethbridge.
The Prime Minister is spending like a drunken sailor. As a result, inflation is excessive. As a result, Canadians are finding it difficult to make ends meet. As a result of that, many Canadians are cutting back on the amount of healthy foods that they purchase and consume. Now the Prime Minister is planning to triple the carbon tax, which will again increase the cost of groceries, home heating, and gasoline for people's vehicles. In other words, the cost of living will hike up once again. Will the Prime Minister exercise some compassion and, for the sake of Canadians, stop his plan to triple the carbon tax?
Well, Parliamentary Secretary.
Mr. Speaker, the Leader of the Opposition, that member, the entire Conservative Party, continues to put forward policies that actually put the future of Canadians at risk. That's right. They do that by telling us to stop fighting climate change. They do that by telling us to raise the pensions of seniors. They do that by telling us that child care and dental care isn't important. It's about time we came together in this House to focus on what matters, which is making life more affordable and making sure that we grow an economy that works for everybody.
For Lethbridge.
I understand the Liberal talking points, and so do Canadians. They've heard them again and again and again and again. It's rather disingenuous and incredibly repetitive, but the reality is, to the Canadian families that are struggling to make ends meet, those talking points don't make the difference. Yes. What makes the difference is when this government exercises responsibility and cuts back on taxation and makes life increasingly affordable for Canadians. So I'll ask again on their behalf, would this government exercise some compassion, and would the Prime Minister commit today to ending his plan to triple the carbon tax?
The Honourable Minister for Family.
Mr. Speaker, let's be clear what the results are in each side of the House. Canada Child Benefit that our government brought in, they voted against it. Middle class tax cut that we brought in, the Conservatives voted against it. The Canada-wide Early Learning Childcare Initiative that is delivering a 50% fee reduction already to families in that member's riding of Lethbridge and across her province of Alberta, that party, the Conservatives, voted against it. Mr. Speaker, they have an opportunity to vote in favor of dental care for low-income children, to vote in favor for rental support for low-income workers, to vote in favor of supports for Canadians with disabilities. If they care about low-income Canadians, I hope we see their support. Thank you.
The Honourable Member for King Vaughan.
Buongiorno, Signore Presidente. Canadians are struggling because of the inflation caused by this Prime Minister. More Canadians are turning to their local food banks for support. Senior usage of food banks has increased 30%. According to the CEO of Toronto Food Bank, nearly triple the number of people visiting the food bank in June 2022 compared to June of 2019. Those are his words. These Liberals have caused the cost of living crisis. Will this Liberal scrap the planned tax hikes?
The Honourable Minister for Seniors.
take any lessons from the party opposite, whose plan for seniors was to raise the age of retirement to 67. Mr. Speaker, one of the very first things we did as a government was to reverse that back to 65. We increased the guaranteed income supplement. We put more money into the pockets of seniors by increasing the old age security by 10%. We're doubling the GST credit, Mr. Speaker. That's our record for seniors, Mr. Speaker, and we're going to continue to deliver for them.
The honourable member for Skeena-Bulkley Valley.
Mr. Speaker, Canadians were shocked to learn that the ArriveCan app cost this government $54 million. That's more than twice the original estimate. But wait, it gets better. Last week we learned that most of that money went to a company with no offices and only 5 staff. This government was using this company to shield subcontractors from accountability and transparency. Canadians want answers. They deserve to know where their money went. Will the government finally take accountability and disclose all the companies that got money from the ArriveCan contract?
The Honourable Parliamentary Secretary.
Thank you, Mr. Speaker. Our government has been focused on protecting the health and safety of all Canadians throughout the COVID-19 pandemic. PHAC and CBSA launched ArriveCan in April 2020 to support the government for Canada's efforts to limit the spread of COVID-19 and ensure border security. The ArriveCan app costs less than $1 million, Mr. Speaker, to develop and ensure security of privacy and accessibility for all users. We will continue to ensure the safety and protection of all Canadians. Thank you, Mr. Speaker.
The honourable member for Winnipeg Centre.
Mr. Speaker, while Canadians are struggling to make ends meet, Ontario is allowing for-profit childcare to gouge parents. After signing an agreement with the federal government, Ontario removed profit caps and reduced the oversight for for-profit childcare centres. This means higher fees for parents and lower wages for staff to maximize profits. This morning, the Prime Minister stood with Premier Doug Ford. Did the Prime Minister tell the Premier that removing limits on for-profit childcare doesn't work, and will he ensure that federal money is not going to for-profit care? Thank you, Mr. Speaker.
Honourable Minister for Families.
Thank you, Mr. Speaker. Let me be very clear. There is a cap in fees in Ontario for all registered childcare providers going back to the time that we signed the agreement on March 28, 2022. But let me share some good news with you, Mr. Speaker. We are moving forward expeditiously with affordable childcare here in Ontario, and by December of this year, families in registered childcare will receive a 50% reduction in fees. This is fantastic news for families in Ontario. In fact, I was in Sudbury on Tuesday, where families are already receiving rebates, and will continue to roll this out throughout the province.
Member for Don Valley East.
Thank you, Mr. Speaker. We know that EI sickness benefits are an important support for Canadians who need to leave work because of illness or injury. We also know that many workers face stressful income gaps between when they exhaust their benefits and when they're healthy enough to go back to work. And that's why in Budget 2021, our government extended EI sickness benefits from 15 to 26 weeks. Can the Minister please share with this House more details about this important extension?
The Honourable Minister of Employment.
Thank you, Mr. Speaker, and thank you, the member from Don Valley East, for his tireless work on behalf of his constituents and all Canadians. Indeed, we recognize that Canada needs an EI system that is fair, flexible, and more responsible to the needs of workers and employers, and that's why we're so excited, and I'm excited to let this House know that by the end of this year's worker will have access to 26 weeks of EI sickness, so they have more time to recover and get back to work safely and in health.
Honourable member for Sarnia-Lambton.
Mr. Speaker, analysts are saying that home heating prices in some places will increase by 300% this winter. That's triple, triple, triple. The Prime Minister's planned increases to carbon tax and payroll tax is a cold-hearted action. The Liberals are literally freezing Canadians out. Is it just inflation, or will this government cut their planned taxes?
The Honourable Minister of the Environment.
Thank you, Mr. Speaker. I think Canadians expect responsible leaders across all members of this House need to address both the affordability issue and the climate crisis. We are certainly working very hard to address affordability issues through doubling the GST tax credit and a range of other things. I do find it very interesting, though, Mr. Speaker, that during the last election campaign, every member sitting in the Conservative Party campaigned on the basis of putting into place a carbon tax. And so this conversion on the road to Jerusalem is very interesting indeed.
The honourable member for Halliburton, Kawartha Lakes, Brock.
Speaker, the Liberals' out-of-control spending and tax hikes are increasing the cost of everything. Food prices in remote Indigenous communities are 2.5 times higher than the national average, and rising fuel prices are just compounding inflation's economic toll on families absolutely everywhere. While the minister monitors the situation, families are struggling with food and heat this winter. So when will this government cancel their tax hikes and cap their spending?
Great question.
The Honourable Parliamentary Secretary.
Mr. Speaker, let's be very clear. When the Conservatives talk about payroll taxes, they're talking about EI, a rate which is lower today than it was when the Leader of the Opposition was in charge of the file. They're talking about the Canadian Pension Plan. We came together with premiers to strengthen the Canadian Plan and make sure that there was more money in the pockets of seniors when they retired, right when they needed it, and the Conservatives are trying to take that away. And when they're talking about carbon pricing, they're talking about a revenue-neutral plan that puts more money in the pockets of 8 out of 10 Canadian families.
Member for Cumberland, Colchester.
Thank you, Mr. Speaker. Certainly, Canadians don't believe their plan to tax us more is revenue neutral. Energy costs are expected to rise by double or, sadly, triple this winter. This is a tremendous burden for Atlantic Canadians. We are already suffering from the cost of living crisis, and of course, Hurricane Fiona has taken a just inconceivable toll on Atlantic Canadians. Why does this Prime Minister want to punish Atlantic Canadians by tripling, yes, I said tripling the carbon tax, and will they agree to end it?
The Honourable Minister for Rural Development.
Mr. Speaker, and I'd like to thank the Honourable Mention for his reference to rural and especially to Atlantic Canadian and Quebec Canadians, as we did fear the brunt of Fiona. I can tell you that the federal government is there to help with a disaster financial assistance arrangement between the provinces, with another $300 million administered through HoC to help the agencies and the communities and those that are falling through the cracks. We will be there for Atlantic Canadians and Quebec Canadians as they battle these storms. That's why we need to address climate change. Ask anybody in my hometown of Port aux Basques if they believe in climate change. They certainly do, Mr. Speaker.
The Honourable Member for Peterborough, Kawartha.
Mr. Speaker, Canadians are at a breaking point. 51% are only $200 away from bankruptcy. And this government's proposed solution, more tax, freezing them out of their homes if they're lucky enough to even have one. They're going to triple the carbon tax on groceries, triple the carbon tax on home heating, and triple the carbon tax on gas. Canadians need hope. They need a break, not more tax. Families need to not choose between buying a winter coat for their children or food on the table. When will the Liberals do the compassionate thing and stop their triple tax hike?
The Honourable Minister for Families.
You know, Mr. Speaker, the member opposite raised some important points about the struggles that Canadians and Canadian families are having right now. But she and her colleagues actually have an opportunity to help. There are several pieces of legislation on the floor of this House right now that would actually support Canadians make those ends meet. I don't understand why they don't want to help low-income Canadian children get their teeth fixed. I don't understand why they don't want to help Canadians with disabilities get a benefit. I don't understand why they don't want low-income renters to get a top-up. Mr. Speaker, they have an opportunity, the Conservatives have an opportunity to demonstrate.
Le député de Thérèse de Blainville.
Mr. Speaker, the pandemic led to a $26 billion debt for the Employment Insurance Fund, but it's not up to taxpayers alone to assume this burden. Neither workers nor companies are responsible for the pandemic or its consequences. The EI Commission even mentioned its concern about the burden the government is leaving to taxpayers. Will the government absorb the EI debt from March 2020 instead of passing on the entire bill for the pandemic to workers and to businesses?
Le ministre de l'Emploi.
The Honourable Minister of Labour. We understand that Canadians deserve an EI system that is effective, and adequate. That's why we're working so hard to improve it and to modernize it. We will reveal our plan before the end of the year. I'm very excited about it, and I'm sure everyone will love it. The Honourable Member for Thérèse de Blainville. Mr. Speaker, I'll remind everyone that the reason unemployment rose during the pandemic was because the government asked businesses to close, and consequently, workers were unemployed. It was the right decision at the time, of course, but it's the responsibility of the government to deal with the consequences of that decision. In the case of CERB, the government is using the Consolidated Fund to shoulder the debt. Why is it refusing to accept the EI debt when those benefits were paid for the same reasons caused by the same pandemic? The Honourable Minister. We have been there for workers and businesses during the pandemic, and we will continue to do so. We will modernize our EI system. That way, if there's another pandemic, we will be ready and we'll be able to better help employers and workers.
Paul.
There's been a 32% increase in violent crime, with over 124,000 more violent crimes last year than in 2015. Wow. Under this Prime Minister, Canadian streets are less safe. That is fact, Mr. Speaker. Clearly, their approach to prioritizing the needs of criminals over victims is not working. When will this Prime Minister finally get serious and start protecting Canadian families from violent offenders, Mr. Speaker?
The Honourable Parliamentary Secretary.
Thank you, Mr. Speaker. Too many Canadians have been hurt by gun violence, and our government ran on the promise to redouble Canada's efforts to tackle this issue. We always put the safety of Canadians as our #1 priority. That plan includes banning and buying back assault rifles, freezing the national handgun market, raising sentences for gun smugglers, and my hope is, Mr. Speaker, that the honourable member across the aisle will support Bill C-21 in committee and allow us to keep Canadians safer.
The honourable member for Fundy Royal.
Well, Mr. Speaker, they could start by listening to victims of crime. Charlene Bosma testified at our Justice Committee that the one bit of solace that she had after her husband Tim Bosma was brutally murdered was that her daughter would never have to face her father's killer at a parole hearing. But since this Liberal government has failed to respond to the Supreme Court's decision to allow mass murderers the opportunity for parole, this one shred of peace has been ripped away. Will this Liberal government act and end parole hearings for mass murderers?
Hear, hear. The Honourable Minister of Justice.
Mr. Speaker, serious crimes in this country will always be dealt with seriously. What we are doing on a variety of fronts, Mr. Speaker, is being smart on crime so that we can dedicate more resources to precisely attacking the kinds of crimes that my honourable member has raised, Mr. Speaker. We'll continue to go in that direction as former Supreme Court Justice Michael Moldaver, someone who can never be accused of being soft on crime, Mr. Speaker, has stated. We absolutely need to dedicate more of those resources in the system to fighting precisely these kinds of crimes.
L'honorable député de Chicoutimi-Le-Fjord.
Mr. Speaker, in 2021, the Greater Montreal area hit its highest homicide level in 10 years. This year, we're on track to surpass that unfortunate statistic. Last week, authorities found a dead body in a recycling bin. In August, there was a triple homicide. Last week, a man was stabbed in the Baudry metro station. Mr. Speaker, why does the government want to remove minimum sentences and is working to improve outcomes for criminals instead of protecting victims? The Honourable Minister of Justice. Mr. Speaker, Canadians' safety and security is our absolute priority. We are working with victims to make the system safer. With Bill C-21, we are increasing penalties for gangs and for trafficking in firearms. We're going to reinforce firearms prohibitions that are there. This is what we are doing. And that's what we need to do to make Canada safer. The honourable member for Châteauguay-Lacolle. Thank you, Mr. Speaker. Over the past few years, I've seen many small businesses in my riding of Châteauguay-Lacolle move to online shopping and upgrade the technologies they rely on. This means they're growing faster, making higher sales, and exporting more. Can the Minister of International Trade, Export Promotion, Small Business and Economic Development explain how our government is helping more small businesses succeed in the digital economy? The Honourable Minister.
Au cours de la nous avons vu l'ingéniosité des propriétaires des petites.
We are helping owners of small businesses to adopt digital technologies and engage in more digital trades. That's why we have invested $4 billion in the Canadian Digital Adoption Program. We are going to make sure that small and medium businesses are on the cutting edge. Thank you.
Member for Mission-Matsky, Fraser-Cunningham.
Mr. Speaker, Canadian small businesses are struggling to stay open. In fact, 1 in 6 say they are considering shutting their doors. The CFIB has urged this government not to burden workers and employers with extra costs at a time when inflation has skyrocketed. Yet on January 1st, the Liberals plan to increase payroll taxes, putting further strain on business owners and providing less take-home pay for workers. So my question today, Mr. Speaker, is very simple. Will this government rescind their plan to increase payroll taxes on January 1st?
Good question. The Honourable Parliamentary Secretary.
Monsieur le Président, je trouve ça vraiment décevant.
Mr. Speaker, I find this really disappointing because we're talking about contributions that Canada are making that will come back to them. In the case of pensions at their retirement, Canadians will be able to benefit from their pension in order to retire with dignity. When it comes to safety of our workers and EI, we know that we are living in a significant unstable moment in terms of the economy. So we are going to be there to support workers as they need it.
North. Thank you very much, Mr. Speaker. It's Small Business Week, and they are worried. A recent survey shows businesses' confidence in the economy is at the lowest point since the pandemic started. 75% of businesses believe inflation will be over 3%, and they are worried about rising costs. This includes payroll taxes and the carbon tax, for which there is no rebate. With the future of the economy uncertain and small businesses worried, will this government cancel its planned tax increases on small businesses next year?
Great question. Honourable Minister.
Mr. Speaker, I want to thank the honourable member for that question, but let's remember something. It is this government that has been there for small businesses every single time. We've been there for them since the pandemic. We've been there for them during the illegal convoy. We have been there for them in the recent aftermath after Hurricane Fiona. We will always be there standing up for small businesses. We've cut their taxes to help them grow. We've helped businesses export. We're helping all businesses, including women-owned businesses, Indigenous businesses, Black-owned businesses, and we're going to keep doing that. Thank you, Mr. Speaker.
The Honourable Member for Calgary, Rocky Ridge.
Well, Mr. Speaker, the inflation crisis triggered by the Prime Minister's out-of-control spending and borrowing is devastating small businesses.
That's right.
Small businesses want to increase wages and pay off their COVID debts, but half of them have still not returned to normal revenue. These businesses and their workers can't afford higher payroll taxes and an ever-increasing carbon tax. Will this government cancel plans to raise the carbon tax and payroll taxes on small businesses?
Good question. The Honourable Parliamentary Secretary.
Nous savons que les petites entreprises.
We know that small and medium businesses are the essential component of our economy in Canada. That's why we were there for small businesses during the pandemic. We are always there for our entrepreneurs and our small and medium businesses. And when we talk about contributions that will be increased, that's happening next year, April 2024. These are contributions that are going to come back to employees through EI and come back to Canadians through their pensions.
Or Whitby.
Mr. Speaker, today marks the start of Small Business Week. In my riding of Whitby and all across Canada, small businesses are the heart of our communities and the backbone of our local economies. This Small Business Week, we are celebrating the incredible creativity, hard work and grit of small business owners and their many successes. Could the Minister of International Trade, Export Promotion, Small Business and Economic Development please share with Canadians what our government has been doing to support small businesses all across the country?
The Honourable Minister of International Trade.
I want to thank the honourable member for that really important question, and happy Small Business Week to all of the incredible entrepreneurs and businesses across the country. We have been there for small businesses right from the very beginning through this heart-wrenching pandemic that everyone has gone through. We've supported small businesses during the illegal convoy. We have supported businesses in Atlantic Canada after Hurricane Fiona. We're cutting businesses for small businesses so that they can grow. We are helping them export. We are helping them get access to the international marketplace so that they can flourish and contribute to their economy. So during this Small Business Week, I want to wish all of our small businesses happy Small Business Week.
The Honourable Member for Edmonton Strathcona.
Mr. Speaker, for 8 months, Ukrainians have heroically defended their country against Putin's genocidal invasion. Yet the government's response has been slow and ineffective. The sanction regime is a mess with no enforcement and no accountability. The humanitarian aid and the supplies for Ukraine that the government has promised have not been delivered. Even Ukrainian MPs have said Canada's response is just unexplainable. And now, the Conservative Premier, Danielle Smith, says that Ukraine should submit. Ukraine needs and deserves our support. When will this government finally act to support Ukrainians?
The Honourable Minister of Foreign Affairs.
Thank you, Mr. Speaker. Of course, I understand our frustration to what's going on in Ukraine, and of course we have to do more. But, Mr. Speaker, we have done a lot since the beginning of this illegal invasion. And we have put sanctions over entities and people to 2,000 people. We've put $3 billion on the table in terms of financial assistance, military assistance, humanitarian aid assistance. But indeed, we need to do more, and we'll do more. Thank you.
L'honorable député de Richmond-Arthabasca.
Monsieur le Président, dans ma circonscription.
Mr. Speaker, in my riding, there is a young 19-year-old woman, Emmy Pruneau, who's been diagnosed with an incurable cancer. To slow the progression, she needs a medication, tazemetostat. The problem is that it was approved by Health Canada in 2020, but it's impossible for doctors in Canada to get a hold of it, even though it is for sale in the U.S. and the United States. Doctors have already had to amputate one of her arms, and if nothing is done quickly, her life expectancy can be counted in weeks. My question to the Minister of Health is simple. Will we raise administrative obstacles to ensure that Emmy can have access to that medication? All she wants is to live. The Honourable Minister. I want to thank my colleague, the member for Richmond-Arthabasca, for being sincere and honest regarding this extremely difficult situation for this person in his riding. I invite him to communicate directly with me so that we can ensure that we do absolutely everything to get the care that this individual needs in order to support her and all of her loved ones. I'm afraid that's all the time we have for question period today.
I wish to draw the attention of members to the presence in the gallery of the Honourable Matthew McKay, Minister of Social Development and Housing for the province of Prince Edward Island. I understand that there have been discussions among representatives of all parties in the House and that there is an agreement to observe a moment of silence in honour of the fallen police officers from South Simcoe Police Service in Innisfil, Ontario. Please rise. comme il est 15h10, conformément à la...
It being 3:10, pursuant to order made on Thursday, June 23, 2022, the House will now proceed to the taking of the deferred recorded division on the motion of Mr. McGregor relating to the business of supply.
La question est la suivante.
The question is as follows.
Mr. McGregor, seconded by Monsieur Boulderis, moved that given that, one, big grocery stores have made massive profits in the past year, not long after several were investigated for bread price fixing. Deux, le salaire des...
Two, workers' wages and the prices paid to producers in the agricultural sector are not keeping up with those corporate profits or with inflation.
Ni même que l'inflation. Three, Canadian families are struggling with the rising cost of essential purchases. The House call on the government to recognize that corporate greed is a significant driver of inflation and to take further action to support families during this cost of living crisis, including A, contraignant
A, forcing CEOs and big corporations to pay what they owe.
No, okay. Okay, I won't start over, but I will not dispense. A, contraignant.
A, forcing CEOs and big corporations to pay what they owe by closing the loopholes that have allowed them to avoid $30 billion in taxes in 2021 alone, resulting in a corporate tax rate that is effectively lower now than when this government was elected.
B, launching an affordable and fair food strategy which tackles corporate greed in the grocery sector, including by asking the Competition Bureau to launch an investigation of grocery chain profits, increasing penalties for price fixing, and strengthening competition laws to prohibit companies from abusing their dominant position in a market to exploit purchasers or agricultural producers. And C,
supporting the Standing Committee on Agriculture and Agri-Food in investigating high food prices and the role of greedflation, including inviting grocery CEOs before the committee.
A témoigner devant lui. The 10-minute period for members voting electronically has started, and the House will now proceed to the vote for members participating in person.
All those in favor of the motion will please rise.
Massey.
Mr. Massey.
Ms. Kwan.
Ms. Kwan.
Mr. Garrison.
Mr. Garrison.
Ms. Blaney.
Ms. Blaney.
Ms. Idlout.
Ms. Idlout.
Mr. Cannings.
Mr. Cannings.
Mr. Johns.
Mr. Johns.
Mr. McGregor.
Mr. McGregor.
Ms. Gazan.
Ms. Gazan.
Mr. Green.
Mr. Green.
Ms. Barron.
Ms. Barron.
Mr. Bachrach.
Mr. Bachrach.
Madam Hughes.
Madam Hughes.
Ms. Zerillo.
Ms. Zerillo.
Ms. Collins Victoria.
Ms. Collins Victoria.
Mr. Bouleris.
Mr. Bouleris.
Mr. Angus.
Mr. Angus.
Ms. Matheson.
Ms. Matheson.
Mr. Desjardins.
Mr. Desjardins.
Ms. McPherson.
Ms. McPherson.
Mr. Blakey.
Mr. Blakey.
Mr. Holland.
Mr. Holland.
Mr. Macaulay Cardigan.
Mr. Macaulay Cardigan.
Mr. O'Regan.
Mr. O'Regan.
Ms. Bennett.
Ms. Bennett.
Monsieur Duclos.
Monsieur Duclos.
Ms. Qualtrough.
Ms. Qualtrough.
Mr. Rodriguez.
Mr. Rodriguez.
Ms. Anand.
Ms. Anand.
Mr. Algabra.
Mr. Algabra.
Monsieur Guilbeault.
Monsieur Guilbeault.
Mr. Wilkinson.
Mr. Wilkinson.
Ms. Hutchings.
Ms. Hutchings.
Ms. Tassie.
Ms. Tassie.
Ms. Chager.
Ms. Chager.
Madame Saint-Onge.
Madame Saint-Onge.
Ms. Cara.
Ms. Cara.
Ms. Gould.
Ms. Gould.
Ms. Ing.
Ms. Ing.
Ms. Zerowitz.
Ms. Zerowitz.
Mr. Miller.
Mr. Miller.
Madame Le Boutillier.
Madame Le Boutillier.
Madame Bibeau.
Madame Bibeau.
Mr. Hussein.
Mr. Hussein.
Monsieur Serré.
Monsieur Serré.
Mr. Casey.
Mr. Casey.
Monsieur Dubourg.
Monsieur Dubourg.
Mr. Arsenault.
Monsieur Arsenault.
Ms. Vandenbeld.
Ms. Vandenberg.
Mr. Sheehan.
Mr. Sheehan.
Mr. Sanson.
Mr. Sanson.
Ms. Jones.
Jones.
Madame Brière.
Madame Brière.
Mr. Fillmore.
Mr. Fillmore.
Mr. Garrettson.
Mr. Garrettson.
Mrs. Romanato.
Mrs. Romanato.
Mr. Lamoureux.
Mr. Lamoureux.
Mr. Fergus.
Mr. Fergus.
Mr. Oliphant.
Mr. Oliphant.
Mr. Ananda Sangari.
Mr. Ananda Sangari.
Ms. de Brussen.
Ms. de Brussen.
Madame Lalonde.
Madame Lalonde.
Ms. Dillon.
Ms. Dillon.
Mr. Assassi.
Mr. Assassi.
Monsieur El Khoury.
Mr. El Khoury.
Mr. Fonseca.
Mr. Fonseca.
Mr. Hardy.
Mr. Hardy.
Mr. Vancouverden.
Mr. Vancouverden.
Mr. Fisher.
Mr. Fisher.
Mr. Kuzmarchek.
Mr. Kuzmarchek.
Ms. O'Connell.
Ms. O'Connell.
Mr. Kellaway.
Mr. Kellaway.
Ms. Sachs.
Ms. Sachs.
Mr. Beach.
Mr. Beach.
Mr. May Cambridge.
Mr. May Cambridge.
Mr. Cedar Brampton East.
Mr. Cedar Brampton East.
Mr. Badaway.
Mr. Badaway.
Mr. Baptiste.
Mr. Baptiste.
Mr. Moff.
Mr. Moff.
Mr. Fragiscados.
Mr. Fragiscados.
Mr. Drouin.
Mr. Drouin.
Madame Martinez Ferrada.
Madame Martinez Ferrada.
Mr. Johari.
Mr. Johari.
Ms. Khalid.
Ms. Khalid.
Mr. Long.
Mr. Long.
Mr. Maloney.
Mr. Maloney.
Mr. McDonald Avalon.
Mr. McDonald Avalon.
Mr. Robillard.
Mr. Robillard.
Madame Shanahan.
Madame Shanahan.
Ms. Sidhu Brampton South.
Ms. Sidhu Brampton South.
Mrs. Zaid.
Mrs. Zaid.
Mr. Rogers.
Mr. Rogers.
Mr. Aldag.
Mr. Aldag.
Mr. Baker.
Mr. Baker.
Mr. Dong.
Mr. Dong.
Mr. Lewis Kitchener-Conestoga.
Mr. Lewis Kitchener-Conestoga.
Mr. Pulowski.
Mr. Pulowski.
Mr. Turnbull.
Mr. Turnbull.
Madame Mendez.
Madame Mendez.
Mr. Van Bynen.
Van Bynen.
Mr. Weiler.
Mr. Weiler.
Mr. Zuberi.
Mr. Zuberi.
Mr. Chahal.
Mr. Jahal.
Mr. Collins, Hamilton East, Stony Creek.
Mr. Collins, Hamilton East, Stony Creek.
Mr. Koto.
Mr. Koto.
Madame Diab.
Madame Diab.
Mr. Hanley.
Mr. Hanley.
Ms. Hefner.
Ms. Hefner.
Mr. Noor Mohammed.
Mr. Noor Mohammed.
Ms. Taylor Roy.
Taylor Roy.
Ms. Thompson.
Ms. Thompson.
Mrs. Valdez.
Mrs. Valdez.
Monsieur Poiliev.
Monsieur Poliev.
Mr. Bazan.
Mr. Bazan.
Mr. Kimmich.
Mr. Kimmich.
Mrs. Thomas.
Mrs. Thomas.
Mrs. Stubbs.
Mrs. Stubbs.
Monsieur Paulus.
Mr. Paulus.
Mr. Shearer.
Mr. Shear.
Mr. Upal.
Mr. Upal.
Ms. Landsman.
Ms. Landsman.
Mr. Halan.
Mr. Halan.
Ms. Lewis Haldeman Norfolk.
Ms. Lewis Haldeman Norfolk.
Mr. Strahl.
Mr. Strahl.
Ms. Dancho.
Ms. Dancho.
Mr. Barlow.
Mr. Barlow.
Mr. Moore.
Mr. Moore.
Ms. Bergen.
Ms. Bergen.
Mr. Godin.
Mr. Godin.
Mr. Mazur.
Mr. Mazur.
Mr. Lewis Essex.
Mr. Lewis Essex.
Mr. Jennis.
Mr. Jennis.
Mr. Seaback.
Mr. Seaback.
Mr. Small.
Mr. Small.
Mr. Ellis.
Mr. Ellis.
Mr. Stewart.
Mr. Stewart.
Mr. Berthold.
Mr. Berthold.
Mr. Duncan Stormont Dundas South Glengarry.
Mr. Duncan Stormont Dundas South Glengarry.
Mr. Workington.
Mr. Workington.
Ms. Finley.
Ms. Finley.
Mr. Abuteyev.
Mr. Abuteyev.
Mr. Chong.
Mr. Chong.
Mr. Barrett.
Mr. Barrett.
Mr. Chambers.
Mr. Chambers.
Mr. Schmale.
Mr. Schmale.
Mr. Vidal.
Mr. Vidal.
Mr. Davidson.
Mr. Davidson.
Mr. Kelly.
Mr. Kelly.
Mr. Viss.
Mr. Viss.
Ms. Rude.
Miss Rude.
Mr. Cooper.
Mr. Cooper.
Mr. Bartel.
Mr. Martel.
Mr. Williams.
Mr. Williams.
Mr. General.
Mr. General.
Miss Ledoux.
Mr. Ledoux.
Mrs. Roberts.
Mrs. Roberts.
Mrs. Goodridge.
Mrs. Goodrich.
Mrs. Block.
Mrs. Block.
Ms. Ferrari.
Miss Ferrari.
Mrs. Vecchio.
Mrs. Vecchio.
Mr. Aitchison.
Mr. Aitchison.
Mr. Malillo.
Mr. Malello.
Mr. Baldinelli.
Baldinelli.
Mr. Lobb.
Mr. Lobb.
Mr. Allison.
Mr. Allison.
Mr. Reed.
Mr. Reed.
Mr. McLean.
Mr. McLean.
Mrs. Gallant.
Mrs. Gallant.
Mr. Waugh.
Mr. Waugh.
Mr. Steinley.
Mr. Steinley.
Mr. Lawrence.
Mr. Lawrence.
Mrs. Cramp Nyman.
Mrs. Cramp Nyman.
Monsieur Lehoux.
Mr. Lehoux.
Mr. Genereux.
Mr. Genereux.
Mr. Tucker.
Mr. Tucker.
Mrs. Falk, Battleford, Lloydminster.
Mrs. Falk, Battleford, Lloydminster.
Mr. Van Popta.
Van Popta.
Mr. Zimmer.
Mr. Zimmer.
Madame Vien.
Madame Vien.
Monsieur Gould.
Mr. Gould.
Mr. Caputo.
Mr. Caputo.
Mr. Arnold.
Mr. Arnold.
Mr. Brassard.
Mr. Brassard.
Mr. Williamson.
Mr. Williamson.
Mr. McGuire.
Mr. McGuire.
Mr. Cram.
Mr. Cram.
Mr. McKenzie.
Mr. McKenzie.
Mr. Dreeshen.
Mr. Dreeshen.
Mr. Nader.
Mr. Nader.
Mr. Tolmie.
Mr. Tolmie.
Mr. Muse.
Mr. Muse.
Mr. Carey.
Mr. Carey.
Mr. Hoback.
Mr. Hoback.
Mr. Shipley.
Mr. Shipley.
Mr. Redicott.
Mr. Redicott.
Mr. Morantz.
Mr. Morantz.
Mr. Kitchen.
Mr. Kitchen.
Mr. Lake.
Mr. Lake.
Mr. McCauley Edmonton West.
Mr. McCauley, Edmonton West.
Mr. Falk Provencher.
Mr. Falk Provencher.
Mr. Dowdle.
Mr. Dowdle.
Mr. Dalton.
Mr. Dalton.
Mr. Bragdon.
Mr. Bragdon.
Mr. Epp.
Mr. Epp.
Mr. Motts.
Mr. Mott.
Mr. Weber.
Mr. Weber.
Mrs. Wagenthal.
Mrs. Wagenthal.
Mr. Vierson.
Mr. Vierson.
Mr. Ruff.
Mr. Ruff.
Mr. Shields.
Mr. Shields.
Mr. Leipert.
Mr. Leipert.
Mr. Fast.
Mr. Fast.
Mr. Morrison.
Mr. Morrison.
Mr. Patzer.
Mr. Patzer.
Mr. Soroka.
Mr. Soroka.
Monsieur Terrien.
Monsieur Terrien.
Monsieur Blanchette Jonca.
Monsieur Blanchette Jonca.
Monsieur Villemur.
Monsieur Villemur.
Monsieur Garon.
Monsieur Garon.
Madame Gill.
Madame Gill.
Madame Michaud.
Madame Michaud.
Monsieur Fortin.
Monsieur Fortin.
Monsieur Perron.
Monsieur Perron.
Monsieur Barcelou Duval.
Monsieur Barcelou Duval.
Retour à Madame Larouche.
Madame Larouche.
Monsieur Plamondon.
Monsieur Plamondon.
Madame Vignola.
Madame Vignola.
Monsieur Beaulieu.
Monsieur Beaulieu.
Monsieur Lemire.
Monsieur Lemire.
Madame Chabot.
Madame Chabot.
Monsieur Desilets.
Monsieur Desilets.
Ms. May, Saanich Gulf Islands.
Ms. May, Saanich Gulf Islands.
Mr. Morris.
Mr. Morris.
Mr. Vong.
Mr. Vong.
Monsieur Reyes.
Monsieur Reyes.
All those opposed to the motion will please rise. The House will now wait for electronic voting period to end before resuming proceedings. Je désire informer la Chambre.
I wish to inform the House that the electronic voting period has ended.
Members who are not able to vote due to technical difficulties, they may now use the raise hand function, and the chair will recognize them. Seeing none, le bureau va maintenant compiler.
The table will now compile. Oh.
Yeah. Mr. Chang?
Mr. Speaker, I just want to confirm my vote was yes.
Yes. Okay. Very good. Seeing no more, then we'll continue. Le bureau va...
The table will now compile the results of the vote.
Yeas pour 327, 327. Nays contre, nil aucun.
I declare carried. We'll wait a couple of minutes. If I can ask the honourable members to maybe, if they've got some discussions, to either keep them very quiet, and if you can hear my voice, please say shh. Nobody can hear my voice, obviously. If you can hear my voice, please say shh. There we go. Perfect. Tabling of documents. The Honourable Minister of International Trade, Export Promotion, Small Business and Economic Development.
Mr. Speaker, pursuant to Standing Order 32.2, I have the pleasure to table in both official languages the annual report of the 2020-2021 Canada account as prepared by Export Development Canada. Thank you.
Dépôt de projet de loi émanant.
Introduction of government bills.
Statements by ministers. Rapport de...
Presenting reports from interparliamentary delegations.
Presenting reports from committees, the Honourable Member for Scarborough Centre.
Mr. Speaker, I have the honour to present in both official languages the 11th report of the Standing Committee on Citizenship and Immigration in relation to the motion adopted on Tuesday, October 4th, 2022 regarding the immigration response to events in Iran. The Standing Committee on Citizenship and Immigration reports that in light of the downing of Ukrainian International Airlines Flight PS752 by the Iranian Revolutionary Guard Corps and in light of the killing of Masha Amini by the Iranian Guidance Patrol, that the committee demands the government stop issuing visas to all Iranian nationals directly affiliated with the Iranian Revolutionary Guard Corps, Iranian Armed Forces, Iranian Guidance Patrol, or Iranian intelligence organizations, and that, pursuant to Standing Order 109, the committee requests a response to this report by the government. Thank you, Mr. Speaker.
Projet de loi.
Introduction of private members' bills.
First reading of Senate public bills. Mr. Lake, seconded by Mr. Coutu. Mr. Lake, seconded by Mr. Coutu, moves that Bill S-203, an act respecting a federal framework on autism spectrum disorder, be now read a first time. The Honourable Member for Edmonton-Wetaskiwin.
Thank you, Mr. Speaker. It's my pleasure to introduce Bill S-203 in this House, seconded by my honourable colleague from Don Valley East. The bill was introduced in the Senate by Senator Leo Housakos, who has long been a tireless advocate for autistic Canadians. It was seconded there by my good friend Senator Peter Beam, who, like me, is the father of a wonderful young autistic man. Bill S-203 builds on the work of former Senator Jim Munson, who has been relentless in his pursuit of a national autism strategy for nearly 2 decades. As the bill's summary states, it, quote, provides for the development of a federal framework designed to support autistic Canadians, their families, and their caregivers. A national autism strategy is long overdue, but never before have we seen this level of agreement and the collective will to see this through. On behalf of my son Jaden, Peter's son Nicholas, and autistic Canadians and their families from coast to coast to coast, I urge the House to join me and my Liberal friend and colleague in support of this important bill.
This motion is deemed adopted. When
shall I read the bill a
second time?
At the next sitting of the House.
Motions. The Honourable Parliamentary Secretary to the Government House Leader.
Yes, thank you. Mr. Speaker, there have been discussions amongst the parties, and if you seek it, I believe you will find unanimous consent for the following motion, that notwithstanding any standing order, special order, or usual practice of the House, at the conclusion of oral questions on Wednesday, October the 19th, 2022, the Speaker, a member of each recognized party, a member of the Green Party, and the member for Elmwood Transcona each be permitted to make a statement to pay tribute to the late Honourable Bill Blakey, and that afterwards the House observe a moment of silence, and that the time taken for these proceedings shall be added to the time provided for government orders. Thank you, Mr. Speaker.
All those opposed to the honourable member moving the motion will please say nay. Agreed. The House has heard the terms of the motion. All those opposed to the motion will please say nay. Carried. Presenting petitions. Présentation pétition. Questions on the order paper. The Honourable Parliamentary Secretary to the Government House Leader.
Yes, Mr. Speaker, I would ask that all questions be allowed to stand at this time, please.
So ordered. Orders of the day.
Order émanant du gouvernement, projet de loi émanant du gouvernement commune, resuming consideration at second reading of Bill C-22, the Canada Disability Benefit Act.
Resuming debate, the Honourable Member for Beaches, East York.
Thanks, Mr. Speaker. I'll be sharing my time with the member for Chateauguay-Lacolle. Today is the International Day for the Eradication of Poverty. Poverty reduction is an issue I've worked hard to address in Parliament, including as co-chair of our all-party anti-poverty caucus. And that notion of all-party on this issue has always been an important one, because the idea of dignity and equality of opportunity for all should transcend any partisan politics. Now, we've seen significant progress since 2015, thanks in large part to the Canada Child Benefit, as well as increases to GIS for seniors and the workers' benefit. On StatsCan's numbers, poverty levels have gone from 14.5% in 2015 to 10.3% in 2019 to 6.4% in 2020. Of course, the 2020 levels were reached due to extraordinary pandemic income supports that have fallen away. And on top of that, the rising cost of living, many more people are being left behind than we see reflected in those 2020 numbers. It goes without saying that there remains much more work to do. And the next step in that work needs to be realizing the proposed Canada Disability Benefit as ambitiously as possible. People with disabilities are consistently overrepresented in our national poverty numbers, and that needs to change. Bill C-22 will establish the Canada Disability Benefit with the goal of reducing poverty and supporting the financial security of working-age persons with disabilities. I want to see this bill realized yesterday, but it isn't enough to support this legislation. Finance needs to step up here too. The cost of poverty to our society is greater than the cost of ending poverty. Finance needs to understand that basic idea and do the right thing in realizing the promise of Bill C-22. I'm going to cede the rest of my time for questions, Mr. Speaker, because I want to get this bill to committee as quickly as possible, and I encourage all of my colleagues to work together in supporting this bill. Thank you.
Questions and comments. Questions et commentaires. Resume. Oh, I'm sorry. The Honourable Member for Kitchener Centre.
Thank you, Madam Speaker, and thank you to the member for Beaches East York for his steadfast support of C-22, including getting parliamentarians across party lines to support an open letter calling for the governing party to reintroduce the bill. I really appreciate his approach to moving us as quickly as possible by ceding his time, and the call for what needs to be done to finance the disability benefit. I wonder if he could speak more to what every parliamentarian could do, not only to ensure that the benefit is financed as soon as possible, but to get emergency support to Canadians with disabilities who need it the most.
Member for Beaches East York.
Thanks to the member for the question. I've certainly enjoyed working across party lines with the member and with others to make sure we've seen the retabling of Bill C-22. I would say I think the priority for all of us should be to be writing to the finance minister as part of the fiscal update and especially as part of the next budget cycle to say that this is one of our top priorities. And if enough of us across party lines deliver that message clearly to the Minister of Finance, I have every expectation that we are going to realize the promise of Bill C-22 as fulsomely as we can.
Questions and comments. Questions et comments. The Honourable Parliamentary Secretary to the Government House Leader.
Yes, so thank you, Madam Speaker. And I've had the opportunity to share a few thoughts in regards to the importance of the legislation. And one of the roles that the federal government, I believe, has to play is to support Canadians directly. And through Bill C-22, we are seeing substantial support for people of disabilities. And I'm wondering if my friend can just provide his thoughts in terms of the important role the government, in particular the Government of Canada, plays in supporting the people of Canada.
The Honourable Member for Beaches East York.
The income supports that the federal government provides make a world of difference to many different people. So we see over $60 billion delivered to seniors between old age security and guaranteed income supplement. The lowest poverty rate among any demographic that we see in this country is among seniors as a result of that. Should we do more to help seniors? Of course. But the work that the federal government does, in particular, the income supports that are provided are instrumental in ensuring that we are reducing the poverty rate among seniors as we have. Similarly, the Canada Child Benefit has demonstrably dropped the child poverty rate in this country, and we are now spending $30 billion and more to deliver for families with kids. But both working age Canadians, Canada Workers Benefit, there's still much to do, and people with disabilities disproportionately represented in those national poverty numbers that I referenced in my speech. And we absolutely need to do more. And when we look at the transformation of poverty in seniors with respect to the guaranteed income supplement, if we do the very same thing for people with disabilities through the benefit realized or contemplated in C-22, we're going to make a world of difference there as well.
Questions and comments. The Honourable Member for Châteauguay-Lacolle.
Thank you, Madam President. And I know full well how my colleague has been passionate in advocating for this disability benefit. I'd like to hear from him about the criticism or the approach that some people have. Well, this is charity, and this should be done outside of government. This is something that really doesn't belong to a government program. I'd like to hear the honourable member on that and have his thoughts on just how important it is to help disabled people have their financial autonomy.
Honourable Member for Beaches East York.
Thanks, Madam Speaker. I want to pick up on that question of autonomy because fundamentally this is about dignity, ensuring that every single person in our society can live a life of dignity, and that comes with ensuring that individual has enough support to realize their own passions, to realize their own endeavors, and it comes with that kind of autonomy. And that autonomy can only be realized. That there's an old quote from Dostoevsky that money is coined liberty. And that kind of freedom, it's not freedom from something, but it's freedom to do something. And if we don't realize that kind of freedom for everyone in the society, especially people with disabilities, in some cases people who are unable to provide for themselves despite their working age, then we are missing an absolute foundational core component of what governments ought to be delivering for our society. That we as a government need to provide that minimum floor, that social safety net that no person, whether someone with a disability or not, falls below.
Resuming debate, the Honourable Member for Châteauguay-Lacolle.
Well, merci beaucoup, Madame la Présidente.
Thank you very much, Madam Speaker. It's a huge pleasure for me to rise in the House and speak today as a representative of the constituents of Châteauguay-Lacolle in support of Bill C-22. As you already know, Bill C-22 is framework legislation that would implement the Canada Disability Benefit in order to reduce poverty and strengthen the financial security of people who are working age and belong to this group. It provides for general provisions around this benefit and authorize the Governor and Council to implement most of the means and modalities through regulations. This is, as I said, framework legislation, and all the negotiations and details will be established subsequently between governments at all levels, provincial, territorial, and federal, and together with those most affected, that is, people with disabilities. It also makes a related change to the Income Tax Act, a consequential amendment to the Income Tax Act. As my colleagues have said in this debate, the benefits that will be established through regulations will set out the eligibility criteria for the Canada Disability Benefit and the conditions that need to be met in order to receive or continue to receive the benefit, the amount that will be received, and the way in which the benefit will be indexed to inflation, and the periods of payment and the amounts to be paid in each period, and the process for applying for the benefit. Madam Speaker, in my region, Bill C-22 is music to people's ears, especially to people with disabilities and all those who work to improve their quality of life. So I'm delighted that there's unanimous consent here in the House to fast-track this bill as much as possible. That shows that all political parties understand how important this benefit is to people with disabilities and for among the most vulnerable Canadians in this country. Everyone understands that people with disabilities face unique obstacles and difficulties, including in health and welfare and financial security. And as a matter of fact, I was interested to read in the statistics that almost 1 in 4 people, 21% of Canadians, have a disability. And I can tell you that here in the House, I think we can count some of those people, and I think we will all eventually experience handicap or disability at some point in our lives. But we have a privileged financial situation here in the House, whereas for people who are born or who have an accident in their youth, so people who are either born with a disability or are injured early in their lives, it's clear that their financial autonomy is hugely impacted. So it's important to make a difference in their lives and to enable them to play a bigger role in society by supporting them with adequate financing or finances. So once again, Madam Speaker, it's a matter of independence or autonomy and human dignity. In Châteauguay-Lacolle, and I imagine in other places in Canada, the community has long been aware of the difficulties people with disabilities face. And we have set up organizations, volunteer organizations, and not-for-profits to meet some of those needs. Often, it's families who have shown leadership to help their children or their aging parents with disabilities, to help them break out of their isolation and to get supports in the areas of education and training and whatnot. These are people who dedicate themselves for years to improving the quality of life of their loved ones. And they often do that at the expense of their own physical well-being and financial health. And that's why it's government's role, and I think others here are similarly minded, that it's my opinion that the government should help, and that's why C-22 is so important. Madam Speaker, allow me to commend all the volunteers and staff who work with people with disabilities in my riding. I'd, among others, like to underscore the support of the Horizon Multifunctional Resource Center for people with all types of disabilities. And that organization has been of invaluable support, including the efforts of its director. And this has provided a break for dozens of families in my riding. There's also Action Découverte in my riding, an organization that supports individual and collective autonomy of people of all ages with disabilities, intellectual disabilities. And it helps that clientele through activities to help young people become more independent. And there's Chez Nous Solidaire in Mercier, Un Vent d'Espoir in Saint-Rémy, and other organizations also founded by amazing parents who seek to help not only their own disabled children, but the children of others as well. And they spare no effort in offering support services in the community and social services, as well as housing, to promote the independence of these young people in the community. These charitable organizations cannot do everything by themselves. They struggle, as it is, to fund their own activities, and knowing that people with disabilities are twice as likely to live in poverty than people who do not have disabilities, in a fair and equitable society, it's our duty to support them financially, support them adequately, so that they can actively participate in our social economy. And that's why our government presented new legislation that will provide for a disability benefit. Madam Speaker, it's important to point out that this benefit, which is the cornerstone of our action plan to include people with disabilities, this benefit will round out other federal, provincial, and territorial supports. It will not replace them. It will be a complement to existing services and supports, and will help thousands of Canadians get out of poverty. In the spirit of nothing without us, we are going to continue to work with the provinces and territories, as well as with the disabled communities, to ensure that this benefit is designed keeping their needs in mind. The Canada Disability Benefit will contribute to alleviating the financial difficulties that people with disabilities have experienced for so long. And this will create an economy and a society that's more open and inclusive, and it will significantly reduce poverty for hundreds of thousands of disabled Canadians. So this benefit will become a key part of Canada's social safety net, and it will complement the old age security and the guaranteed income supplement and the child benefit. We're not talking about charity here, Madam Speaker. We need everyone to be able to participate in our social economy, even at home in Châteauguay-Lacolle, and we want to make that dream a reality. Thank you very much. Questions and comments? The Honourable Member for Calgary-Shepherd. Thank you, Madam Speaker. When the Minister started the debate on this bill, she indicated that there would be an amount paid to each eligible applicant for the benefit. The problem with the Act and the way it's drafted is that the Act doesn't say who will be eligible, what the criteria are, and how what the amount of the benefit will be. And during the debate in the early days, I suggested that the Old Age Security Act would be a good example to follow in amending C-22. So my question for the member is, would she be willing to take some sections out of the Old Age Security Act and cut and paste them to ensure that people with disabilities have a benefit that's similar to the OAS benefit? The Honourable Member for Châteauguay-Lacolle. Thank you, Madam Speaker, and I'd like to thank my honourable colleague for the question he asked, because I know it's a topic that's very important. We want this benefit to be a supplementary amount, not a replacement amount. We know that provinces have their own systems and programs, and that there are tax credits and so on, and various programs designed to support people with disabilities, and they have their own criteria. Sometimes the criteria are very complex. So we thought it important to have this framework legislation, and then we can get into the negotiations over how much. But for now, we want to make sure that we're talking about supplementary income to make sure that it's adequate. Thank you. Questions and comments? The Honourable Member for Shefford. Thank you, Madam Speaker, and I'd like to thank my colleague from Châteauguay-Lacolle for her speech. I had the opportunity to take a stand on C-22 a month ago, and I myself have a family member who unfortunately has passed away, but who had a disability for a good part of their life. And I also was able to speak to the director of an organization in my riding, and she pointed out that it is the lack of details in this bill that's problematic. And it was mentioned that this is to be an additional amount, not a replacement for what's already available in the provinces. So on the day of poverty, could my colleague confirm that more details will be forthcoming for the organizations and stakeholders? The Honourable Member for Châteauguay. Thank you very much, Madam Speaker, and I'd like to thank my colleague once again, my colleague opposite, because I believe we share the same principle that we mustn't do things on behalf of other people. And once again, my condolences with respect to the person that the member mentioned who'd passed away. It's very difficult for families and for loved ones. But one thing is for sure, people with disabilities, as much as possible, they want to have a say. So it's not up to the federal government to impose something on people and tell them how this is going to work. We really have to talk to the stakeholders and the frontline workers and with our provincial partners.
And I'd like to thank the member for her intervention. Indigenous peoples with disabilities, I think, face extra challenges when trying to access services, and I'm sure we'll have extra challenges trying to access this benefit once it's available to them. I wonder if the member could provide us or agree that Indigenous peoples with disabilities will need to get special provisions for trying to access these services, especially when they prefer to speak or be heard in their Indigenous languages, like in Inuktitut, which is not a federal official language.
The Honourable Member for Châteauguay-Lacolle, 25 seconds.
Thank you, Madam President, and I thank my colleague from Nunavut. In fact, something that I am seeing in my riding, and it's not something that was obvious, we neighbor Ganawage, which is a very proud and independent nation. But we have been able to, our local organizations, been able to partner with social services at Ganawage to provide a project such as housing, supportive housing for youth in transit, because of course the youth are mobile across the territory. But there are Indigenous, there are certainly Mohawk social workers and support staff that are working within the project. That there was no go-ahead unless we had the shared partnership of our two communities.
Before we resume debate, je désire informer la Chambre qu'en
It's my duty to inform the House that because of the deferred recorded divisions, government orders will be extended by 15 minutes.
Member for Sherwood Park for Saskatchewan.
Well, thank you so much, Madam Speaker. I do appreciate the opportunity to speak to Bill C-22 and more broadly to the situation confronting Canadians living with disabilities. Now, Bill C-22 proposes a new federal financial benefit for Canadians living with disabilities, however, does not actually define many aspects of the structure of this benefit. So I'll be voting in favor of this legislation because I agree with the principle of providing the support, but I am concerned about some of the lacking substance in terms of how this benefit would actually work. Increasingly, we see from this government a desire to limit the actual work of Parliament in defining the nature and scope of programs. Instead, the government wants a blank check from Parliament, legislation that authorizes ministers to shape and define a program independently according to their discretion. In general, this is not a good way for governments to operate in a democracy, and in particular, I do not think this government has shown itself trustworthy when it comes to working out the details of critical programs. When it comes to the structure of this benefit, the government's message is just trust us. But from a government that cannot figure out how to deliver passports in a timely manner, cannot address the affordability crisis, and cannot secure our borders, the message of just trust us seems rather hollow. Now, I have two specific concerns about the prospective structure of this program that I do want to highlight. First, I share the concern of many about how this program would interact with other existing programs, including those provided at the provincial level. If a new federal benefit leads to a loss of eligibility for other existing benefits, then it would leave people worse off overall. It is not inevitable that this would be the case, but this is a matter that will require careful and respectful dialogue with other levels of government and hard work at every stage, hard work that this government hasn't always been prepared to do. So at this point, the government is passing broad framework legislation without ensuring that it will actually leave Canadians with disabilities better off in every case. The government doesn't have to wait for this legislation to pass to begin those discussions, and I would encourage them to actively engage those discussions now about protecting existing benefits, because aspects of those dialogues may inform suggested amendments. Madam Chair, the second concern I have is that it's critically important that the structure of this benefit program protect access for Canadians with disabilities who are working or trying to get into work. Even with existing benefit programs at other levels, certain Canadians with disabilities may find themselves in a position where entering the workforce actually leaves them worse off. It is critically important that work always leaves people better off financially. Supporting Canadians, including Canadians living with disabilities, in being able to access meaningful work has long been a key priority for Conservatives. And why is this important? Overwhelmingly because Canadians of all backgrounds and circumstances want to be able to work and are happier and more fulfilled if they are able to work. In this context, by work, I don't just mean commodified work, but work of any sort, where individuals exert themselves in order to contribute positively to the world around them. The science of happiness and fulfillment measurement shows us that work generally makes people happier by providing them with meaning and with a workplace-based community and with a greater level of power and agency. So quite apart from the notably important income-earning properties of work, work also provides meaning and happiness totally independent of whether or not it generates income. Now, the think tank Cardis has done excellent work on this question of work and disability. And they found that most Canadians living with disabilities want to work or want to work more. But also they found that the vast majority of public policy focus and money has been towards income support as opposed to supports that help people get into work. Now, the critical point about work support and income support is that they are not mutually exclusive. In fact, often they are necessarily complementary. Some people require income support in order to afford the resources and transportation required to find and get a job in the first place. And if income supports are withdrawn immediately once people work or start work, they may not be able to afford vital necessities as well as the things they need to sustain them in their new job. So having both fulfilling work and steady income are vital for human happiness and fulfillment. Having income without work or work without income are both, in a sense, problematic. Now, of course, having income isn't just about fulfillment and happiness, it's about basic survival. Canadians with disabilities need income to take care of their own needs and the needs of those they love. Now, for most of us, work comes with earning income. However, when benefit programs are poorly structured, people may actually be forced to choose between work and income because benefits are cut off or income is lost as a result of working. In such cases, given how essential income is for survival, people will understandably choose income over work if they are forced to choose between these things. But it is cruel and pointless to force people to make this choice, to choose between the happiness associated with work and receiving the financial support that they need. Income supports for Canadians with disabilities can and should go hand in hand with workplace support, and only peeling those income supports back gradually when it is clear that income support is not required because of the level that an individual is able to work. Now, we saw an example of this terrible choice between work and income with the poorly constructed CERB program during the pandemic. Unemployed Canadians who were accessing CERB, who were then offered part-time work, were in many cases actually worse off financially if they took that work, because part-time work would likely push them over the threshold for CERB eligibility, even if they were not earning close to what they would have been entitled to receive under CERB. Thus, people were forced to remain out of work in order to access the resources that they needed to support their families. Now, not only does this make zero financial or economic sense to create a financial disincentive to work, but it puts people in the painful position of needing to choose between the happiness and dignity that comes from work on the one hand and financial security on the other hand. That is why we feel it is very important that this new federal program be structured such that Canadians with disabilities, many of whom can and do work or want to work, are not rendered worse off by entering the workforce. Now, there is nothing in the text of this bill to suggest that it couldn't be structured in a way to ensure that work always pays, but the past record of this government gives us significant cause for concern. In the 42nd Parliament, the member for Carleton, now the leader of the Conservative Party, proposed Bill C-395, a bill specifically designed to address this problem of work sometimes bringing about a loss in benefits for Canadians living with disabilities. Bill C-395 would have amended the Provincial Fiscal Arrangements Act to ensure that in negotiations around transfers and the construction of benefits for Canadians living with disabilities, people with disabilities would not lose more through taxation and the reduction of benefits than they gain as a result of working. It would have protected Canadians with disabilities from these kinds of perverse situations where they would have to choose between the happiness that comes from work or the financial security that comes from government benefits. Now, if Bill C-395 was the law of the land, then we could pass this bill even as written with the confidence that the benefits constructed would leave people better off. But when it came to a vote on Bill C-395, Liberals actually opposed it. Liberals opposed this common-sense proposal from our leader to ensure that Canadians who work are better off as a result of the money they earn. Now, sadly, Liberals don't seem to appreciate the value, dignity, and happiness that comes from hard work. Now, I'm not sure if it could be found in the scope of this legislation as written, but I would welcome amendments that would capture the spirit of our leader's past work to protect Canadians with disabilities from being punished for working. Now, parenthetically, Mr. Speaker, on this subject, Madam Speaker, excuse me, I want to say something directly to employers about hiring Canadians with disabilities. The research done by Cardis shows that many employers have an exaggerated perception of the costs associated with accommodation. Cardis's work shows that including and accommodating employees with disabilities is often much cheaper than employers initially expect, and that funding may be available from different levels of government for businesses, including small businesses, to seek to accommodate customers and employees living with disabilities. Now, further, as our leader has previously shared in the context of speaking to C-395, there are so many cases of Canadians with disabilities who make incredible, committed, and loyal employees and who bring unique competencies to the workplace. Governments have a responsibility to ensure that poorly structured benefit programs do not undermine the ability of Canadians to access work. But employers also need to lead in pushing aside stereotypes and recognizing the contributions that Canadians with disabilities can make to their workplace. Many employers are already doing this, and I congratulate those that are doing this already. Now, Speaker, these were the main points that I wanted to make on C-22, but I also think it's very important to speak to the context of the legislation. And that is the significant negative impacts on the lives of Canadians living with disabilities that flow from the government's radical, ableist approach to euthanasia, their so-called MAID regime. We simply cannot have a conversation about financial benefits separate from a recognition about the biggest threat to the lives of Canadians living with disabilities. That those with disabilities are much more likely, those without disabilities are much more likely to be offered suicide prevention and recovery support, while our brothers and sisters, cousins, and friends who are living with disabilities are being denied those supports and actively pushed towards death, even if they are saying they don't want it. Now, among those who support legal euthanasia around the world, Canada is still increasingly seen as a cautionary tale, a warning of what not to do. Now, in this vein, I want to start with a bit of history. Euthanasia in Canada started with Bill C-14, passed in the 42nd Parliament. This legislation affixed the name medical assistance in dying to what had previously been called euthanasia, the process of doctors killing a consenting patient. Now, that legislation sought to define a regime whereby people could choose hastened death if their death was deemed reasonably foreseeable. Now, I criticized the legislation at the time for, among other things, not being sufficiently clear about what was actually meant by reasonably foreseeable. Indeed, there were significant abuses even in the immediate aftermath of the passage of the legislation, whereby doctors determined someone's death to be reasonably foreseeable based on a string of hypotheticals and where a person had nothing approaching a terminal condition. For example, back in 2016, I highlighted a case in Vancouver where a physician declared a depressed person eligible for euthanasia without examining them because that patient, quote, could easily get bed sores and then die of infection, end quote. A person's death was, prior to examination, declared reasonably foreseeable because the person could theoretically die from an as yet uncontracted bed sore infection if they were bedbound as a result of their depression. These were the kind of perverse outcomes that were possible even in 2016 as a result of the lack of safeguards and the ambiguity around what was meant by reasonably foreseeable. Now, the current rules allow someone also to consult many different physicians before finding two who will approve. So if 20 or 200 doctors say no criteria are met, but then 2 say yes criteria were met, then the killing of the patient can proceed. The ambiguity and the opportunity to consult multiple doctors before getting the desired result means that indeed the holes were and still are large enough to drive a truck through. So these were the pre-existing problems that were already, in particular, raising concerns of the disability community. The lack of clarity around what were and were not circumstances where death was reasonably foreseeable opened the door for people who were living with disabilities being encouraged to pursue MAID, even if they didn't want to, and even if they were actually not eligible. You don't have to take my word for it, because the minister responsible for this legislation, the Minister of Employment, Workforce Development and Disability Inclusion of Canada, actually said during subsequent discussion of C7, she said, quote, "I regularly hear from families who are appalled by the fact that they take their child, potentially their older child, in and are offered unprovoked MAID. I think that has to stop," end quote. That's from a minister in this government. So this was already the context following the passage of C14 and prior to the passage of Bill C7. Now, the road to C7 was much more contrived than the road to C14. The already nebulous reasonable foreseeability clause was challenged, and a lower court in one province proposed to overturn this restriction. The federal government could have appealed that lower court decision and indeed had a strong basis for doing so. An appeal would at the very least have given parliamentarians more time to consider a broad range of legislative options. Instead, the government made a political choice to embrace the court ruling, the lower court ruling, and the artificial timeline it created, pushing medical assistance in dying for Canadians with disabilities. This was not about following a court ruling. This was about something the government could have appealed, but they wanted to use the court ruling to advocate for a long-standing objective. So following this contrived process, the government put forward Bill C7, which was rightly opposed by all of the leading organizations representing Canadians living with disabilities, as well as by domestic and international human rights authorities. Krista Carr from Inclusion Canada said the following: "Inclusion Canada has advocated for safeguards in MAID since we intervened in the Carter case. Our biggest fear has always been that having a disability would become an acceptable reason for state-provided suicide. Bill C7 is our worst nightmare. By having a disability itself under Bill C7 as the justification for the termination of life, the very essence of the Charter of Rights and Freedoms would be shattered. Discrimination on the basis of disability would again be entrenched in Canadian law," end quote. She says further, quote, "The singling out of one particular group of people based on their personal characteristics that happens to be a protected ground under the Charter of Rights and Freedoms, and to use that reason as grounds to justify the termination of the lives of the people who have those characteristics is just wrong, and we wouldn't consider doing this. We would never consider doing this for any other group of people, Indigenous, racialized, LGBTQ. Another quotation, Dr. Heidi Jans from the Council of Canadians with Disabilities. She says, people with disabilities are at a higher risk of suicide due to systemic and internalized ableism, yet they face substantial barriers when trying to access suicide prevention services. Medical professionals overlook typical sources of stress. Problems arising from relationship breakdowns, depression, and isolation are wrongly attributed to disability. The removal of reasonable foreseeable natural death as a limiting eligibility criteria for the provision of MAID will result in people with disabilities seeking MAID as an ultimate capitulation to a lifetime of ableist oppression, end quote. And finally, Bonnie Brayton from the Disabled Women's Network of Canada pointed out, quote, Bill C7 is sadly lacking in any meaningful public consultation with any people with disabilities, despite how much more profoundly it could affect anyone who lives with a disability, end quote. The disability community overwhelmingly opposed C7 and has repeatedly raised concerns about negative pressure and coercion impacting Canadians living with disabilities. Okay, so what about autonomy? The government would argue that C7 provides people with disabilities with the option of medically facilitated death, but they don't have to choose that option. It's just another option that people have. To this, I would note that autonomy is always expressed in a social, legal, and economic context. Now, that context is that many Canadians living with disabilities struggle to access key supports and services that they need. We don't have sufficient workplace supports in place, and there are gaps in terms of community and income support. In that context, the law and the medical system say to a person living with this disability, you have a simple way out. You can choose to die. If you are at a point of existential agony and you have a disability, then the system will offer death as a supposed solution. So in effect, Madam Speaker, if a person like me without a disability is experiencing existential distress and suicidal ideation, and if I were to discuss that distress with a doctor, I would be offered suicide prevention. But if a person with a disability, the same as me in every other respect, is experiencing the same existential distress and suicidal ideation, and they discuss their distress with a doctor, they will be offered suicide facilitation by that same medical system. Now, that difference in the way the law and the health system treat those living with and without disabilities obviously sends a message to everyone involved in those interactions about whose life the law and the health system deem to be more or less worth living. This Liberal government has built a staircase to suicide prevention and a ramp to suicide facilitation. So as much as members opposite would like to say that this is about autonomy, the social and legal context that the government has created is not neutral, and it is, in fact, discriminatory. Disability rights groups overwhelmingly see this reality, which is why they have been diametrically opposed to the approach of this government, and so much for nothing about us without us. Canadians with disabilities feel devalued by a system that offers them easy death and does not offer them critical supports to live. Sadly, the mentality of the medical system is changing as well in response to these legal changes. The House has heard from many witnesses at different times and in different communities where patients were repeatedly pushed towards death and even called selfish for rejecting that option. Again, I will quote the minister, who said herself, I regularly hear from families who are appalled by the fact that they take their child, potentially their older child, in and are offered unprovoked MAID. I think that this has to stop. In response to the testimony that we have heard, Conservatives sought to amend C7 to guarantee that a physician or other healthcare worker would not raise euthanasia or MAID with a patient unless the patient raises it first. This amendment would have ensured that, for instance, a person with a disability who goes to a doctor for something unrelated will not be offered facilitated death out of the blue. This would have solved the problem that the minister actually identified. But the government opposed this Conservative...
Je dois interrompre l'honorable député. J'ai un rappel au règlement.
I have to interrupt the honourable member. A point of order. The honourable member for Rivière-des-Mille-Îles. Madam Speaker, with all due respect for my colleague, he is completely off topic. We are talking about giving financial support to persons living with disabilities, but for the past 10 minutes, my colleague has been talking about a totally different subject, that is, medical assistance in dying. So I would like the colleague to get back on track, please, Madam Speaker. I understand. I take this point of order, but as you know, we do have some tolerance in accepting that members talk about various topics, but I would request that the member continue to talk about Bill C-22, which we're currently debating.
The rights I'm given by the House to speak about this pertinent issue, which fundamentally relates to this legislation. The government doesn't want to hear from the many concerns raised by Canadians living with disabilities, that this is critically linked to their quality of life, the fact that the structures that the government has put in place are denying vital supports to Canadians who need it and pushing them towards this widening door that the government has offered when it comes to facilitated suicide. Again, the minister said, I regularly hear from families who are appalled by the fact that they take their child, potentially their older child, in and are offered unprovoked MAID. I think this has to stop. Of course, this government wants to go even further. Next year in March, euthanasia for those with depression or other mental health challenges will become explicitly legal, and the government is now studying euthanasia for children. In the world imagined by their current trajectory, a parent could bring a teenager suffering from depression to a counselor and find that that teenager is being offered suicide facilitation instead of suicide prevention support. And recently, Dr. Louis Roy from the Quebec College of Physicians recently recommended that euthanasia be legalized for infants with certain disabilities. Imagine it, Mr. Speaker. Someone would actually come to a parliamentary committee in Canada recommend the killing of young children because of their disability. So much for autonomy, Madam Speaker. So much for autonomy. I would hope the government would have denounced the vile views expressed by Mr. Roy. So far, they have not.
I do invite the honourable member to bring us back to C-22. We're going really into a totally different bill. Please, you have 1 minute. The honourable member has 1 minute left.
Madam Speaker, I expect better when it comes to ruling on the rules. You know that there is broad latitude, and I have a 20-minute speech. I have a 20-minute speech.
Absolutely.
And I spent the overwhelming first half of the speech discussing financial benefits.
I
said that I would spend the second half of the speech.
May I interrupt the honourable member to remind him that I was very broad in my interpretation of how the rules work, and the member had ample time to expose precisely the arguments the honourable member has been bringing forth, but we are 1 minute left into the speech, and I would like to remind the honourable member to bring us back to C-22. That's all I'm saying. The Honourable Parliamentary Secretary to the Government House Leader.
Madam Speaker, what I find to be extremely offensive of what just took place towards you is the member pointed at you and said, he expected better from you. That is not the way that any member of this House should treat the chair, not even the individual, but the respect that is supposed to be shown to the chair. And I would, through you, encourage that member to apologize to the chair.
Thank you. Thank the honourable member for his care, but I think we, in this chair, we know that we are subject to displeasing members, so the honourable member may proceed.
Thank you, Madam Chair. It's very clear that members of the government, members of the bloc, don't want to hear about the subject. That is a pressing priority for Canadians living with disabilities. They would prefer to talk about, we're introducing this generic framework legislation with no particulars. But they don't want to talk about the fact that they've been called out by every disability rights organization in this country for the fact that they have put in place a framework that is denying vital supports to Canadians with disabilities while widening and widening the push for Canadians facing disabilities towards facilitated death. People living with disabilities have a great deal to contribute to society, and they need to be offered workplace supports alongside income supports. We also need to recognize that a person's dignity is not dependent on their circumstances or their context or their perceived productivity or ability to contribute, that human dignity is inherent in all human beings. I will vote for C-22 while maintaining extreme concern about the way that this government views and treats Canadians living with disabilities and their apparent lack of desire to hear from parliamentarians and to hear from those organizations, those legitimate concerns that those organizations are repeatedly raising.
Questions and comments. The honourable member for Beaches East York.
Thanks, Madam Speaker. I was going to make a joke about figures of speech and the need to educate my friend about figures of speech after reading his Twitter feed. But what I wanted to ask him about is specifically around the quantum that he thinks should be realized, because he spoke about the vagueness of the legislation and the punting of some of the eligibility criteria and the punting of the quantum to the regulations. I think it's a fair criticism. And in the Old Age Security Act, we don't do that as Parliament. Having said that, I'd be curious, would the member support a submission to Finance for the coming budget cycle to say that the amount should be no less for people with disabilities of working age than it is for low-income seniors?
For Sherwood Park, for Saskatchewan.
Thank you, Madam Speaker. I'm not prepared to name a specific number on the fly, but I do agree in principle with my colleague that it would be legitimate to submit recommendations from parliamentarians trying to provide parameters around the appropriate numbers. And I think that should just be done in the context of not just saying a specific number for benefit but also prescribing how that federal benefit would interact with benefits at other levels, and also how it would interact with the issues I raised about the need to provide appropriate support for Canadians entering the workforce.
Le député de Rivière-des-Mille-Îles.
The honourable member for Rivière-des-Mille-Îles. Madam Speaker, I'd like to continue in the same direction as I was speaking before. I'm a little outraged that we're using time in this House to talk about things that have nothing to do with the debate, talking about MAID, talking about access to suicide, using terms like killing children. This is outrageous speech. I'm extremely shocked. This is a serious bill that the Bloc will be supporting. We're trying to financially help people that have disabilities, and spending 20 minutes on that bothers me even more. The honourable member for Sherwood Park, Fort Saskatchewan.
Speaker, I wish the member was more offended by the realities on the ground in this country and by the impact that that has on the lives of Canadians with disabilities than he is by the fact that I've raised those issues in the House. Now, he didn't like the fact that I referenced killing children. Dr. Louis Roy from the Quebec College of Physicians gave testimony before a committee of this House in which he recommended offering euthanasia, quote unquote, offering it to children who are less than 1 year old. Maybe the member didn't have a chance to see that testimony. I would encourage him to review that testimony. I think it's highly relevant to this conversation. Because if the message we're giving to parents who have children with disabilities, if the message we're giving to Canadians with disabilities is that, well, we're working hard to pave this easy way out, so-called, that has a great deal to do with the conversation we're having today.
Questions and comments. The honourable member for Victoria.
Thank you, Madam Speaker. And I'm going to focus on the very beginning of the member's speech, where he talked a bit about the need to support people with disabilities in the workplace. And I've had disability advocates, people with lived experience come to me and talk about how it's not only discrimination in hiring, but it's actually about accommodation and accessibility in workplaces. And that if we want people to feel welcome in the workplace, we need to ensure that ableist policies are gotten rid of, and that we do everything we can to accommodate people with disabilities. Here in the House of Commons, this is an ableist workplace, and for people who want to run and become members of Parliament, people with disabilities, virtual Parliament would be a huge step in ensuring that we have policies that support accommodation and accessibility. I'm curious if the member can respond to those comments.
Member for Sherwood Park, Fort Saskatchewan.
I was with the member most of the way. I agree that all the things she spoke about in terms of accommodations are important. The House of Commons has within its standing orders provisions that allow any standing order to be abrogated in order to accommodate a member with a disability, and I think that's important and that's positive. I believe that there are ways to achieve that accommodation without virtual Parliament. My sense is that there are many members who are keen on taking advantage of virtual Parliament, who are zooming in from their own offices even on Parliament Hill. And I think that the institution can accommodate and has accommodated Canadians, elected officials with disabilities outside of a virtual context. But I certainly agree that accommodation is very important. And I think Cardis' research identifying that for employers, the costs of accommodation are actually much lower than are often initially expected. That research is very important as well, and hopefully encouraging to employers that are considering doing more in this area.
Questions and comments. The honourable member for Kitchener Centre.
Thank you, Madam Speaker. It was 2 or 3 weeks ago now that we had this same debate on C-22 in this House and heard members of all parties communicate their support for C-22. In the time since, I put forward a unanimous consent motion on that basis to move it to committee so that amendments could be proposed to move forward with getting this benefit to Canadians with disabilities. Can the member for Sherwood Park, Fort Saskatchewan, speak to what he could do to get support from parliamentarians in this place to move on with getting C-22 to committee?
The honourable member for Sherwood Park, Fort Saskatchewan.
Thank you, Madam Speaker. Important opportunity to talk about how legislation is scheduled in this place, right? Because the government has most of the days, and the government schedules when legislation takes place. So what the government has done with C-22 is they scheduled it for 1 day of debate, and then they didn't schedule it for weeks and weeks. And then they said, how come this legislation hasn't passed? Well, clearly the legislation needs to have a certain amount of time being debated in the House. But if the government sets this as a priority, and I think it should be a priority, they could have scheduled it for a number of days in that first week. We could have completed second reading debate right up front. But it's a bit unreasonable for the government to say, well, if we're going to move this bill forward, you have to agree to adopt it, even while we fail to prioritize it in terms of our selection of the bills. So I think C-22 should be a priority. I would encourage the government to prioritize it in their selection of days so that we can indeed complete the debate that's required on the issues around it and move it forward.
However, for Souris Moose Mountain.
Madam Speaker, and I appreciate the opportunity. I thank my colleague for his speech and his comments and many issues that he's brought up. And it's interesting when I hear and around the room, ultimately, I have an earpiece here that I have to use because I can't hear, and I'm deaf in one ear, and people don't understand that, and because they can't see my disability, and because I don't talk about my disability. But then there's a big concern about that, because during COVID, for people with disabilities who are disabled because of hearing, with masks, we read lips. And we couldn't read lips because we couldn't hear things. And we heard comments from people who said, you're speaking too loud. Well, it's because we speak loud because we can't hear and understand that. And that invisible disability is extremely important to a lot of our disabled people. I'd like to speak, quickly, Madam Speaker, a member who is basically 43 years old. He has 4 children, and he's lost that ability to raise his children. He had cochlear implants put in. And his concerns with this legislation are the fact that there's regulations, but it doesn't tell him what he can do and how he can get back to work. And I'm wondering if the member would mind commenting on those invisible disabilities and the ability for people getting back to work.
Sherwood Park for Saskatchewan.
Thank you, Madam Speaker. And I think the member raises many important points, in particular recognizing the diversity of disabilities that exist. When we talk about disability, that could include many different kinds of things that in a particular social context make it harder for them to do a job that they could otherwise do. And we need to recognize that not all forms of disability fit with what our expectations might be. Not all forms of disability are visible. And that's why this program needs to be well constructed, it needs to be versatile, and it needs to encourage accommodations for people that respond to their particular circumstances. It's why we would like to see and would like to have seen more details on this from the government or the legislation, and these are important questions we need to be asking at committee.
Parliamentary Secretary to the Government House Leader, Senate.
Thank you, Madam Speaker. Going back to the preceding question that was asked by the member from Kitchener Centre, I don't disagree with the member from Sherwood Park, Fort Saskatchewan, that he is right. It's the government that sets the days and the agenda. But a lot of this place operates in good faith. You have to operate under the assumption that you want to move forward to eventually get to a place of voting on a particular bill. The problem is, and this member knows it better than probably most Conservatives, what Conservatives do is they do various different tactics to slow the day down. They'll move a motion of concurrence that burns away 3 hours. Then they'll put in some points of order in there, again, to burn more time, to try to burn away a day. It's very clear and it's very obvious to Canadians as a whole that the Conservatives do use multiple tactics to slow down anything getting through this House because they want to see this government fail. That's their objective, and that's their motive behind it, and this member knows that.
Part for Saskatchewan, 15 seconds.
Madam Speaker, just look at the facts. This fall, the House has sat for about 3 weeks. Conservatives have given unanimous consent to expedite 2 pieces of legislation, Bill C-29 and Bill C-30. So that's a pretty impressive breakneck speed for the opposition to agree to the option of certain pieces of legislation. This is only the second half day we've debated C-22, and yes, it needs to be debated. But we support the legislation. We want it to move forward. We want the government to do better. And look, debate in Parliament is part of the process.
Resuming debate, the Honourable Parliamentary Secretary to the Government House Leader, Senate.
Well, you heard him say it himself, Madam Speaker. The member for Sherwood Park, Fort Saskatchewan, basically just said, yeah, we let go some legislation that we all agreed with. Aren't we the heroes of the day? This is legislation that by his own words, he said, we all agree on it. And then to suggest that it's somehow some kind of handout to the government by allowing that legislation to pass through this House because they already agree with it. I mean, you heard the argument come from him just moments ago. But in any event, Madam Speaker, I want to start my speech today by referencing, back to what happened during the last speech from the member from Sherwood Park Forks, Saskatchewan, the way that he went after the chair in this House by saying to the chair, you should do better, you should know better. I mean, I think it's extremely disrespectful to the chair occupant. It's extremely disrespectful to the individual, yourself, Madam Chair, who happens to be sitting there at the time. But more importantly, it's disrespectful to the institution. The institution of our parliamentary system is based on one individual that presides over the meetings to ensure fairness, that comes from an impartial perspective, despite the fact that they may have been or may have come to this place under a particular party banner. And I think that we lend that impartiality and we lend that benefit of the doubt, and we treat that individual as though they do come from that place of impartiality for all chair occupants. I know I certainly have a great relationship with the chair occupant, the deputy speaker, who happens to be from the Conservative Party, and I try to extend that to the deputy speaker from the NDP, and indeed yourself, Madam Speaker. But for a member of this House to point at the chair occupant who happens to be sitting there at the time and say, you should do better, I think is extremely disingenuous to this entire institution, and quite frankly, that member should apologize. I asked him to do that when that happened. He didn't do that. He will have more opportunities to do that. I really hope that he comes out and he can feel free to interrupt me in my speech on a point of order in order to apologize to you, because you deserve it, Madam Speaker. You should not have had that occur. I want to go back to, we're talking about this piece of legislation, Madam Speaker, and how all parties in the House appear to be supportive of it. The Bloc have spoken in favor of it, the NDP, the Green, Liberals, obviously, Conservatives appear to be supportive of it. Maybe that's why they spend their entire times talking on this particular topic about anything but this piece of legislation, as we witnessed prior to myself. But, if you go back and you look at the actual platform commitments of all political parties, you will see that there was some degree in there of moving forward with a disability, a national disability benefit. Because I think that we've come to a certain place in our society where we respect the fact that we have to start looking at our disability benefits from a national perspective. Right now, like many of the programs that we have out there, there are piecemeal projects in Ontario. There is ODSP, which is the Ontario Disability Support. The Ontario Disability Support Program. There are, various different ones in other provinces that are out there. And what we saw in the last election is that all parties had committed to doing something about this very important issue. And it's been called upon us by many individuals throughout the country repeatedly. What we know, Madam Speaker, is that persons with disabilities face very unique challenges that aren't seen and aren't realized the same way as persons without disabilities. We also know that individuals with disabilities, proportionately speaking, represent a larger population of those that are experiencing poverty. And as a matter of fact, Madam Speaker, when you look at the poverty rates, they can be significantly higher amongst individuals that have a disability. And I think one of the very important things to talk about here, Madam Speaker, is that at least from the government's perspective, from the Liberal Party's perspective, when we go to tackle something as large as this, because make no mistake of it, Madam Speaker, this is a very large program that has a lot of moving pieces to it, we need to work with our counterparts. This is not something that is very clean-cut and simple, and something that can be just tabled, passed, and implemented. This is something where we need to start going back and talking to various different provinces and various different regions that are providing benefits like this. For example, what we don't want to happen in my province of Ontario is to introduce a benefit like this and have our provincial government see it as an opportunity to claw back on existing programs that are already put in place, the ODSP in Ontario, as I just mentioned. If we do that, this benefit will be counterproductive in terms of actually providing more supports for Canadians that really do need them. And so you can imagine, Madam Speaker, when you talk about various different provinces and territories that have to work with the federal government on this, it's not going to be a one-size-fits-all. That's why this legislation is about framework. It's about establishing the framework by which we can then go and have these discussions and create the right programs to balance them against existing programs that are in place by other provinces and regions, and make sure that there is a net gain to actually lift people with disabilities out of poverty, those that are currently experiencing poverty. And so when we talk about that framework, we talk about the various different things that this bill will seek to do. It's not simple, as I indicated. There's a lot of moving parts. For example, who will be eligible? This bill needs to make sure that it clearly identifies who will be eligible. I know the member from Sherwood Park, Fort Saskatchewan, and others spoke earlier about, well, why aren't the details in this bill? The details should be there right now. Well, these are the things that need to be worked out. Who is eligible? The conditions that need to be met to determine eligibility. The amount that individuals will receive. Again, ensuring that anything that is given by the from the federal level is not counterproductive or used as an opportunity to claw back at the provincial level. We need to see about indexing this benefit to inflation. You know, we're seeing during certain times of you know, extreme hardships right now as we face global inflation, we see that you know, this benefit would have to somehow adjust to meet those inflationary increases. The payment periods, how often will these payments be made? What is the most beneficial way to make those payments? How will they be rolled out to individuals? These are things that all need to be considered. The application process. How will individuals who currently are perhaps getting other disability payments in other provinces, how will they apply, and how will we ensure fairness across all provinces and territories, despite the fact that many individuals are already accessing other benefits? Or applications made on behalf of people who are incapable of making their applications. What will the process be to ensure that that can be taken care of? The circumstances in which an application would be deemed ineligible. There will be times when people are ineligible to receive this benefit, and so we need to make sure that we properly identify those as well. And then, of course, Madam Speaker, there's the other end of this. You know, there's the other end of establishing a list of offenses for people who try to abuse this particular benefit that would be put out there. You know, I know that there's a lot of talk about that. I know it comes up, you know, when especially when people talk about CERB and those that abused CERB. We need to use the time now to ensure that whatever we put in place properly respects and reflects that. So, you know, for example, some of the offenses could be people who falsely identify information, or individuals who are caught to be counseling people on how to falsify information and how to, you know, have the intent to actually steal all or a substantial part of the particular benefit. Or knowingly making false or misleading representation in relation to an application. All of these things need to be properly looked at. And the problem, Madam Speaker, as I previously indicated, is it's not just looking at it through the federal lens. It's not a piece of legislation or a benefit that is not going to be touching upon other benefits that already exist out there. And that's why, for all those reasons that I just talked about, what is being proposed here is framework legislation. Legislation to set up the framework in which this benefit will be established. This is monumental in terms of a national approach. We have never had a benefit like this before. It is long overdue. So many Canadians out there deserve it and, quite frankly, have been waiting a long time for it, but we need to continue to push forward and do this properly. What we know, Madam Speaker, is that more than 6 million Canadians over the age of 15, which represents over 20% of Canadians, currently identify with having a disability. That's what we know right now in Canada, that 6 million individuals. Only 59% of Canadians with disabilities, Madam Speaker, between the ages of 25 and 64 were employed in 2017, compared to 80% without disabilities. So we know, Madam Speaker, that those who have disabilities are quite often or the data would indicate that they are not employed from a percentage perspective as much as those without disabilities. And persons with disabilities who were working, this is really important, Madam Speaker, persons with disabilities who were working earn less than Canadians without disabilities, 12% less for those with milder disabilities, and 51% less for those with more severe disabilities. So these are the facts that we know of what the current situation is like when it comes to, we're not even talking about people who aren't working. We're just talking about people who are working and comparing people with disabilities with people without disabilities. And it is as a substantially lower amount that those with disabilities are making than those without disabilities. Madam Speaker, 850,000 Canadians, nearly 21% working-age Canadians with disabilities live in poverty. These are individuals who are living below the poverty line and quite often are struggling already as it is, in addition to the increased burden that's placed upon them by having their disability. So we know that this House has unanimously spoken in favor of bringing forward a disability legislation, Madam Speaker. We're finally seeing this here today. I know that all members of this House support it, and I really hope that we can see this move on so that we can get to the point where we can have a vote on this and we can see it come to fruition. Because there are certain things, Madam Speaker, that I believe that we should try to avoid to the best of our abilities in being political about. And this is probably one of the most important. Taking care of some of the most vulnerable people in our community. If there is no other reason that we assemble in this place, if there's no other reason that government exists, it's to help the most vulnerable people in our communities. And that's exactly what this piece of legislation is doing. It's recognizing the fact that, yes, disabilities are not just what decades ago people may have thought them to be, that they are expansive and include a lot more than those traditional ideas of what a disability was. They do include things like my Conservative colleague mentioned earlier, hearing impairment and a disability to communicate as a result of that. And it is so important that we as government, that we as parliamentarians make sure that we establish the supports necessary to take care of these people in their particular moments of need. So I really hope, Madam Speaker, that we can see this legislation pass through this House, that we can work together to ensure that the framework is moved along as quickly as possible. I would note that the legislation, this particular piece of legislation to establish the framework, requires that after the first 3 years of the disability benefit being in place, that it is reviewed by Parliament, and then again every 5 years after that. And that's unique, because most of the time that review period is a 5-year period. But the importance of this is, I think, is highlighted in the fact that the government insists that there be oversight on this to adjust and to balance and to reposition in the event that things need to be tweaked along the way. So I'll conclude with that, Madam Speaker. I really encourage all members in this House to vote in favor of this. I really hope that we can move quickly on this. I didn't take the full time allotted to me to speak to this, and I hope that others choose the same, and that others choose to indeed help to move this along very quickly so that we can vote on it and that we can put this into legislation and build that framework. Thank you, Madam Speaker.
Questions and comments? The Honourable Member for Central Okanagan, Similkin and Nicola.
Thank you, Madam Speaker, and I appreciate the speech from the member from Kingston and the Islands. And I also want to just reiterate there's a point of agreement we have. I would not trust my province I would believe all provinces would have the incentive here to simply claw back or even draw down of what they would usually give to someone who is in particularly dire needs, particularly persons with disabilities. But the issue here is that this bill should have really ideally have had first reading and been referred to a committee, because like in British Columbia, we are seeing more and more legislation that are coming out that gives absolute power to the minister and their department officials to do everything by regulation. And that's exactly what this bill does. As well attention as all members who have spoken on this. Essentially, it does not take leadership and say, this is the dollar amount that we believe that every Canadian citizen who has a person with disabilities, who cannot work for themselves, who is vulnerable, needs to be able to live. And essentially, by abdicating that role, essentially we are going to be giving the power to department officials and the minister. And a minister, you may agree with a member, but later on, I should say, Madam Speaker, but later on, another government comes in and the number changes. And none of us will have the ability to do anything other than squawk in the House. So does he not believe that this bill should have gone straight to committee? Does he believe that it should have had a number to show some leadership? And again, I thank him for his frankness around the provinces.
Honourable Parliamentary Secretary.
Thank you very much, Madam Speaker. Well, first of all, I'd say that I agree with him in terms of the incentive. It's human nature is not the right word, but certainly there's an incentive there for other levels of government to use the opportunity to claw back because they see another form of payment coming and use that money for something else. It's very basic. I mean, I think it's fair to say that would be something that would be very attractive to different levels of government. And so, yes, that's one of the first things we need to do is ensure that doesn't happen. You know, he also asked about the oversight on this and what it would look like down the road. Well, as I indicated towards the end of my speech, one of the things about this bill, which is unique, is that the first time that it has to be reviewed in terms of the oversight on it is 3 years after the legislation comes into force. That's unique because typically it's 5 years. So I would say that Parliament will have oversight on this. I would say that there are a lot of programs out there that he might also use that logic that he brought up. OAS, for example, he might consider, why the same thing isn't done there. But I'll leave it to him to come back to the House on that.
Questions et commentaires, l'honorable député de Beauport-Limoilou.
The honourable member for Beauport-Limoilou. Thank you, Madam Speaker. As my colleague already said, there's some lack of clarity around this bill, and the details are missing. Obviously, the federal government has indicated that they won't interfere with Quebec and provincial jurisdiction. That's appreciated. So when it comes to the various supports, support in the workplace for transit and so on, we want to make sure that all these other supports are not taken away for people who receive this new benefit. So there are some concerns that there may be cuts in other areas after this benefit comes into being. So what can my colleagues say to help reassure people with disabilities that this benefit will not end up penalizing them in other ways?
The concern, Madam Speaker, again, a similar concern to what we've heard from the Conservatives, which is that there's not enough information and details in the bill in terms of who's going to be eligible, how much they're going to get. These are the things that I talked about in my speech. I talked about this is why this is framework legislation. Those details need to come out after engaging in that consultation process to determine exactly what it should be. I mean, when it comes to spending money, we will still have a budget every year that will have to be approved. That money would presumably be inside that budget envelope in order to be approved by this House. But, her last comment specifically, Madam Speaker, with respect to how do we make sure that other jurisdictions don't end up clawing back, I think that's one of the most important things here. ODSP in Ontario, the Ontario Disability Support Program, on its own barely lets people get by. What I would hate to see is the Ontario government utilize the fact that there is this new federal program to claw back from the provincial side. That's why, but Ontario might be different than Quebec, and it might be different than other provinces and territories. That's why we need to make sure that whatever we do, we respect those jurisdictions, but ensure that this is going to be additional to what people are already receiving.
The honourable member for Victoria.
Thank you, Madam Speaker. I want to thank the member for his speech. I am concerned that there isn't enough information on how much people with disabilities will get and who will be eligible, but I'm also concerned that there isn't a clear timeline on when people will get this benefit. And the minister has stated publicly that it could be 3 years. People with disabilities need help now. Does the member think it's acceptable to wait 3 years?
Parliamentary Secretary.
I don't think that it's acceptable to make people wait any longer than is absolutely necessary. This is something that is long overdue, something that needs to come into effect as soon as possible. But I also want to ensure, Madam Speaker, that when it's done, it is done right. I want to make sure that the proper research is done so that when establishing amounts like she's asking, establishing criteria like we've heard from the Conservatives and the Bloc, when all of that is done in a way that respects the fact that we have multiple different jurisdictions that are already engaging in disability payments, and ensuring that we want to ensure that they don't claw back on those, and we want to make sure that people are receiving this benefit equally across the country. I appreciate the NDP's passion for this, but I feel as though there is a certain degree of trying to apply a certain degree of simplicity to what I see as a very complex equation and a complex problem to iron out to make sure that we get it right.
Member for Fredericton.
Thank you, Madam Speaker. I've been listening very intently to debate on this very important piece of legislation, and something that sticks out is the evolving concept of nothing about us without us, and it being simply for the disability community, nothing without us. So could the Honourable Parliamentary Secretary comment on how C-22 lives up to this mantra, and additionally just how important the leadership of the Minister of Employment, Workforce Development and Disability Inclusion has been to this House? Thank you.
Honourable Parliamentary Secretary.
Well, I really appreciate that, because that question goes back to the other 3 questions that I've been asked. The questions have all been about timing, about amount, about determining all this stuff in advance right now, but the whole nothing about us concept is all about ensuring that these decisions are made with the disability community, ensuring that when we talk about how much the payment will be, the criteria for receiving it, that it's not a top-down approach, that it is an approach that works with individuals with disabilities. So I personally believe that the new benefit needs to be done in consultation with persons with disabilities, Madam Speaker, and that's why I support this particular framework that we have in front of us.
The Honourable Member for Coast of Bay, Central Notre Dame.
Thank you, Madam Speaker. I enjoyed my colleague from across the way enjoyed his speech. I'd like to know what the member proposes to be part of this legislation, so that I heard him mention that they don't want us to have to claw it back. So I guess that's in a couple of years' time when we form government. We don't want to have to claw it back. So what measures are going to be put into this legislation to make sure that we don't have a similar situation that we had with CERB and other programs? And will it be efficiently administered, unlike what's happening with passports and Veterans Affairs issues right now?
Parliamentary Secretary.
There's nothing that I can do, Madam Speaker, to ensure that a potential future Conservative government doesn't claw back or eliminate this entire benefit altogether. As a matter of fact, I'm quite worried, Madam Speaker, that something like that might happen. When I was talking about clawbacks, Madam Speaker, I was talking about the provincial government clawing back, like the member from Skeena-Book, I forget the Conservative member that asked me earlier, like he asked me, he specifically said, and I apologize to my NDP colleague for that, he specifically said, it's almost human nature for provinces to want to claw back a little bit when they realize that money is coming from another area. That's what we want to ensure doesn't happen. That other provinces and territories who are also providing supports, that this is actually supplemental to that and not replacing it. Thank you, Madam Speaker.
Order. It is my duty pursuant to Standing Order 38 to inform the House that the questions to be raised tonight at the time of adjournment are as follows. The Honourable Member for Lanark, Frontenac, Kingston, Public Safety. The Honourable Member for Renfrew, Nipissing, Pembroke, Public Safety. And the Honourable Member for Mission, Matsqui, Fraser Canyon, Health. Reprise du débat. Resuming debate, the Honourable Member for Nanaimo Ladysmith.
Thank you, Madam Speaker. I'm happy to speak today on this very important Bill C-22 around establishing the Canada Disability Benefit. I want to acknowledge the work of my NDP colleague, MP for Port Moody, Coquitlam, and others for their perseverance and in bringing the voices of those living with disabilities, as well as the tremendous amount of work led by those living with disabilities and many allies to Parliament. It is clear we need this government to act now and implement this much overdue benefit. Constituents in my riding of Nanaimo Ladysmith with disabilities and allies are asking for their voices to finally be heard. I ask my colleagues to consider what their lives would look like if they were living with a disability and as a result were legislated into poverty. I think of Jocelyn, a constituent from my riding who I've spoken about before in this chamber, who is struggling to keep food on the table for her and her children as a result of living with a disability. Jocelyn is a single parent of 2 young children, holds an education, work experience, and a drive to contribute and give back to her community. Unfortunately, Jocelyn was in multiple accidents, leaving her unable to work and relying on the minimal disability income provided to make ends meet. Jocelyn described to me the challenges she experiences in covering just the basic costs of living. Jocelyn was very clear that all she was hoping for is the certainty that her children would have food on the table and a place to call home. Housing and food are certainly not luxuries for her and her children. These are basic human rights. In the 2015 election, the Liberals ran on a platform of delivering equitable opportunities for those living with disabilities. We had a glimmer of hope before the most recent election called by the Liberals, followed by inaction. This promise could have been delivered within the last 7 years of this Liberal government, so those desperately waiting have the basics they need. Yet, here we are, once again, with no action. Why are those living with disabilities being treated by this government as if their lives do not matter? Mr. Speaker, the impacts of this inaction, this complete disregard for fellow human lives, is evident across Canada. It is imperative that federal leadership is taken today to provide Canadians with disabilities the basic human rights they deserve. Instead, more and more Canadians are becoming homeless, relying on food banks, are getting sicker instead of better without access to the medications they need, and often left without the affordable and necessary adaptive equipment they need. A lack of federal leadership trickles down in many ways. People living with disabilities are being made to feel that their lives do not matter. I feel it important, Madam Speaker, to once again share the story of a constituent in my riding who described to me that he felt that he did not matter and that because of his disability, he felt his life was considered disposable and was being treated as such by this government. I know this constituent is not alone in his experience, hearing from more and more people living with disabilities that feel that they have little hope of things ever getting better for them and feeling frustrated by this government and needing action today. People living with disabilities continue to contribute to our communities in countless ways. I think of Anne, for example, another constituent in my riding of Nanaimo Ladysmith and also a friend who's living with disabilities. Anne was told by a job placement agency years ago that she should settle for sitting at home and watching daytime television. Despite this clearly misguided and uninformed recommendation, I met Anne when she returned to complete her post-secondary education at Vancouver Island University as a fellow student. With barriers removed for Anne's success, Anne thrived as a post-secondary student, graduated with distinction, continued on to finish her master's degree, and is now an author and a strong community advocate for those living with disabilities and their right to access barrier-free education, housing, and to participate fully in the community. Despite Anne's accomplishments, Anne continues to be bogged down by an unrealistic student loan with payments that are unrealistic within the minimal income that she receives. Madam Speaker, when we take a moment to step back, it becomes evident that ensuring that those with disabilities are at minimum living above the poverty line does not only benefit those living with disability like Anne and Jocelyn, it benefits Canadians as a whole. The symptoms of reacting to poverty costs us all. When people can't afford healthy, nutritious foods, we see increased costs to health care as just one example. The same applies when people can't afford the medications they need or a safe roof over their heads. We pay more as Canadians when we are reacting to the symptoms of poverty than if we prepare and respond proactively by providing the means for all to live with dignity and respect. If people have, at the very minimum, their basic needs met, including a place to call home, healthy food, enough money to pay their bills, everyone benefits. Those living with disabilities are not exempt. Poverty does not benefit anybody. Economists predict that poverty in Canada would be reduced by as much as 40% overall by eliminating disability poverty alone. Yet another resident in my riding, Kate, shared with me her experience living with disabilities, trying to make ends meet. In addition to living with Chiari malformation, a structural defect in the skull that causes part of the brain to push into the spinal canal, leading to symptoms such as severe headaches, numbness of the limbs, loss of muscle control, coordination issues, dizziness, and fainting, Kate suffers with early onset osteoarthritis, ADHD, anxiety, depression, and several food and environmental allergies. To make matters worse, she was also diagnosed with cancer. You would think that Kate has enough to deal with in her day-to-day. Instead, she has been legislated into poverty by this government because she's living with disabilities. Compounding Kate's serious health concerns, Kate has not eaten more than one single meal a day in nearly a year. One single meal. She skips breakfast and lunch so she can enjoy and afford one dinner a day. As a result, Kate has been prescribed by her doctor a list of supplements to counteract the malnutrition she is experiencing. Unfortunately, the supplements that Kate has been prescribed, she cannot purchase with the little funds she is forced to live off. With the increased cost of living, Kate's minimal income is stretched even thinner. Kate described adding a bag of frozen vegetables to her cart just recently, the same bag of vegetables she spent her few dollars on in the past, and crying with the realization that this same bag had increased in price from $4 to $5.29. How much more could Kate possibly cut back from only one meal a day? The reality Kate is facing, trying to make ends meet with a disability, are unfortunately all too common. Kate describes her experience of living in poverty, pointing out that poverty is relentless. It is a constant, nagging, oppressing force that never lets up. There is a saying that the true measure of any society can be found in how we treat its most vulnerable members. In a country as rich as ours, I am sad to say that this government gets a fail on how we treat those living with disabilities. Now, let me be clear. I have met some of the strongest people I know who are living with disabilities. The incredible strength I have seen exhibited despite being kicked down over and over again is formidable. People living with disabilities are contributing members of our communities with their own unique stories, talents, and skills. People living with disabilities have loved ones, hobbies, and goals they are working on just like all of us. Yet, because many are unable to contribute through financialized forms of labor, we treat those living with disabilities, as my constituent stated, as disposable. However, many people living with disabilities deserve what everyone deserves: basic human rights. Why must those living with disabilities have to fight so hard to be able to meet their most basic needs? The Liberal government has let Canadians living with disabilities down at a time when they need this government to step up most. Madam Speaker, thankfully there are ways we can move forward today to begin treating those with disabilities with the dignity and respect they deserve. With the support of my colleagues in this chamber today, we can move forward with a Canada Disability Benefit. If delivered with the best interest of those living with disabilities and in partnership with provinces and territories, those living with disabilities could once again have hope. To those of you who are expressing your concerns, who have been fighting for too long, I hear you and will promise you that I will do all I can to work alongside my NDP colleagues to push for this to be done in a timely manner and to finally start doing what is right. Thank you, Madam Speaker.
Questions and comments. Questions et commentaires. The Honourable Parliamentary Secretary to the Government House Leader.
Yes, thank you, Madam Speaker. I think what's significant here is that we are taking a historic step in terms of passing this legislation, recognizing how important it is that as a national government that we're there to support in a tangible way people with disabilities. In listening to the debate, whether it was the first day of debate or today's debate, there's obviously going to be issues in which the standing committee will deal with to see if there is in fact ways in which we can improve upon the legislation. My question to the member is with respect to that. Does the NDP have currently, is she aware of specific amendments that they're hoping to propose at the committee stage in hopes that this legislation passes soon, Madam Speaker?
For Nanaimo, Lady Smith.
Thank you, Madam Speaker. I sure do hope that this bill is supported by all members to be brought forward to committee to be worked on at that time. There is much work that needs to be done, and I have full faith that my colleague, NDP member from Port Moody Coquitlam, will be bringing forward some amendments to ensure that the information within this bill is specific enough and has the timelines within to have this bill implemented in a way that will benefit those living with disabilities and to put that money where it belongs in their pockets so they can afford to make ends meet.
The Honourable Member for Calgary-Shepherd. The Honourable Member for Calgary-Shepherd.
Thank you, Madam Speaker. So to the member, one of the things I've been asking members on the government benches, and I'm hoping that maybe she has thoughts on this too, is this legislation, there's not a lot of content to it right now. The Old Age Security Act actually is very, very similar when we're talking about providing a benefit to individuals at the very bottom of the income scales in order to support them. Old Age Security is meant for pensioners, those people who have retired or simply cannot work and happen to find themselves in struggling in very difficult situations, which is kind of what we're talking about here, helping those who are unable to work due to whatever disability that is that they have. The Old Age Security Act already has a lot of good content examples for things like criteria, cost of living adjustments to make sure that the benefit received is not impacted by inflation. I wonder if the member would agree with me that we should look at the Old Age Security Act at the committee stage to try and remove some of the ability of cabinet to simply set things by regulation, and that we parliamentarians can then set it into legislation so it becomes fixed. I think having it in legislation is a much better proposition for persons with disabilities. It gives them certainty. I wonder if the member agrees with that.
Honourable Member for Nanaimo, Lady Smith.
Thank you, Madam Speaker, and thank you to the member for his question. It's clear that there are far too many in our country, as wealthy as ours, that are living in poverty, and that definitely does include seniors, those living with disabilities. We have a high child poverty rate, and there's actions that we know can move us forward to start alleviating the poverty being experienced. And this national disability benefit is one such benefit that can be put into place today and actually start making a difference, a real difference in people's lives. And so to answer his question, everybody needs to be lifted out of poverty. Let's definitely look at some examples of what's been working well and get it to committee to start doing the work.
Questions et commentaires. Questions and comments. The Honourable Member for Kitchener Centre.
Thank you, Madam Speaker, and thank the member for Lady Smith for her strong support of C-22 alongside the rest of the NDP caucus. As she mentioned, there are a number of groups across the country who've called out concerns with respect to what's not in the bill. Today, most recently, the Accessibility for Ontarians with Disabilities Act Alliance has done the same. Can she share more about what she can be doing working alongside all parliamentarians in this place to ensure that strong amendments are brought forward at committee as soon as possible to strengthen the bill?
The Honourable Member for Nanaimo, Lady Smith.
Thank you, Madam Speaker, and thank you to the member for all of his work and advocacy around this bill and getting people with disabilities the support that they need and deserve. You know, it is vital that we are all getting all hands on deck and getting this work done today, and that includes having our federal Liberal government working alongside provinces and territories to ensure that this bill is, that this benefit is provided in such a way that those living with disabilities are receiving the benefits that they need and deserve, and to ensure that clawbacks are not happening is just one example. And so thank you for the question, and absolutely there are many amendments that still need to be done. This is not the bill that the NDP would have put forward, but it's a step in the right direction.
The Honourable Minister for Seniors on a point of order.
Madam Speaker, I
give notice that with respect to consideration of government business number 20, at the next sitting of the House, a Minister of the Crown shall move pursuant to Standing Order 57 that debate not be further adjourned. Thank you.
Resuming debate, the Honourable Member for Perth Wellington.
Thank you, Madam Speaker, and it is indeed a pleasure and a privilege to rise in this House this afternoon to join the debate at second reading on Bill C-22, the Canada Disability Benefit Act. I'm particularly pleased to participate in this debate based on many of the conversations I've had over the last few weeks with constituents in my riding of Perth Wellington. And I want to highlight one specific conversation I had last week. It happened at the local community food centre in my riding of Perth Wellington. Now, for those of you who may not know what the community food centre is, it's a wonderful institution. Here in my riding of Perth Wellington, it's called the Local. We just call it the Local. And I like to compare it to a kitchen. It obviously has a kitchen, but it's like a family kitchen, where when you enter, you're part of a family. And the people who greet you are always there with smiles. They're always there with a helping hand, and they're always there for a good conversation. So when I was invited to meet with community members to discuss issues affecting those living with disabilities, I was absolutely thrilled and honored to be able to participate in that conversation. And when I arrived last Friday, at the Local, there greeting me right away was Uncle Glenn with a big smile. Now, he's not officially my uncle, but I call him Uncle Glenn, Glenn Broadfoot, with a big smile. And I think I got a hug as well, which was wonderful. But they're greeting me with a smile. I was offered a cup of coffee by another community member, and we began an important conversation about what's needed for Canadians living with disabilities. And if there was one word that came out of that conversation, which I think encapsulates this piece of legislation and the hopes for this piece of legislation, is the word dignity. Dignity for Canadians living with disabilities. That conversation around that circle of chairs last Friday, the word dignity came up time and time again. One participant talked about how a haircut was considered a luxury. Another individual talked about how on the meager amount that she receives each month, she's not able to have a social life. She can't go even for a cup of coffee at the local coffee shop, at the local Tim Hortons, and have that interaction with the community. So when you hear stories like that, when you hear challenges like that, it becomes all the more important that we have this conversation today, of what we as Canadians and what we as parliamentarians want to see to support Canadians living with disabilities. Another participant in that conversation talked about how she worked a few hours a week, received a certain amount of money, but every time that she worked that hour, every time that she worked and brought home that paycheck, it was immediately clawed back from her monthly ODSP check. So while she was enjoyed and was able to do that opportunity, it was clawed back. So, Madam Speaker, when we come to discuss this piece of legislation, when we come to discuss what we want to see going forward with the Canada Disability Act, we want to encapsulate some of these concerns that have been expressed by people that I've met with, the people that all people in this House have met with. One of the challenges with a bill like C-22 is that it's the bare bones. It's the structure, it's the foundation, but it's not the actual meat on the bones. And that will come later through regulation. So I want to use the few moments that I have this afternoon to highlight some of the things that I think are necessary and what I think a lot of Canadians think are necessary to go into this piece of legislation. First thing is about clawbacks, and it has been mentioned a few times in this House about clawbacks, whether it's from provincial programs or other entities' work income. It is my hope that when the regulations for this piece of legislation are developed, that there are safeguards in place to ensure that when a dollar is earned through this benefit, a dollar isn't taken elsewhere, whether it's through a provincial program or through money that someone may have earned through workplace employment. Too often we see governments at one level give a dollar and governments at another level take a dollar away. So that's the first thing that I hope to see happen with this piece of legislation. And one thing that I want to highlight, and one opportunity I think is there, is that 2 parliaments ago, in the 42nd Parliament, this House debated a bill entitled the Opportunities for Workers with Disabilities Act. It was called Bill C-395 at the time, and this stood in the name of the now Leader of the Opposition, then the member for Carleton. But it was a bill that would have ensured that when an individual earned employment income, they were not negatively impacted in their other benefits, including and most specifically disabilities benefits. So one way that this bill, and I hope it will be considered at committee when we expect this to be taken up in the next few days, that they enshrine some of the principles from that bill to ensure that there's not that disadvantage. The other thing that I very much hope that we will see through this piece of legislation and when it's implemented through regulatory means is that it is done with a disabilities lens in mind. And what I mean from that is to ensure that this program is set up in such a way that is clear, understandable, and easy to use for anyone making applications to the program. We know that as Canadians, we file a lot of information with various government entities, whether it's the Canada Revenue Agency or Service Canada. They already have a lot of the information that would be needed to process this type of benefit. So it is my hope that when the regulations come into place, they're done so in a clear, efficient, and easy-to-use way so that Canadians living with disabilities from coast to coast to coast are able to access the benefits that ought to be provided through this benefit without additional means, additional barricades, additional blockages to prevent them from obtaining these important benefits. Madam Speaker, as I wrap up my comments about what my thoughts on this piece of legislation, I wanted to read a couple very short postcards that I received from constituents in my riding, which I think help to summarize the importance of a disabilities benefit and supporting Canadians living with disabilities. One constituent wrote me and said this: "We must take care of our most vulnerable. Only by lifting others up do we lift ourselves up." Another constituent wrote this. They wrote, "Such an important thing to look after and aid the people living with disabilities in our city and in our province and in our country. The challenges of poverty associated with disabilities is demoralizing. Please debate and pass this bill." Those are just 2 examples of constituents in my riding who have been pushing for this important benefit for a long time. Madam Speaker, as I wrap up my comments, I want to once again thank the many constituents who have contacted me on this piece of legislation, but specifically want to point out the good work that's being done by the folks at the local community food centre, working to bring all community members together in a safe, welcoming place which respects and promotes the dignity of persons living with disabilities. Thank you, Madam Speaker.
Questions and comments? The Honourable Parliamentary Secretary to the Minister of Health.
Thank you, Madam Speaker. I'm happy to chime in today on this very important bill, which is also, this debate is occurring on the day for the eradication of poverty, and I'm sure my honourable colleague is aware of this important day. I'm also really glad to hear that there's a community food centre in his riding. We are neighbours, in fact, so it's good to hear that the good work of the community food centres is doing so much good work in his community. And I echo his comments with respect to dignity and the right that every Canadian has to that dignity, ensuring that they can do normal things like go and get a haircut, pay their rent, and go to Tim Hortons for a coffee. Today is a day where the whole world is focused on the issue of poverty reduction. So I'd like to ask the member point blank. This is an important bill, one that I'm passionate about, one that I signed a letter with various members of this House to fast track. Will he be supporting the Canada Disability Benefit Act?
Honourable Member for Perth Wellington.
Thank you, Madam Speaker, and I thank the member from Milton for the question. I thought it was fairly clear in my comments that I will, in fact, be supporting Bill C-22, and I think it's been fairly clear from the Conservative Party that we will be unanimously supporting that piece of legislation. But I do want to take a few seconds just, again, focus on the importance of where we go from here with this piece of legislation. It will be going to committee and later with regulatory means, and we must ensure that this piece of legislation doesn't get bogged down in a regulatory process where bureaucrats are affecting the outcomes of people's lives. We need to make sure that we're in this for the right reasons and in it to support Canadians living with disabilities from coast to coast to coast. Thank you, Madam Speaker.
Questions et commentaires. Questions and comments. The honourable member for North Island Powell River.
Thank you, Madam Speaker, and I thank the member for his speech. And again, today is the day to eradicate poverty, so I'm glad we're talking about this and the realities that so many people living with disabilities face, and that as a collective, as a country, we have to take ownership that our inability to create accessible spaces has excluded people and left them in poverty. So I'm glad we're having that conversation, and I hope we continue to actually take the next step. So through you, Madam Speaker, to the member, I just want to ask, what I'm seeing again in this piece of legislation, although I will support it, although I appreciate the intention, what really matters to me is the impact. And what we see in this piece of legislation is nothing as concrete that is really going to make a successive difference. So I don't want to see this just passed and the action's not taken. I'm wondering if the member could reflect on that.
The honourable member for Perth Wellington.
Thank you, Madam Speaker, and I thank the member from North Island Powell River for her important question. And she's absolutely right. It's the impact. It's the impact that this piece of legislation or other pieces of legislation will have on Canadians living with disabilities. And there is the challenge that this isn't a concrete piece of legislation. This is the framework. This is the foundation. It doesn't actually intend what's going to come out of it. I know from personal experience, my mother-in-law lives with a disability. She uses a wheelchair. And I know how different programs in the past, particularly focused on accessibility, are done with good intentions, but then aren't always implemented in a way that is actually cognizant or reflective of what's needed by persons living with disabilities. So again, A for effort on this piece of legislation, but the real work's going to come down the road to ensure that there is a meaningful impact, that this piece of legislation doesn't claw back benefits that might be received elsewhere or make it more difficult for persons living with disabilities. Thank you, Madam Speaker.
Questions et commentaires. Questions and comments. The honourable member for Souris-Mousmet.
Thank you, Madam Speaker, and I appreciate that, and I thank my colleague for his great speech on and recognizing the many different types of disabilities that we have out there. And I was fortunate to be golfing with a young man who has cerebral palsy this past weekend, and he is disabled with his right hand and his left hand and his left foot. Ultimately, on the very last hole of our tournament that we were in, he was the last guy up to hit, and he hit his golf ball on the number 14 hole, the Esfand Golf Course, and we watched it sail. There was 8 of us watching it sail over the water, and it hit the green, and it rolled, and it rolled, and it rolled into the hole. And he got a hole-in-one, and it was spectacular. Now, the one thing about this, his nickname is Ace, and unfortunately, I hate to say this, but he's had 3 holes-in-one, Madam Speaker. But it was such a fantastic thing to see because 8 of us were all over him, cheering. What a great and fantastic thing. And when I chatted a little bit with him about the legislation during that golf tournament, one of his concerns were about there. And the reality is, when is it, what steps are there, and in particular about the regulations and what those regulations are saying. And that's a big challenge. And so I'm wondering if my colleague would make some comments on what he sees where these regulations are, because the reality is, at committee, hopefully those regulations will get some answers to them.
The honourable member for Perth Wellington, a very brief answer.
Thank you, Madam Speaker. I'll be as brief as possible. I thank the member for the question and congratulate Ace on his hole-in-one, something that I shall never in my life achieve. But he's absolutely right about the regulation. Going forward, we need to make sure the regulations are clear, direct, to the point, and don't have any unintended consequences that would negatively impact a person living with disabilities. Thank you, Madam Speaker.
Resuming debate, the honourable member from Mission Matsui Fraser Canyon.
Oh, thank you, Madam Speaker. And I'm so pleased tonight to be speaking on Bill C-22, an act to reduce poverty and to support the financial security of persons with disabilities by establishing the Canada Disability Benefit and making a consequential amendment to the Income Tax Act. Madam Speaker, when I was thinking about this bill on my flight last night to Ottawa, I would be remiss if I didn't mention Bethesda Christian Association. For the majority of my mother's life, Madam Speaker, my mom's volunteered with Bethesda, and subsequently as her child, I volunteered with Bethesda as well. My mom also worked for the organization for over 20 years. And working with Bethesda taught me a lot about humanity. And it taught my family a lot about compassion and humility and respecting the rights of every single person. I have had the privilege of knowing one woman, Darlene, who also went to the same church as me growing up, since I was born. And one of my favorite childhood photos is sitting at the family piano with Darlene. And to know Darlene today has brought richness to my life. Darlene lives with mental disabilities, but she lives life to the fullest. And she's taught me so much about just, even for an outgoing person like myself, to get out there and not be afraid to shake the hand of a stranger or say something in church at the appropriate time. She's just brought so much richness to my life. But I also know that women like Darlene have also have been challenged financially. Irrespective of government, we've actually seen a reduction in support staff and direct supports for women like Darlene living with disabilities. And that's not good. And as a conservative, Madam Speaker, one of the tenets I hold to is that the government has a responsibility to take care of people who can't take care of themselves. And many Canadians living with disabilities, especially some of those with mental challenges like Darlene, really do need the support from taxpayers to live her best and her full life. And as a country as rich in Canada, I don't think that's a hard threshold to make. So I am pleased to say that I'll be supporting this bill today for what I learned from Bethesda Christian Association growing up, Madam Speaker. And sorry, it's just a little hard to hear myself speak when the two speakers are having a little conversation there. Sorry to interrupt. I'll just let you get in your seat. Thank you.
Timer's still on.
So as I was saying, I'm going to be supporting this bill, Mr. Speaker, because we need to do more to support those living with disabilities. But when I was looking at Bill C-22, especially under the regulations section, Section 11 of the bill, it says a lot. I'll just give a couple examples here. Point A, respecting the eligibility criteria. Point B, respecting conditions that are to be met in order to receive or to continue to receive the benefit. Point C, respecting the amount of a benefit or the method for determining the amount. It goes on and on like this for about a page and a half of the bill. But it doesn't say some of the things that people are looking for. And that is, how much will they actually receive from the government under a Canada disability benefit? Secondly, what would a Canada disability benefit cost to the public coffers? And when will the disability benefit be costed? Another question upon reading the bill that I'm struck with is, what amount does the government plan to provide persons with disabilities through the Canada disability benefit? Thirdly, how does the government plan on coordinating the Canada disability benefit with other provincial benefits? Fifth, if this benefit is to operate in coordination with provincial benefits, how will the government ensure that there is no provincial disparity for those accessing the benefit in respect to the tax code? Another point, what will the eligibility be for the Canada disability benefit? Will it include those living with invisible disabilities? And how will that criteria be established? Will the Canada disability benefit be indexed to inflation? With the rising cost of inflation in this country, this is a big concern to many currently living with a disability. Another point, when should Canadians expect to start receiving the Canada disability benefit once the bill is passed? Currently, the bill has the coming into force to be determined by an order in council. Another point, since almost all information about the benefit is to be determined through regulation, will the government be open to increasing parliamentary oversight outlined in the bill? Another point, how will the government ensure that the Canada disability benefit should consider the complex web of programs currently in place, which for many Canadians with disabilities can result in benefit cuts and higher taxes as a consequence of taking on work? I think especially in the context of veterans living with disabilities, that's a very important point. Another point, how will the government ensure that applying the Canada disability benefit is inclusive and not a difficult bureaucratic process? How will we make this form simple to fill out? And how will we ensure that the Canadians who need this support will get it as quickly as possible? And finally, how will the Canada Disability Benefit be impacted if there are changes to provincial or territorial programs? So, Mr. Speaker, I will be supporting this bill, but there are a ton of fundamental questions that the framework needs to answer when this bill is hopefully passed by Parliament and brought before what I assume will be the HUMA committee. So with that, Mr. Speaker, I look forward to any questions, and thank you.
Questions and comments? Questions et commentaires. The honourable member for Milton.
Thank you, Mr. Speaker. It's nice to see you back in the chair, and I thank my honourable colleague and friend for the speech. And looking forward to doing some Netherlands friendship group whether or not he's interested. We've got some work to do, and he's my co-chair, so I'll be counting on his engagement there. Mr. Speaker, my friend talked about how it's important as a Conservative to stand up and help people who need it most, people who don't have access to certain services. And I'm just curious, I'm glad that he's so engaged in this bill, and I'm really thrilled to hear that he's supporting it. Does that category of people who need it most, include families with young kids who can't afford to get their teeth fixed?
The honourable member for Mission Matsky, Fraser Canyon.
Well, Mr. Speaker, I thank the honourable member from Milton for his question, but the debate today is on Bill C-22, not C-31. As I mentioned in my speech on Bill C-31, we have to look at the inflationary impacts of what we're doing. And as I outlined in the suite of questions I posed that I hope committee members in the government will be listening to, we need to do a full costing of this bill to see what impact it will have on Canadians and on Canadian taxpayers in the context of the inflationary period we are living within right now. Thank you, Mr. Speaker.
Questions and comments? Questions et commentaires. L'honorable député d'Abitibi-Témiscamingue.
The Honourable Member for Abitibi-Témiscamingue. Thank you, Mr. Speaker. Happy to see you back in your chair for these late debates. My question for the member is this. Does he think that the bill is well constructed? Is it writing a blank check to the government? Should there be more criteria, more transparency on the government's intentions, and maybe more relevant, should the money be sent directly to the provinces, because this is something that belongs in provincial jurisdiction?
Merci, Monsieur le Président.
Thank you, Mr. Speaker. I think at this time that this bill needs a lot of work. I hope that the Bloc will support this bill and that we can study it in a committee. That way we can find which amendments are needed to make sure that the bill will work in a context of provincial programs. Thank you, Mr. Speaker.
The honourable member for Victoria.
Thank you, Mr. Speaker. And today is the International Day for the Eradication of Poverty. And over 1 million Canadians right now are living in poverty. Having a disability benefit is so critically important, but this government has failed people with disabilities again and again and again. Now they're asking people with disabilities to wait 3 years, and they've presented a bill that doesn't actually tell us how much people will get or who will be included. Can the member speak to how vital it is that people with disabilities know how much they will be receiving, who is receiving this benefit, and when this benefit will come?
Honourable member for Mission Matsky, Fraser Canyon.
Well, thank you, Mr. Speaker. And to the points raised by the member from Victoria, I think those are essential. Going back to Darlene, whom I mentioned in my speech, Darlene going out for coffee at Tim Hortons or an ice cream and a burger at McDonald's, she has to tabulate that every single month. She lives dollar by dollar. And Bethesda Christian Association, who supports Darlene, lives dollar by dollar as well. So yes, getting that critical information, when the benefit will come into force, how much people with disabilities will be living on, is essential. And I hope that that information is brought forward by public servants at committee as soon as possible, because there's no point going down this legislative exercise if we don't have answers to those fundamental questions. Thank you, Mr. Speaker.
Questions and comments? Questions et commentaires. The honourable member for Peace River Westlock.
Well, thank you, Mr. Chair, and I want to thank my honourable colleague for his speech. My aunt was actually one of the residents of Bethesda, and so he may have run into her. She passed away a number of years back, but it was interesting to hear that in his speech. One of the big concerns I have, and I hear from the disabilities community, is just around access to MAID and approval to MAID. And over and over, we're hearing of people who are in distress, but not necessarily terminal, accessing MAID. I was just wondering if you could address that as well.
Member for Mission Matsky Fraser Canyon in 30 seconds or less. Please.
Well, thank you, Mr. Speaker, and thank you to my colleague from Alberta for the land of milk and honey, as he likes to say, for his question. Just last year, or this year, if I'm mistaken, a woman in my community received MAID because she couldn't find adequate housing. So what we need to do as a government, as a society collectively, is ensure that human dignity is respected. And we need to ensure that people living with disabilities have hope and have support. And I hope that this framework and with amendments at committee, we can get there, Mr. Speaker, and provide a new level of dignity and a new level of hope for those Canadians. Thank you, Mr. Speaker.
Resuming debate, le reprise de débat, the honourable member for St. Albert, Edmonton.
Thank you, Mr. Speaker. I rise to speak on Bill C-22, an act to establish the Canada Disability Benefit. In short, what this legislation seeks to do is provide an income supplement to Canadians with disabilities that complements provincial programs and supports. Unfortunately, in Canada, many persons living with disabilities are stigmatized and marginalized. Many live in poverty. Indeed, for those who are of working age and live with a disability, they are significantly more likely to live below the poverty line than those who do not live with a disability. Persons with disabilities deserve to be supported so that they can live healthy, happy, productive, and meaningful lives in which barriers are removed. And they deserve a helping hand to escape poverty. And in that spirit, I support this bill in principle. However, there is much that is unknown about this bill. We don't know who is eligible for the benefit. We don't know what amount one who is living with a disability will be entitled to receive. We don't know payment periods. We don't know how the benefit will be dealt with in terms of being indexed for inflation. We don't know what the application process looks like, and we don't even know when the benefit will take effect. Those are a lot of unknowns. And I have to say, after 7 years, and now more than a year since the government introduced a substantively similar bill on the eve of the Prime Minister calling an unnecessary and opportunistic election, that we have legislation that provides no further details. We have a minister who has been unable to shed any further light. All we have is a loose framework with all of the details to be determined at a later date, perhaps years down the road. And as a consequence, we as members of Parliament are in, I would submit, an untenable position in some respects of being asked to support a bill, the details of which are unknown in terms of the scope and impact of the Canada Disability Benefit. The Minister of Employment and Workforce Development stated in her speech quite appropriately that she is working with her provincial and territorial counterparts to ensure that this benefit does have its intended impact, that it is an income supplement, that there are not unintended consequences, including clawbacks and taxes, which would undermine the effectiveness of this benefit. Now, I have to say, Mr. Speaker, that while it is good that the minister is engaging in those discussions with her provincial and territorial counterparts, The issue of clawbacks for the disabilities community is a much broader one than simply in respect of this proposed new benefit. I certainly support providing an income supplement to low-income Canadians living with a disability. But we know that the best social program is not a new benefit. The best social program is employment for those who have the opportunity and ability to work. After all, employment provides an opportunity for dignity and self-work and provides a sense of purpose. It provides opportunities of social connectedness in contrast to the isolation that many persons living with disabilities face each and every day. Employment improves mental health and one's overall well-being. Not all Canadians living with disabilities are able to work, but many are, and many do. More, or nearly 1 million Canadians living with a disability are in the workforce, including 300,000 Canadians who are severely disabled. Many more would like to work, but for all practical purposes, they are unable to do so. They're unable to do so because when they go out and work and earn a little bit of income, their earnings are offset by the clawing back of programs and supports. We know that in some provinces, for every dollar earned, one can see a clawback of $1 or nearly $1 in social support. And so for many Canadians living with disabilities, there is in fact a disincentive to go back and be able to participate in the workforce. This is counterproductive, it's unfair, and it has the perverse effect of trapping Canadians living with disabilities in a cycle of poverty, something that this bill seeks to address. Now, as my colleague, the member for Perth Wellington, stated in his speech, my colleague, my friend, the leader of the official opposition, the member for Carleton, introduced a bill in the 42nd Parliament, Bill C-395, to address this unfairness. In short, what that bill sought to do was to ensure that any person living with a disability would never be disadvantaged, would never see more in clawbacks and taxes than what they would earn from an income from going out and working. Instead of supporting that bill, the Liberals voted against it. Now, one can debate the particulars of that particular bill, but it isn't just the member for Carleton that has raised this issue. In 2017, a unanimous report of the Standing Committee on Human Resources recommended, it was a key recommendation, that the federal government play a leadership role to ensure that Canadians with disabilities are not disincentivized from participating in the workforce. And so, Mr. Speaker, in conclusion, let me say that this bill is a step in the right direction. There are a lot of details that remain, and time is of the essence. But there's more work to do beyond this bill to remove barriers, most importantly, so that Canadians living with disabilities can enjoy the same opportunities that other Canadians enjoy to be able to go out into the workforce and earn a living and have that dignity and self-worth that comes with a job. That's how you reduce barriers. That's how you reduce stigmatization and marginalization, and that's how you lift Canadians living with disabilities out of the trap of poverty. Thank you, Mr. Speaker.
Questions and comments. Questions et commentaires. The honourable member for Saanich Gulf Islands.
Thank you, Mr. Speaker, and it's an honour to have a chance to rise and join in this debate. Thank my honourable colleague for his comments and those also of many other members. It's clear that C-22 is far less than what was expected. It doesn't provide the details, that so much is left to be filled in later, and yet the needs are clearly urgent. People living with disabilities in this country are disproportionately and scandalously exposed to poverty. I'll ask my honourable colleague, for people, I totally agree that having a job is a great way to build self-worth and respect, but would he not agree with me that no one with a disability should live in poverty, whether they can find a job or not?
Honourable member for St. Albert, Edmonton.
Well, thank you very much, Mr. Speaker, and I want to thank the member for Saanich Gulf Islands for that question. And I absolutely would concur with her that we have to do everything to ensure that Canadians living with disabilities are not trapped in poverty. And that's why we need to remove barriers so that Canadians living with disabilities can find employment, but we also have to provide other supports. This is one additional support, and it's one that I support, if it is ever rolled out the door, because it unfortunately could be some time between now and the time that the money is actually delivered to Canadians living with disabilities. It's frankly been too long.
Questions and comments. Questions et commentaires. L'honorable député de Shefford.
The honourable member for Shefford. Thank you, Mr. Speaker. I'd like to thank my colleague for his speech. This is International Day of Poverty, and we want to eradicate poverty. So disabled people on the labor market, they need help. We need to eliminate the barriers. There are too many people with disabilities who are in vulnerable positions, and this was confirmed to me by an organization in my riding in Granby. And so there has to be a whole lot of thinking about access, because without that, people with disabilities will be shut out of the workplace. The honourable member.
Well, thank you very much, Mr. Speaker, and I hear the question posed by the member for Shefford, and she raises an important issue about access and taking steps to reduce barriers to help those living with disabilities. And the member for Carleton provided a concrete measure in the way of his bill that would help persons with disabilities be able to have that opportunity to enter the workforce through 3 concrete measures within that bill, namely measurement, action, and enforcement. It was very disappointing that the Liberals voted against that very good bill.
And comments, the honourable member for Nunavut.
I'd like to thank the member for his intervention. I think that inevitably there will always be people with disabilities that can't be gainfully employed, and I hope that they're not going to be ineligible because of that. But I wanted to ask instead on Indigenous peoples or people who have disabilities that live in rural and remote communities, who live in communities that have a higher cost of living. And I wondered if the member agreed that maybe there needs to be supplement for people in this benefit for people that live in rural and remote communities.
The honourable member for St. Albert, Edmonton.
Well, thank you, Mr. Speaker. And what we've got to do to address the cost of living is to tackle inflation that is at a 40-year high. It's inflation that is the result of this government's out-of-control spending, propped up with the support of the NDP. If the member is serious about reducing the cost of living, making life more affordable, that would be a good place to start.
And comments, a 30-second question. The honourable member for Prince George, Peace River, Northern Rockies, and then followed. Answer, HoC.
Thank you, Mr. Speaker. And I'll just ask the member quite quickly. We're talking about the lack of benefits to people with disabilities and the poverty that's often the case and the reality for them, and the sad state where they're actually being given an option of using MAID as a solution, a terrible solution to the problem. Can the member just speak to that and maybe the reasons why we're really wanting to get behind our folks with disabilities in Canada?
Honourable Member for St. Albert, Edmonton, in 30 seconds or less,
Thank
please.
you very much, Mr. Speaker. And it speaks to the record of this government in not listening to persons with disabilities and disabilities rights organizations when they expressed alarm when the reasonably foreseeable criterion was struck down by one judge in one decision. And we have seen heartbreaking cases now of people who have turned to MAID because of such things as a lack of adequate housing, something completely not what MAID was set up to do. And when I asked the Prime Minister a question about that, instead of addressing the issue, instead of showing some compassion, instead he said, we're just wrapped up in ideology. I think it speaks to his attitude towards Canadians living with disabilities and how insensitive he is.
Resuming debate, reprise du débat. Seeing none, is the House ready for the question? The question is as follows. Ms. Qualtrough, seconded by Mr. O'Regan, moved that Bill C-22, an act to reduce poverty and to support the financial security of persons with disabilities by establishing the Canada Disability Benefit and making a consequential amendment to the Income Tax Act, be now read a second time and referred to the Standing Committee on Human Resources, Skills and Social Development and the Status of Persons with Disabilities. If a member of a recognized party in the House
wishes to request a recorded division or that the motion be adopted on division, I would invite them to rise and indicate it to the chair.
Et indiquer à la présidence. The honourable member for Kingston and the Islands.
Thank you, Mr. Speaker. I would request a recorded division.
Very good. Pursuant to conformément à l'ordre
Pursuant to order made on Thursday, June 23rd, 2022, the division stands deferred until Tuesday, October 18th, at the expiry of the time provided for oral questions.
Rising on a point of order? Or? Yes, the honourable member for Kingston and the Islands is rising on a point of order.
Mr. Speaker, I believe if you seek it, you'll find unanimous consent to boldly travel through time to 6:45 and see the clock as such.
Do we have unanimous consent? I believe we do. Order. In accordance with Standing Order 38, a motion to adjourn the House is deemed to have been made and seconded at this time. Therefore, the question is that this House do now adjourn. The honourable member for Lanark, Frontenac, Kingston.
Thank you, Mr. Speaker. Mr. Speaker, today's question relates to the number of lives that could be saved if the government would instruct the RCMP to install automated external defibrillators, also known as AEDs, in each cruiser. Now, I've been raising this issue since the Liberal government came to power in 2015, and the government, unfortunately, has taken no action. By my calculation, about 300 lives would be saved every year if AEDs were installed in Canada's 5,600 RCMP cruisers. Let me tell you how I've come to that calculation. The purpose of an AED is to reduce fatalities from the kind of heart attack known as sudden cardiac arrest, a pathology which typically starts with what is known as pulseless ventricular tachycardia and ventricular fibrillation. An academic paper published in the Annals of Emergency Medicine makes the following remarkable assertion regarding this pathology. Quote, every patient with a witnessed ventricular fibrillation cardiac arrest should survive. If the patient does not survive, the goal is to determine why, end quote. So in principle, AEDs, which are the device used to counter this kind of cardiac issue, should save a lot of lives. How much? Well, ventricular tachycardia and ventricular fibrillation are the source of 85% of all sudden cardiac arrest deaths. Among this population, if each cardiac crisis were witnessed and responded to instantly by a first responder equipped with an AED, there would in principle be a perfect survival rate. Now in practice, the survival rate is going to be lower, but when it's at its highest in controlled, highly monitored situations, such as airports and casinos, the rates are impressive. At O'Hare Airport in Chicago, for example, the save rate is 75%. But time is of the essence. According to the Heart and Stroke Foundation, for every minute that the application of an AED is delayed, the chance of survival drops by about 7 to 10%. After 12 minutes, the survival rate is under 5%. This is why the public policy response, both here and in the U.S., is focused so intensely on speeding up response times when a victim or bystander contacts 911. This is why police vehicles are equipped with AEDs in places like Vancouver, Kingston, Laval, Fredericton, Medicine Hat, and even Smiths Falls in my riding. There is an AED trunk, for example, in the trunk of every one of the over 150 cruisers of the Ottawa Police Service. As long ago as 2012, this resulted in 22 interventions and 9 successful saves of heart attack victims. In 2013, there were 23 interventions and 8 lives were saved, and so on in a long record of success right here in Ottawa. Ottawa's experience, which is typical, shows that on average, 1 life will be saved every year for every 17 installed AEDs in police cruisers. There is no better place to put an AED than in the trunk of a police car. Now, AEDs that are purchased in bulk cost a little over $1,000 each. Training costs are essentially zero, as RCMP personnel are already trained, and the cost of responding to 911 calls is not a factor, as the police already do this. So, multiply this success rate by the number of cruisers in the RCMP. If each one of the 5,600 RCMP cruisers carried an AED, this would result in 300 lives being saved every year, a little over 320. Since an AED remains operational for 10 years, we could save 3,000 lives over the next decade at a cost of $2,000 per life. With these considerations in mind, Mr. Speaker, why is it that the government has not, after 7 years in power, arranged to have AEDs in every police cruiser, every RCMP cruiser in the country? Thank you.
The Honourable Parliamentary Secretary to the Minister of Public Safety.
Thank you, Mr. Speaker. And I want to begin by thanking the Honourable Member for his advocacy, but also for his donation of AEDs to his local police service. According to Heart and Stroke, approximately 40,000 Canadians experience sudden cardiac arrest each year, of which 80% occur outside of a hospital setting. This is one of the reasons why all RCMP officers are required to be trained and recertified in CPR and first aid, including the use of AEDs. The RCMP is committed to our communities with CPR, AED, and first aid training, included in the standard first aid curriculum, in which all members are required to recertify every 3 years. This represents demonstrable enhancement of our public safety role as first responders. The RCMP is aware that some police services equip police vehicles with AEDs. Mr. Speaker, I was also present when we studied motion M124 at the Public Safety Committee, looking at the Honourable Member for Richmond Arthabaska's private member's bill on the issue. AEDs increase the chances of survival by 75%. At the time of our study, the Library of Parliament provided us with a 2014 report that the Public Safety Committee did on the economics of policing. Municipalities pay 60% of policing in Canada, and it makes up to 50% of their budgets. While I was doing some research on police forces in North America that have these devices in their car, it appears that many of them got them either through donations or grants, much like the Honourable Member across the aisle did with his police service. Currently, the RCMP provides contract policing services to all provinces and territories except Ontario and Quebec, as well as some 150 municipalities. These services are provided through the police services agreements, which see the cost for RCMP services shared by the provincial and municipal governments and the federal government. In consultation with the RCMP, provinces, territories, and municipalities establish the level of resources, budget, and policing priorities in their respective jurisdictions. It's through these consultations and decisions by the government of local jurisdiction that the RCMP has allocated funding for the purchase of new equipment. The financial impact of procuring AEDs for RCMP vehicles would also have to be completed in consultation with contract partners to determine the extent to which these devices could be deployed. Currently, AEDs have been approved for installation and used in select RCMP operational areas, including emergency medical response teams, some protective policing details, and in provinces where provincial policing standards require that AEDs be available. Another important consideration that came up during our study of M124 was that only 15% of Canadians live in communities that are serviced by the RCMP. Obviously, only equipping RCMP vehicles would help, but it wouldn't reach as many communities as we would like. In equipping RCMP vehicles with AEDs, several operational rollout and financial considerations must be assessed, including consultations with our contract partners. Thank you, Mr. Speaker.
The honourable member for Lanark Frontenac Kingston.
I thank my honourable colleague for that very informative answer. There's a number of pieces of information I was unfamiliar with. One thing I picked up, though, was her reference to what she calls contract partners, which really means the provincial and territorial governments. And it sounds like she is saying, I'm going to ask her whether she is saying the following, that if the initiative were taken, say, by the government of Alberta or Saskatchewan, that would be sufficient to start the ball rolling in that province. She also indicated a willingness to work with private sector partners who provide the necessary funds to purchase these things. May I assume that if that were to happen in some part of the country, and if the RCMP hierarchy were to resist, it does appear to me that there has been resistance institutionally in the RCMP, that the government would override and say, look, these things will be given for free, please install them where they're being offered. So those two questions, could you respond to those? Thank you.
Honourable Parliamentary Secretary.
Thank you, Mr. Speaker, and it's difficult for me to answer a question on RCMP operational details, but I think, as the honourable member knows, right now the Alberta government is talking about getting out of contract policing and instituting their own police service. But I think certainly the honourable member has heard what I'm saying, in that it requires consultation with the provincial or municipal partners before we can move forward. As he, I'm sure, knows, the cost of this policing is split between the federal and provincial governments. So I'm sure if the honourable member has a private company that wanted to donate AEDs to all RCMP vehicles, I'd be happy to work with him on that.
The honourable member for Renfrew, Nipissing, Pembroke.
Mr. Speaker, as a member of Parliament for Renfrew, Nipissing, Pembroke, I take this opportunity to thank my constituents for their care and encouragement. I couldn't do my job without their support. Thank you. On February 14th, 2022, the NDP Liberal Socialist Coalition issued a proclamation declaring a public order emergency. The anti-democratic bouncy castle emergency order has been recognized around the world as a despicable, egregious violation of human rights. Canada's image has been tarnished internationally. Canadians have been encouraging me to follow up on my request of the Prime Minister to stop his unacceptable campaign of hate, divisiveness against ordinary Canadians. Now that the Emergencies Act inquiry is underway, it's time to start focusing on the deep wounds in Canadian society created by the Prime Minister and his profane coalition. Liberals need to accept that many Canadians believe those who disagree with them on policy matters are not wrong. Canadians struggle to understand how those on the big government, radical left side of the political fence could possibly hold so many wrong-sided views. The trucker strike was brought about by widespread resentment of hysterical reporting throughout the pandemic by the Liberal bought-off media. The attempted cancellation of anyone who dissented over lockdowns, whether on scientific grounds or civil liberty grounds, further exacerbated the problem. I ask again, how can Canadians trust the Prime Minister or the Liberal Party when he and his caucus are on the public record as misleading Canadians 9 times on the need to invoke the Emergencies Act? For example, the NDP Liberal Coalition representative stated, and I quote, "The invocation of the Emergencies Act was only put forward after police officials told us they needed this special power." False. No police service asked for the Emergencies Act. Next, the NDP Liberal Coalition Minister of Finance got on in the act by grossly inflating estimates of the Freedom Convoy's impact on the economy. While Canadians are struggling to buy groceries and heat their homes, this same minister directed public servants to run around and waste taxpayer dollars by begging local Ottawa businesses to accept money for non-existent losses. In fact, after the severity of the Liberal pandemic lockdown, many businesses enjoyed a boom in business. The Prime Minister's and his coalition's false accusations are interpreted by the Convention on the Prevention of Punishment of the Crime of Genocide as accusation in the mirror. This rhetorical practice of falsely accusing others of conducting, plotting, or committing precisely the same transgressions as one plans to commit against them. The claim by the Prime Minister and senior members of the Liberal Party that members of the Freedom Convoy were racist, misogynist, and undesirables is a textbook example of demonizing and dehumanizing that comes by labeling certain groups in society as undesirable. An appalling example of this divisiveness was when the Prime Minister accused a granddaughter of the Holocaust survivors, my Conservative colleague, the member for Thornhill, who is Jewish, of standing with racists. Canadians see the hypocrisy in the Prime Minister accusing others of being racist when the Prime Minister enjoys dressing up in costumes and in blackface to make fun of other people's cultures and skin color. The accusation is a propaganda technique that's been used in non-genocidal and other forms of persecution committed against Jews, blacks, and First Nations, among others. It's time to face some inconvenient truths about the Prime Minister. His behavior is dividing our country. Being angry all the time is not demonstrating leadership. To this day, members of the Liberal Party refuse to condemn the Prime Minister's racist act of wearing blackface.
The Honourable Parliamentary Secretary to the Honourable Minister of Public Safety.
Well, Mr. Speaker, holy smokes, that rhetoric and misinformation that's coming from the other side of the House is a little bit hard to respond to, but I'm going to do my best. Last winter, Mr. Speaker, safety concerns from illegal blockades had shut down businesses, prevented citizens from moving about in several Canadian cities. Supply chains were cut off, hampering the ability of small business owners to contribute to the well-being of their families and communities. Mr. Speaker, through a large blockade in the city of Ottawa and other communities were also impacted. Alberta, Manitoba, British Columbia, Quebec, and cities within these provinces all faced illegal blockades that threatened people's safety and livelihoods. The situation was so critical that the Province of Ontario, City of Windsor, and City of Ottawa all declared states of emergency. The Government of Canada knew that a safe resolution to these illegal blockades would require the collaboration of all partners. That's why we engaged closely with law enforcement, provincial, territorial, and municipal officials to share situational updates and intelligence and explore ways we could support one another. These discussions were ongoing throughout the crisis. The decision to invoke the Emergencies Act was informed by these discussions and consultations. The ultimate goal was always to bring an end to the blockades peacefully. In full transparency, we've made public a document that provides the reasons for issuing the declaration of a public order emergency. This fulfills the requirement in subsection 58(1) of the Emergencies Act, and the Government of Canada is pleased to provide this public information. In addition, the Government of Canada has provided a public document describing the consultations we undertook before invoking the Act. This document clearly demonstrates that we were closely engaged with all key partners in order to bring all expertise to the table to solve this public order crisis. Mr. Speaker, I would encourage my colleagues to review these public documents. They would make clear that for several weeks last winter, illegal blockades were growing, strengthening, and threatening law and order in numerous communities. Provinces, territories, municipalities, and law enforcement all clearly communicated their views and concerns to the Government of Canada. And crucially, these partners asked the Government of Canada to lend support to the police of jurisdiction to counter the illegal activities. Mr. Speaker, we explored all other possible strategies to counter and to bring a peaceful conclusion the many illegal blockades in Canadian communities at the time. But it was at this time and following extensive and ongoing discussions that the decision to invoke the Emergencies Act was made. This was not an easy decision, and we took the path with an appropriate sense of gravitas. Importantly, invoking the Act provided law enforcement with the additional tools that allowed them to bring an end to the blockades. I must reinforce that this peaceful resolution was achieved in large part because of our close and ongoing consultation with provinces, territories, municipalities, and law enforcement. And the Government of Canada did not keep the Emergencies Act in place any longer than necessary. We revoked it as soon as possible once it had achieved its intended purpose and law enforcement no longer needed the additional tools. Thank you, Mr. Speaker.
The Honourable Member for Renfrew, Nipissing, Pembroke.
In a secret memo, the Canadian Security Intelligence Service, CSIS, rejected the false claims by the NDP Liberal Socialist Coalition that the Freedom Convoy was infiltrated by Nazis. According to CSIS, Freedom Convoy participants considered themselves, and I quote, patriotic Canadians standing up for their democratic rights. The Canadian flag was the most prevalent flag on display in the crowd, likely reflecting participants' belief that the patriotic Canadians standing up for their democratic rights, wrote CSIS. CSIS went on to advise this government that a small number of individuals displayed handwritten statements or images on their flags in an attempt to focus their message. Specifically, several added a swastika to the flag, not necessarily to identify as Nazis, but to imply the Prime Minister and the federal government are acting like Nazis by imposing public health mandates, unquote. The memo marked secret was dated February 2nd, 2022. It concluded by reminding the NDP Liberal far-left coalition that freedom of expression is constitutionally protected in Canada.
Honourable Parliamentary Secretary.
Thank you, Mr. Speaker. And let's take a step back and remember what it was like here in Ottawa last winter. And while the honourable member and many of her colleagues were playing footsies with the illegal blockade, many Canadians were suffering. Many Canadian businesses were suffering. They were being held hostage by these illegal blockades. People did not feel safe going about their lives in their own communities. I'm pleased to share with the honourable member a quote from the interim chief of police service who told members of the Public Safety Committee, the Ottawa Police Service, quote, I want to thank the federal government for invoking the Federal Emergencies Act. He went on to say, from a policing perspective, the legislation provided the Ottawa Police Service with the ability to prevent people from participating in this unlawful protest. He referred to the invocation of the Act as a critical piece of their efforts. Thank you, Mr. Speaker.
The Honourable Member for Mission Matsqui, Fraser Canyon.
Thank you, Mr. Speaker. In May, I asked the Minister of Health what scientific advice he had received in regard to travel mandates, and today I'm asking the same question. On September 26th, the Minister of Health, Public Safety and Transport announced the lifting of the pandemic precautions effective October 1st by allowing the special orders under the Quarantine Act to expire. This effectively meant that foreign nationals no longer needed to be vaccinated to enter the country. Incoming travelers wouldn't be subject to random mandatory COVID-19 tests. Unvaccinated Canadians would no longer have to isolate. Travelers would no longer have to report or monitor for COVID-19 symptoms. Face masks wearing on planes and trains were no longer mandatory as well. And submitting public health information through the ArriveCan app would effectively become optional. While Conservatives had been appealing to this government for a long time to lift the mandates, and we're happy to see them gone, my question remains, what was scientific about October 1st? What evidence was this decision based on? And why was Canada so slow to lift the mandates compared to other countries? The second issue I'd like to raise tonight, Mr. Speaker, relates to the ArriveCan app. Like a lot of Canadians this summer, I use the ArriveCan app. I went to visit some family in the Netherlands, and when I came back home, I was on a flight through Iceland, and I had to do the ArriveCan app, and I did it properly to get on the plane, and I did it for my spouse as well. And when we arrived in Toronto, the app had broken down, and I went to the CBSA officer, and he says, "Oh, that's a normal thing to happen." In fact, it's been happening quite a bit. It wasn't an easy process, but we went through it, and it all got worked out. But that goes to say, as some other members in this House of Commons have raised today, why the ArriveCan app was so poorly designed and why it costs so much money. Right now, Canadians are recovering from the COVID-19 pandemic and government restrictions. Community groups are starting to refocus and get membership out again. Sport groups are doing the same thing, and that's all well and good. But I would be remiss if I didn't mention in this chamber, Mr. Speaker, that right now Canada needs to look back very closely about what happened during the last 3 years. And my second question to the government today is, would they consider a royal commission to determine how much money was spent on COVID-19 programs, additional money that was spent during the COVID-19 pandemic, what consequences of that spending took place, and what are the long-term impacts both for our society and for our fiscal coffers. We're in a period of inflation right now, Mr. Speaker, and we need to be very careful about how we spend money moving forward. But Canadians are equally concerned about how their rights are going to be protected moving forward as well. And I think we have a responsibility in this House, Mr. Speaker, to ensure that that critical work is being undertaken. So I'd like to petition the government with my time today to empower every parliamentary committee, if not a royal commission, to look at program spending over the last 3 years. Empower them to look at which programs worked, which ones didn't, which ones cost the most, which ones had the most take-up, and which ones didn't have any take-up at all. A lot of things were spent on, and we don't know the consequences of that spending and the impacts. And secondly, we need to look at about how Canadian rights under the Charter are going to be protected moving forward. There are a lot of unanswered questions. I know there's some cases before the federal courts, but I think here in Parliament we need to look very closely at things like the ArriveCan app. And I'll give one final example. Just 3 weeks ago, before the October 1st rescindment of the Quarantine Act, I had a senior citizen. He's never had a smartphone. And the CBSA officer told this man that he needed to get a letter from his MP to go into the United States for the day and come back. That is not what the Charter calls for, and we need to stop those things from happening again. Thank you, Mr. Speaker.
The Honourable Parliamentary Secretary for the Minister of Public Safety.
Well, thank you, Mr. Speaker. And my understanding of this was that honourable members would ask for information to elaborate on a question they had asked in the House. The honourable member has greatly expanded what he had asked. I'll focus on a couple of things, but in particular he had asked about Nexus. He didn't mention that tonight, but I will deal with that. The ArriveCan app is something that we brought in to keep Canadians safe. We will always put the health and safety of Canadians as our #1 priority. I recall at the time, honourable members from the other side of the aisle calling for us to close the borders, stop letting people into Canada. The ArriveCan app was a useful tool that we brought in during the pandemic, and it is no longer mandatory, as the honourable member knows. I would like to talk a little bit about Nexus, which is what the honourable member had asked in his question of Minister Duclos. And we know Nexus is extremely important for travelers. We know that Canadians are traveling again. And that's why we're working with U.S. Customs and Border Protection to restore Nexus enrollment services in Canada. I hear from my own constituents with concerns about being able to get a Nexus appointment. It's a joint program managed by both Canada and the United States. When our American counterparts are ready to deploy officers to Canada again, we'll be ready to immediately facilitate it. Canada and the U.S. are in discussions right now about the timing of the reopening of Canadian enrollment centres. However, until that time, enrollment centres in Canada will continue to be closed. Mr. Speaker, Canadians can now travel to the U.S. to complete their interviews and applications, and we are also allowing existing Nexus members who renew their memberships before the expiry date of their card. They will retain their membership privileges for an additional 24 months from the date of expiry. Mr. Speaker, the honourable member talked at length about our Charter of Rights, and I just want to assure the honourable member, as well as all Canadians, that on this side of the House we will always stand up for Canadians' charter rights. We always have, and we always will. Thank you, Mr. Speaker.
The Honourable Member for Mission Matsky, Fraser Canyon.
Well, thank you, Mr. Speaker, and I have no doubt that every member in this, all 338 of us, don't care about the Charter of Rights and its application. What I'm saying here today is that we have made so many consequential decisions, even on this side of the House, and we have not properly examined the impact, both in terms of our rights, the societal impact, and the fiscal impact it's going to have on future generations in Canada. I don't recall actually referencing Nexus in my question to the minister, but I will take that in good faith from the member, and I would simply ask then, as my primary question in the minute I have today, is one of the reasons why the American government hasn't decided to reconstitute offices in Canada is related to the application of firearms for American officers on Canadian soil. Thank you, Mr. Speaker.
The Honourable Parliamentary Secretary.
Well, thank you, Mr. Speaker. And I will say to the honourable member that I know that the Minister of Public Safety and his U.S. counterpart have been in discussions to get Nexus back in Canada. And I'll reiterate, when the American counterparts are ready to deploy their officers again to Canada, we'll be ready to facilitate it. Canadians want to get back to their lives and put the pandemic behind them, and I will assure the honourable member that we continue to work with the United States to ensure that that the officials can, the American counterparts can deploy their officers in Canada again. Thank you, Mr. Speaker.
It being 6:20, the House stands adjourned until tomorrow at 10 a.m. pursuant to Standing Order 24-1.